गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः। तस्मै श्री गुरवे नमः। तस्मै श्री गुरवे नमः। गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे तस्मै श्री गुरवे नमः। तस्मै श्री गुरवे नमः।
Good evening, everyone. On behalf of Ayurveda, I welcome our respected faculties and dear participants to this Prithvika national level paper and poster presentation. Dear participants, before going to start, let me remind you your time limit. Your maximum time limit for the presentation is 8 minutes. Kindly do follow your time. And please don't unmute yourself unnecessarily. Before get much delay, we can start the session. And before that, I wish all the very best to our curious participants. So first, we can start with paper presentation, and I invite Dr. Kanjan Ashok Choudhary for that. I invite Dr. Kanjan Ashok Choudhary.
Before that, good evening, everyone. Next, I would like to invite Dr. Swapnaja for the paper presentation. Dr. Swapnaja?
Yes, sir.
Okay, doctor.
Yes, sir. I will share my screen.
Okay, doctor. Please share the screen.
So can I?
Your screen is visible, doctor. Please start the session.
Good evening, everyone. I'm Dr. Swapnaja Changundi, third year PG scholar from Dr. D.Y. Patil Ayurvedic Medical College. And my today's topic is efficacy of Rason taila, uttarbasti in management of vandhyatva. Introduction. About 10 to 15% of couples are infertile in India. In that, female infertility is about 40 to 50%, and male factor is about 40%. Due to suppression of Vayu, there is dosha dushti. By use of uttarbasti, the yoni remains the girl quickly, or the woman conceives immediately. Inflammatory conditions can be correlated with two vitiation of pitta. Also, dysfunction can be correlated with vitiated vata, that is also inability of occurrence, that is daurbalya, can be correlated to kleshma. Any abnormality in this process can cause functional disturbance, which leads to infertility. Aims and objectives to study the efficacy of Rason taila in the management of vandhyatva. Also to study the etiology of the vandhyatva materials. Uh, we take a 30 years female complaining of primary infertility. So she is married since 3 years, and she is having no any issues, no any history of abortion. USG reports are also normal. She get her menarche at the age of 12 years. Also, her menses are regular. The sperm count of male is normal. Also, the routine blood investigations are also the normal. But before going for the uttarbasti, before 15 days, we give mrudu virechan to the patient, as she has vata vruddhi. So mrudu virechan was given to the patient. In the for the purva karma, or for the uttarbasti, 32 padasnehan with til is done for the 15 minutes. After that, nadi speth for 10 minutes. Vaginal dodge is done with 500 ml of panchavalkal kwatha with all aseptic precautions. Then patient was transferred in OT after vaginal dodge. After examination of BP and pulse, the patient was given lithotomy position and covered with towel. After that, the patient is painted with panchavalkal kwath. Routine examinations were performed to confirm the size and position of the cervix. Then after that, exposure of vaginal canal is done by the use of sim speculum and anterior vaginal wall retractor. The anterior lip of cervix was held with valsellum or the Alice forceps. The external os and fornices are swabbed with antiseptic solution, and the length and position of the uterus was assessed by inserting uterine sound. After this, the os was dilated with the lubricated Hagar's dilators enough to admit the uterine cannula easily. Then the uterine cannula, about 2 centimeter in length, with one end curved so as to go in the direction of uterus, was pushed up to the external os and not to the internal os, and then tail was injected with the syringe from the other side of cannula. At the time of injecting medicine into uterus or into cervix, the patient was kept in head low position. After a consequent menstruation at the day 7th, uttarbasti given to the patient for regular 5 days. This process of uttarbasti was carried about 3 months regularly. After giving the uttarbasti, the patient was observed for 1 hour, and then the sterilized pad was introduced to the vagina. The valsellum, speculum, and uterine cannula brought back. The patient was kept in head low position. The patient was advised to put her right leg crossed on the left leg in her dorsal position. The patient was strictly advised to follow patya and take rest during the treatment. Observation and result. Uttarbasti was given continuously for 5 days for 3 months, then taken a gap for 1 month. At that time, patient was taking Falagruta 15 ml BD. Again, if next menstruation started, uttarbasti consequently for 2 months. After the second uttarbasti, menses not come to the patient, then UPT, we bring the UPT test, which is positive. Also beta HCG test carried out, which also came positive. After the 15 days, USG carried out, which shows the single fetal pole. Then discussion. Female plays a lead role in Garbha formation, thus keeping the female health in mind. Uttarbasti plays an important role. Rason tail is Vata Pitta Shamak Jivaniyam and Rasayan. It also has Dipan, Pachan, Anulomban, Shotahar, Krimigna properties. Phalagrit contains mainly Tikta Madhur, Katu Rasam, Lagu Snigdha Gunam, both Katu, Madhur Vipaka, and Shitavirya. Conclusion: Uttarbasti of Rasona Taila shows result in the management of infertility. Uttarbasti with Rasam Tail is effective in increasing fertility, and it may help in management of Sri Vandhyatva. As one of the Samprapti was Vata Vruddhi, so Mrudu Viration was given, followed by Uttarbasti. There is no any side effects and complications were observed in this patient. So these are the references. Thank you.
Thank you, doctor.
Thank you.
Thank you for the wonderful presentation. I think you have
Thank you,
one more poster presentation is there, right, doctor?
Okay.
Please continue with
Hello.
your poster presentation, doctor.
Okay, sir. I will. Sir, can you share the poster, please?
Okay, doctor, just a moment. I will share for you, doctor. Doctor, please start the session.
Um, as we all knew, the maintaining good nutrition and healthy diet during pregnancy is so much important for the mother and also for the health of mother and also for the unborn child. So, in Ayurveda, monthly regimen for pregnant woman was explained by different acharyas. So today we will see the monthly regimen by the Acharya Charaka. So in first month, that is Pratham Masa. So in first month, that is Pratham Masa, Acharya Charak. Acharya Charak advised to take a non-medicated milk should in evening and in morning and in evening according with Satmya Bhojana in desired quantity. Also in Dvitiya Masa, he advised to take a milk medicated with madhu drugs. In Tritiya Masa, the milk with madhu and ghritam should be taken, but madhu and ghrit in unequal quantity. In Chaturth Mas, butter extracted from milk or milk with butter should be taken. In Pancham Masa, ghrit prepared with butter which is extracted from milk should be taken. In Saptam Mas and in sixth month and in seventh month, Grit medicated with the drugs of Madhurgan should be taken. In eighth month, the rice yabagu prepared with milk and mixed with grit should be taken. In 9 month, Acharya Charaka advised the Anuvasan Basti with oil prepared with Madhurgan drugs, followed by the Yoni Pichu, should be given to the patient for the um, sir, so in 9 month, Anuvasan Basti should be given to the patient. Thank you.
Thank you, doctor. Thank you for the wonderful presentation.
Thank you, sir.
Next, I would like to invite Dr. Kiran Dhanraj Malbhage for the paper presentation. It is a case presentation.
you. Myself, Dr. Kiran Dhanraj Malbagi, PG Scholar Rashastra and Bhaishajya Kalpana at Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Um, my guide is Dr. Ashwin Shetty, Assistant Professor, Department of Rashastra and Bhaishajya Kalpana, Dr. D.Y. Patil College of Ayurveda and Research Center, Pune. My HOD's name is Dr. Nilima Dharkar, Department of Rashastra and Bhaishajya Kalpana at Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today I am going to present a case study which is titled as a case study on Ayurvedic management of Pitta Prameha, type 2 diabetes mellitus. Abstract is diabetes mellitus is a global health concern and there is currently limited published literature available on effectiveness of Ayurveda intervention on this condition. This report describes a case of successful reversal of diabetes mellitus in a patient with a high HbA1c percentage of 8.64%. The patient displayed classical diabetes symptoms and was diagnosed with Pitta Prameha. Treatment was provided using classical Ayurvedic intervention. The patient responded positively to the treatment with her HbA1c dropping to 6.9% within 8 months. This case report demonstrates the efficacy of Ayurvedic intervention in treating diabetes mellitus. Diabetic disorders can arise from an imbalance in the Pitta dosha. Parts that maintain equilibrium between Pitta and Kapha helps to control inflammation and body's metabolism. Introduction. Diabetes is a major growing health challenge in India, affecting an estimated 8.7% of the population between the ages of 20 and 70. Diabetes mellitus is a serious health condition that affects the body's ability to use insulin properly. This can result in high levels of sugar in blood and can lead to various health complications. In India, the number of people with diabetes increased from 26 million to 65 million in a span of 26 years from 1990 to 2016, which makes India a major contributor to the global burden of diabetes. This medical issue causes a buildup of glucose in the patient's blood and urine. Hyperglycemia is the term for this condition. The terms diabetes, which is in Greek, which means siphon through, and mellitus in Latin, sweetened with honey, are the sources of the word diabetes. According to Ayurvedic texts, prameha is caused by an imbalance in the doshas. That is bioenergetic forces, primarily kapha and pitta doshas. In Ayurveda, Pitta Prameha refers to a type of urinary disorder primarily caused by an aggravation of the Pitta dosha. Patient's information. On 25th of April in 2023, a 54-year-old married non-smoking, non-alcoholic female patient had complaints of severe tiredness since the last 3 to 4 months. She had gradual loss of weight of approximately 6 kgs without any apparent reason. She also complained of increased frequency of burning micturition, excessive sweating with body odor, that is Svedo Angagandhata, increased thirst, that is Pipasa, increased hunger, that is Kshuddha Vruddhi. She was suffering from increased frequency of yellow colored urine, that is Pita Mutrata. She also complained of excessive thirst, that is Pipasa, dryness of mouth, throat and palate, which we call in Ayurveda as Shosha. Sore taste in mouth, that is Amlasyata, burning sensation of hands and feet, which we can call as Hastapada Taladaha, and night sweats. She said her sleep has been disturbed due to the frequent episodes of micturition at night. The patient was average built, with weak physique, with strong maternal and paternal history since 12 years of diabetes mellitus. Appetite and bowel movements were increased. She had no other known diseases and was not under any medications. There was no history of any interventions for the presenting complaints. Clinical findings. Clinical findings are: the clinical examination revealed a blood pressure of 1/10 by 70 mm of Hg with pulse rate of 74 beats per minute. The patient weighed 39 kg and her height was 147.32 cm. On palpation, her abdomen was soft and tenderness at lower pelvic area. Her tongue was coated. Her cardiovascular and breathing rate was normal. The patient had a Pitta Kapha Prakriti with an above average Samhanan, that is body build, and Praman, which is we call as body proportion. She had white hair with medium density, normal appetite, and deep sleep at 6 months ago. Timeline. In the present case, treatment had been continued for 8 months starting from 25th of April in 2023 to 15th of December in 2023. Case study Prameya Pittach Prameya. Case study Prameya Pittach Prameya Pradhananda. Patient came with chief complaints of increased frequency, micturition, bahumutrata, increased thirst, vipasa, fatigue, glani, weight loss, that is karsh, increased sweating with body odor, svedanga gandha, increased appetite, that is kshuddha vruddhi, and burning hands and feet, hasta pada taladha, since 6 months. Vedana Vrittant. A 54-year-old female patient complains of with increased frequency of micturition 6 to 7 times in a day and 4 to 5 times in night, increased thirst, fatigue, weight loss of 6 kg in 3 months, Svedu Angagandha, Kshuddha Vruddhi, Jvarangata, burning hands and feet since 6 months. Uruvedna Vrittant, no any history of major illness. Kula Vyadhi Vrittant, mother and father were said to be diabetic. Vayaktik Vrittant, table number 1 to 3 are showing the timeline of Nidan, subjective and objective criteria. Table number 1 showing Nidan, Ahar, Vihar and Mansik. In Ahara, the Nidanas are she is vegetarian, fermented food, she eats fermented food, madhurs and snigdha, katu, tikshna, ushna food and irregular meal time. In Vihara, disturbed sleep, sedentary lifestyle, bowel 2 times per day, micturition 6 to 7 times in a day and 4 to 5 times in night. In Mansik, Nidana, Chinta and Atikrodha. Samanya Pariksha. Appearance is fair. Pulse rate is 74 per minute. BP 110 by 70 mmHg. Respiratory rate 18 per minute. Weight 39 kg. Height 147.32. Temperature is 100 degree Fahrenheit. And respiratory system, bilateral air entry clear. Cardiovascular system S1 S2 are normal. In CNS system conscious and oriented. रोगी परीक्षा प्रकृति पित्त प्रधान कफ सारहीन सत्वहीन संहननहीन कोष्ठ मृदु अग्नि तीक्ष्ण प्रमाणहीन आहार शक्ती उत्तम जरण शक्ती उत्तम व्यायाम शक्तीहीन वय मध्यम जिह्वा साम. अष्टविध परीक्षा नाडी पित्तवात मूत्र पित्त उष्ण मल साम जिह्वा साम शब्द स्पष्ट स्पर्श उष्ण दृक् प्राकृत and आकृती is मध्यम. Table number 2 showing symptoms before and after treatment. This is the subjective criteria. Symptoms, here are symptoms before and after treatment. Symptoms: frequent micturition. Before treatment it was 6 to 7 times in a day and 4 to 5 times in night, and after treatment it was 3 to 4 times in a day and 1 to 2 times in night. The symptom was excessive thirst. Excessive thirst was present before treatment and get reduced after treatment. Increased appetite, which is present before treatment and then reduced after treatment. Increased sweating with body odor, which was present before treatment and reduced after treatment. Increased body temperature was present before treatment and reduced after treatment. Burning hands and feet present and then reduced. Weight loss, 6 kg weight loss before treatment, and after treatment she gained a 5 kg of weight. Table number 3 showing investigations before and after treatment. Objective criteria. Investigation before treatment on the 25th of April in 2023. The HbA1c was 8.64%, and after treatment on the date of 15th of December in 2023 it was 6.95%. Diagnosis after seeing the patient's symptoms. The diagnosis was Pittach Prameha. Treatment: internal medicines, Patol, Patra, Nimbatvak, Amalki and Amruta. The cause of these contents with the dose of 15 ml and before food twice a day. Vasant Kusmakar Ras, combination of Vasanta Kusmakar Ras, Trivanga Bhasma and Giloy Sattva, which is taken by twice a day after food. Chandra Prabhavati, which should take twice a day and 2 in number. Madhvasav, which have to take 15 ml with lukewarm water daily after food. Result: healthy diet and exercise were advised with internal Ayurveda medicines. Before taking Ayurveda medicines, patient was undiagnosed with diabetes mellitus, increased blood sugar level, and was taking antibiotics and multivitamins to treat fever and weakness. Discussion and conclusion. Pitta's prameya refers to condition in Ayurveda related to diabetes mellitus, specifically the type caused by the imbalance of the pitta dosha in the body. In Ayurveda, prameya is a broad term for urinary disorders including diabetes. According to Ayurvedic principles, pitta dosha governs metabolism and digestion. So an imbalance in pitta can lead to conditions like diabetes where metabolism and blood sugar regulation are disrupted. In Ayurveda, managing pitta's prameya involves balancing the pitta dosha through dietary and lifestyle changes, herbal remedies, and practices like yoga and meditation. Dietary recommendations typically involve consuming foods that pacify pitta, such as sweet, bitter, and astringent tastes, which while avoiding spicy, sour, and salty foods that can aggravate pitta. Long-term elevated blood glucose level must have been the source of burning neuropathy. Alcoholics and people with a vitamin B12 deficiency also frequently have it. This patient in particular was not an alcoholic. Her vitamin B12 level were not assessed since the intervention addressed the issue, supporting the likely diagnosis of burning neuropathy. One way to think burning neuropathy is as Daha. It's regarded as one of the varieties of Pitta Roga. As a result, Tikta and Kashayarus medications were chosen. Cloth made from Patoladi Dravyas is one such remedy. The formulation known as Chandraprabhavati, taken from the Bhaishyaja Ratnavali book, is known to bring balance back to the three doshas. Balya, Vrishya, and Rasayana are other special aids in Prameya. Vasanta Kusumakar Rasa is described by Yoga Ratnakar in Prameya Chikitsa that it is strong anti-diabetic medication which may work as a result of synergistic effects of all the drugs constituents because it contains Praval Pishti Rasa Sindhu Mukta Pishti Abrak Basma Swarna Basma Rajat Basma Lohu Basma Nag Basma Vanga Basma Vasa Haldi Ikshu Kadali Kamal Chameli Shatavari and Chandan. It calms the three doshas or Vata Pitta Kapha. Lead, zinc and tin are the main ingredients of the Ayurvedic
Hello, doctor.
Srivanga Basma. It is also a strong antidiabetic
Hello,
as
doctor.
evidenced by several research studies and references in classical literature. Once more, Guduchi is an
Hello, doctor.
antidiabetic or hypoglycemic medication. Thus, Vasanta Kusumakar Rasa, Trivang Basma and Giloy Sattva together successfully lowered blood sugar levels. Madhvasav is indeed a formulation prescribed in the Ashtanga Hridaya, an ancient Ayurvedic text. In the context of treating prameha, it contains ingredients that possess all the pramehagna properties useful in managing the condition. Diabetic disorders can arise from an imbalance in pitta dosha. Parts that maintain equilibrium between pitta and kapha help to control inflammation and body's metabolism. The idea behind such formulation is to provide the patient with a low glycemic, high nutrient supply. According to this study, prameha can successfully managed with pramehagna medicines or rigorous diet and frequent exercise. Before starting Pitta's prameha medicine, the patient was taking allopathic medications to address her symptoms, but she was not getting better. After 8 months, the patient's blood sugar was under good control. These are the references.
Thank you, Dr. Kiran Dandraj Malbage, for the well-explained presentation. Next, I would like to invite Dr. Akshay Gajanan Narode for the paper presentation. Dr. Akshay, are you there?
Yes, sir.
Hello, doctor. Good evening.
Good evening, sir.
Can you please share the screen, doctor?
Video calling.
Hello, doctor.
Yes, sir. I'm sharing my screen.
Doctor, you have any problem with screen sharing, doctor?
Hello.
Hello, Dr. Akshay. You have any problem with screen sharing? We will share for you, doctor.
Am I audible?
Yes, doctor, you are audible. We will
Hello.
share for you, doctor. We will share your screen, doctor. Okay.
Okay, sir. Please share my
Please start
screen.
the session, doctor. Hello, Dr. Akshay. Your screen is visible, doctor. Please start the session.
Hello.
Doctor, you are audible, doctor. Please start the session. Screen is visible, doctor. Hello, Dr. Akshay. Hello. Hello, Dr. Akshay. Hello, Dr. Akshay. Can you hear me? Hello, Dr. Akshay. Can you hear me? I think it does.
Yes, sir. Sir, can you please share my presentation?
Doctor, we are already shared, doctor. Please start the session, doctor.
Hello. Is
Doctor,
my
please start.
sir-
Can you see the
okay?
screen? Is it
Yes,
visible?
yes, yes. It's visible. Uh, good evening, everyone. My topic is review on the concept of Shatkriyakal and its significance. Hello.
Yes, doctor.
I'm okay.
Doctor, you're audible.
Uh,
Please continue.
okay. Shatkriyakal is derivation is Kriya means karma, that is action, and Kala is time. It means it is the appropriate time for treatment. Kriya or action refers to the measures taken in the form of Aushad, Ahar, and Vihar with an aim to correct the dosha disturbance. It is the narration in subsequential order of the abnormality occurring in the dosh, dusha, agni, and sutas, and a good understanding of Kriyakal is very important for early diagnosis, prognosis, and the preventive and curative measures. Okay, next slide, please. No disease is produced without the involvement of Vat, Pitta, and Kapha doshas. Hence, aggravation of dosha becomes root cause of disease. Some symptoms such as pain, burning sensation, heaviness are due to Vat, Pitta, and Kapha doshas respectively. The treatment required for disease must correspond to the dosh concerned. The concept of Kriyakal has been widely described in two separate entities as Rutukriyakal and Vedikriyakal. Under Rutukriyakal, normal physiological variations of those is in respective seasons has been discussed, and accordingly certain measures are described. Next slide, please. There are two types of Kriyakal mentioned in Setas, which are Vedikriyakal and Rutukriyakal. So first we will see Vedikriyakal. Vedikriyakal is the process of understanding pathogenesis of disease in consecutive stages and also known as Shatkriyakal, which are Sancham cha Prakopam cha Prasaram Sthan Sanshram Vyakti Bhedam cha Vyakti Doshanam sa Bhavid Vishak. In Susrut Sahita, it is given. Mainly six stages were described for successive manifestation of the disease.
Hello, doctor.
Am I audible?
Doctor. Yes, doctor. Please continue.
Okay, Sanchaya is the Sanitrupa Vruddhishchaya, which is accumulated doshas in respective seeds. It is the first stage of Kriyakala. Pratham Kriyakala IS Karma Avasara means it is the early stage to plan the suitable preventive measures. Next slide, please. Sanchayas are types there. Vat Sanchay Lakshanas are Jadata means stiffness and fullness in abdomen. Pitta Sanchay Lakshanas are Pittanga of body parts and Alpas Santap means mild increase in body temperature. Kapha Sanchay Lakshanas are Gurutva and Glani. Okay. Prakop means Vilay Rupa Vruddhi Prakopa. It is accumulated dosh moving to other sides than its main sides. It is the okay. Prakop Lakshanas are given according to doshas which are Vata Prakop Lakshana, Pitta and Kapha Prakop Lakshanas are explained in Sahitas. Next slide, please. Prasara is the Urdhva. Hello.
Doctor, please continue. You are audible.
Hello.
You are audible.
Doctor, you are audible. Please continue.
Okay. Sthana Sansray. Aggravated doshas spreads to places and stuck somewhere in the body. Obstruction in the protas due to abnormality in protas is called Sthan Sansray. It is a fourth Kriyakal. Next slide. Vyaktivastha. The stage of appearance of clear-cut symptoms of the disease is Vyaktivastha. Example Santap Lakshano Jara, Saran Lakshano Atisara, Puran Lakshanam Udaramiti. These are the examples of Vyakti Lakshana. Next slide, please. Ved is the in case of Puranas, they burst and becomes ulcers. It is the example of Ved. Certain disease attains chronicity, that is Jarna Jor, Pravruddha Amahata, etc. These are the examples of Ved. Next slide, please. After that, we will see about Rutu Kriyakalas. च प्रकोप प्रशमावायो अग्निदिषु त्रिषु वर्षादिषु तु पित्तस्य श्लेष्मणा शिशिरादिषु. There are Ch प्रकोप and prasham according to Rutus. Importance of knowledge of Kriyakal. Treatment is easier if the disease is diagnosed in the earlier stages. So when the doshas are controlled in the Sanchay stage of Kriyakal, they cannot proceed further into the consequent stages of Kriyakal. However, if the doshas are ignored, they will proceed further, will be more strong and deep-rooted, and there will be resistance to medications. So by understanding Kriyakala's treatment should be done in the earliest possible stage. Next slide, please. To break down Samprapti is called Chikitsa, that is treatment, and the 6 Kriyakal are collectively known as Samprapti. So the sequence of Kriyakala should be broken down by applying treatment in the earliest possible stage, that is Sanchay and Prakop. To attain success in treatment, it is essential to apply proper measures in proper time, starting from the Sanchay stage, that is accumulation of dosas. Therefore, all the 6 stages of Kriyakal require action by physician in the form of treatment. So these 6 stages are called 6 stages of action. It have correlation with Panchanidan also. It gives idea about Sadhyatva or a prognosis of the disease. Kriyakal also help it to find appropriate time for doing surgery for Shastrasadhya disease. Kriyakal helps to make treatment plan for particular stage. So, due to various factors, the doshas in the body undergo mutation or morbid changes, which initiate the process of disease manifestation. It is clear from the above description that various changes involved in the disease manifestation process takes place in distinct steps. As the various symptomatologies are exceed in the early stage of disease manifestation procedure, it is necessary for the individual that should be aware of the changes occurring in the body. So, good knowledge of the concept of Kriyakal is very essential for early recognition of the disease procedure. So, the proper knowledge of Shatkriyakal helps in understanding the process of manifestation of every disease as well as to diagnose the disease. The physician who diagnoses disease and treat accurately according to Shatkriyakal will become a successful practitioner. The knowledge of Shatkriyakal is helpful for knowing the sadhyatva of disease and also plays important role in the treatment. Okay, thank you.
Thank you, doctor. Thank you for the presentation. Next, I invite Dr. Yogesh Shrikant Kadam for the poster presentation. Dr. Yogesh, are you there? Dr. Yogesh Shrikant, are you there?
Yes, sir.
Okay, doctor. Good evening. Please start the session, doctor. Please share the screen.
Hello.
Hello, Dr. Yogesh.
Sir, please
Please share
can
the
you share
screen, doctor. Okay, okay, doctor. We will share for you.
uh,
And please start the session, doctor.
good evening to all. My name is Dr. Yogesh Shrikant Kadam. Title Collective Information about Parpati and Parpati Kalpana. Department Rasashastra and Basic Kalpana. College Sri Sree Ayurvedic College and Hospital Nashik Panchavati. Introduction. Parpati Kalpana is one such method described among the 25 other paras, the Bandha methods, which means to control the movement and facility of the paras. In the procedure of Parpati Kalpana, heat application is conducted, means heat energy may enhance its therapeutic efficacy in treating the gastrointestinal disorder. Aim to collect the information about Parpati and Parpati Kalpa. Objective to study the concept of Parpati, to study the Parpati Kalpa, to study the medicinal importance of Parpati Kalpa. Next slide. There are various Parpati: Loha Parpati, Suvarna Parpati, Vijaya Parpati, Panchamrut Parpati, Shwet Parpati, Bol Parpati, Tamra Parpati, Rasa Parpati. Next slide please. Materials from Rasa Shastra books, Rasa Ratnakar, Rasa Chandranshu, Yoga Ratnakar. The importance of Parpati and Parpati Kalpa. In the process of Parpati preparation, Parad is heated along with Gandak and other drugs. Here, Parad gets a very intimate bondage with Gandak, which helps to exhibit thousands of qualities compared to any other formulation. Agni plays an important role in altering the natural physicochemical properties and the potency of the dravas. With the contact of Agni, Ushnagun and Dipan properties, which are responsible for increasing the appetite, are derived. By the Dipan Pachan, Ushna properties of the drug, the intestinal ducts are open and Poshak Rasa absorption gets started. Hence, the Parpati plays important role in Grahani Chikitsa. Next slide, please. Medicinal importance of Parpati Kalpa. Rasa Parpati can use in Unmad, Apasmad, Sangrahani, Udarshul, Vatajwar, Kapachkas. Then Tamra Parpati, it can be used Pandurog, Shula Roga, Vatpitta Prakop,
Prameha. Suvarna Parpati can be used in Grahani, Rusha, Kashay, Jirna, Atisar. Vijay Parpati can be used in Sangrahani, Atisar, Pliha, Gulma, Kushta, and Jalodhar. Low Parpati can be used in Sangrahani, Shul, Atisar, Pandu, and Shodh. Panchamrit Parpati can be used in Grahani, Yakshma, Juar, Pandu, Agnimanda. Bol Parpati can be used in Urdhvak, Adhog Raktapitta, Harsha, Yonigat Raktastrav, and Gudaj Raktastrav. Shwet Parpati used in Mutra Pucha and Mutrashmari. Next slide, please. Discussion. Basic concept of Parpati is important to treat the gastrointestinal disorder. Parpati and Parpati Kalpa, including its contents, helpful in Chikitsa. It is necessary to know about the Parpati and Parpati Kalpa. Different Parpati Kalpa having different properties, so it can be used in many diseases. Conclusion. Parpati Kalpa such as Panchamrit Parpati more important in Grahani Chikitsa. Parpati helps to strain the intestine and helps to regulate bowel movements. So can be used in intestinal disorder. Parpati is unique mercurial preparation involved in different processes like Murshana, Sagandha or Nirgandha, presence and absence of sulfur. Sagni means process with heat. Pot Bandha of Bharat. References Book of Rasashastra by Dr. Vaidya and Doe, Dr. Doe. Rasaratna Samuchay, Adhyay 11. Okay, thank you.
Thank you, Dr. Yogesh. Thank you for the poster presentation. Next, I invite Dr. Shital Palve for the paper presentation. Dr. Shital, are you there? Dr. Shital, are you there? Dr. Shital Palve, are you there? Okay, next I invite Dr. Sana Choudhary for the paper presentation. Dr. Sana Choudhary, are you there? Dr. Sana, please unmute, doctor. Hello, Dr. Sana, please unmute, doctor.
Hello,
Hello.
am I audible?
Yes, doctor, you're audible. Good evening, doctor.
Good evening, sir. I'm not placed sequentially the PowerPoint presentation in my mobile, so I'll just show from the back camera. Is it visible?
Yes, doctor, it is visible. We will share for you, doctor. Don't worry. Okay.
So it is not arranged sequentially actually. That's why I'm doing so.
Okay, doctor.
Is it visible? Sure.
Yes, doctor, it is visible. Please start, doctor.
Okay. Shall I start? Good evening, everyone. This is Dr. Sana Choudhary from College of Ayurveda and Research Center, Akudi. I'm presenting my paper presentation topic for Ayurveda and skin disorders, that is Tvak in Ayurveda. Introduction. Skin is the most visible extended organ of the human body. Now, as we know, skin is mostly affected by various bacteria, viruses, and fungi. Now, all out of this, in today's era, if we see, tinea infections contribute to 10 to 20% and are increasing even day by day. Now, these are due to unhygienic, poor conditions, plus low socioeconomic strata, and because its spread is really very fast. And on basis of this manifestations of tinea, it can resemble to the Drukushta, which is mentioned in Ayurveda. Now, according to this, the Drukushta, the dosha involved are Kapha and Pitta dosha. These doshas, this leads to accumulation of toxins. The vitiated doshas lead to accumulation of toxins beneath the skin, which can involve rasa, which can resemble to plasma, rakta, which resembles to blood, masa, which resembles to muscle, and lasika, which resembles to lymphatic, and thereby discontaminate the deeper tissues. Now, manifestation, why we consider that kapha and vata dushti takes place here? Because firstly, kapha dushti leads to kandu, and we see that in tinea infection, patient complains of extreme itching, extreme kandu. Second is mandal utpatti. If we see circular lesions are present. Now, why vata guna is seen in here? Because of chalaguna, we see the tinea infection, this spread very quickly, very fast, and even because of, like you say, contact of the infected patients, other gets infected very quickly. So this is because of Chalaguna of Vata. And if you see, because of Pitta dosha, you see erythema. So Pitta dosha is involved, but not to that extent as of Vata and Kapha dosha. Thirdly, because of use of antifungal medications nowadays and steroids, we see there is very much recurrence of tinea infections. So in my study, what we have done, we have taken 10 patients whom we have treated with Arogya Vardhani Vati, Amruta Gugul, Marich Tel, and we have given them diet and lifestyle management. And along with this, if you see at the end of 2 weeks of treatment, patients were showing that the Kandu, Daha, Raga, and Pedika, the Utsanna Mandala Utpatti, they have reduced. I'll show you the pictures later. Now, what was the hetu when we came to the diagnosis of this? So, what was the common hetu on these patients? That first was Viruddha Ahar Sevan. Then Sneha Yukta Ahar Sevan, we can say nowadays junk food, which is taken mostly among the youths. Then, and according to Ayurveda, one most important thing was Atyadik Vyayam, the one who works into the gym and the one who are not wearing the sweat absorbent clothes. So in these patients also, you see infection of tinea is very common. Then Purva Roop in this patient, Aswed, Atiswed, according to Ayurveda only. Then Atis Lakshanata, Vaivaranya, Supti, that is paresthesia, Daha, Shota, then Kharatva, and Visarpa, erysipelas-like conditions was seen. Now, if you see the symptoms of Dadru according to Ayurveda, so Dirgha Pratanna Durvavat means that lesions are wide as a plant of conch grass, that is Durva grass, and Pushpavat lesion, the skin discoloration, this resembles to flaxseed flowers, flax flowers. Then Utsanna Mandal, because the lesions, these are having embossed margins with central clearing. Kandu and Anushangi, that is persistent inching. Now, in this study, if you see, after 2 weeks of use of Ayurvedic medications like Arogya Vardhani Vati, Amruta Gugul, Marichadi Tel, what were the results? I'll just show you. Now, these are after the 2 weeks of result. Now, you can see Utsanna Mandal, embossed margins, and discoloration has been improved to some extent. Even here you can see the redness, the discoloration, embossed margin was
Photo not
resolved.
clear.
Is it? This is before. This is after. This is before. And this is after. This was before. This was after. Is it visible?
Yes, doctor, please continue.
Hello. Yeah. So if we see some prapti of Dadru Kushtha according to Ayurveda, Hetu Sevan, then Sapta Dravyani Dushti was over here. That is Vat, Pitta, Kapha, Tvak, Mans, Rakta, and Lasika. Kushtha Vyadhi Utpatti. Now these are the common samprapti for the Sapta Mahakushtha and 11 Shudra Kushtha, amongst which we have seen Tadru Kushtha, which is mostly mediated due to Kapha and Vata dosha. Now, Sadhya Sadhyatva, if we see Sukh Sadhya, when only Kapha and Vata dosha involved and Dhatu involved is only Rasa. And when you see Kuchra Sadhya, when it is Pitta Pradhan, Rakta and Mas are involved. When it becomes Yapya, it is Dvi doshaj and Medashrit. When it becomes Asadhya, it is Tri doshaj and Asti, Majja and Shukra Ashrit. The results I have shown you already. So in present study, the patients were given oral and topical Ayurvedic preparations for tinea. After 2 weeks of the following drugs, Arogya Vardhani Vati, Amruta Gugul, topical preparations of Marichadi Tel, significant results were observed. Positive results were symptoms such as Kandu, Rukshata, Paridaha, Pedika were resolved. Now, in this era where there are various antifungal resistance, we can, the ancient Ayurveda medications were highly effective in resolving the Drukushta, which resembles tinea infection. Thank you.
Thank you, Dr. Sana.
Hello.
Thank you for the presentation.
Thank you, sir.
Next, I invite Dr. Shubhankar Kulkarni for the paper presentation. Dr. Shubhankar, are you there? Dr. Shubhankar Kulkarni, are you there? Dr. Shubhankar Kulkarni, are you there? Okay, next I invite Dr. Chandranshu Shukla for the paper presentation. Dr. Chandranshu Shukla, are you there?
Yes, sir. Yes, sir. Good
Okay,
evening.
doctor. Good evening. Please share the screen, doctor.
Is it visible, sir?
Yes, doctor, visible. Doctor, if you have any trouble, we will share for you, doctor.
Yes, sir. If you can share, it will help me.
Sure, doctor, we will share for you. Just a moment, doctor.
Yes.
And please start the session, doctor.
Good evening, all. Myself, Dr. Chandranshu Shukla, PG scholar of Panchkarma. I am here presenting the topic Raktamokshana and ancient Ayurvedic Panchkarmiya practice. Introduction. Sir, next slide. Raktamokshana is a unique procedure among the Shastra Karma indicated in different diseases where gross vitiation of Rakta is present. Raktasya mokshanam Raktashravaha, letting out the impure blood from the body is known as Raktamokshana. Rakta Dhatu is one among the Sapta Dhatus of Sharir which circulate all over the body. Rakta Dhatu Praman according to Charak is 8 Anjali. It is one of the Dash Pranayatana. Next slide, please. Shushruta has mentioned Rakt as Panchabhautika, Vishrata, Dravta, Rag, Spandhan, and Laguta are the guna of Rakta according to the Mahabhuta dominance. Next slide, please. This is the classification of Panchashodhan according to Shushruta, Bhagavad, and Charaka. Shushruta and Bhagavad mentioned Raktamokshana among one of the Panchakarma. Next slide, please. Classification according to Shushruta, Shastrakrat and Anu Shastrakrat. Prichan and Shiravedan comes under the Shastrakrat, and Shrang, Jaloka, Alabu, and Ghati, we consider it as Anu Shastrakrat. Next slide, please. Siraveda, puncturing a vein for therapeutic purpose, is known as Siraved, and it is one of the important methods of Raktamokshana. Siravyadi Chikitsartam, Shalyatantram Prakirtitah. Siraved is considered as Ardha Chikitsa in Shalyatantra. Among all the treatment methods for Sadhi Roga, Siraved is the best. इसने आदि भी क्रिया योगन तथा लेपेन अनापि यांति यशु व्याधे शांति तथा सम्यक सिरावेदात. The condition which do not subside with snehan, lep, and any other gum, it will subside by proper siraveda. Next slide. Vanprasth is advocated as maximum limit of bloodletting with extensively vitiated dosha. As per Dharan, Vanprasth Uttam Matra 768 ml, half Prasth Madhyam Matra 384 ml, and 1/4 Prasth Heen Matra 192 ml. Next slide. Site of Siraveda according to disease. Vata Chonit, Paddari, Paddaha, Avauk, Chip, Visarp, Vatkantak, Vicharchika. We do Siraved at 2 angul above Shipramarm. Kroshtuk Sheesh, Khanj, Pang, Vat Vedana, 4 angul above Gulf Sandhi. Gridrisi, 4 angul either above or below Janu Sandhi. Vishwachi, 4 angul either above or below Kurpar Sandhi. Apchi, 2 angul below Vasti Marma. Next slide. Prachana karma is one type of Raktamokshana in which Kurcha Shastra is used to make multiple incisions are made on affected area to ooze out vitiated blood and achieve dosha samyata. Indications of Prachana karma diseases produced due to vitiation of blood locally, accumulated vitiated Rakta, localized skin diseases, glandular enlargement, alopecia. Procedure is a tourniquet is applied over the affected area by using a sharp pointed edged instrument. Multiple pricks are made over the diseased area. Pricks are made in a specific manner. Next slide. Pricks are made from either bottom to upward direction. Pricks are to be made parallel to each other. It shouldn't be too superficial or too deep. Over the prick should be avoided. Thus, the whole area of disease should be covered. Bleeding stops on its own. When satisfactory amount of blood oozes out, the tourniquet has to be removed. If excessive bleeding is observed, then the Raktamokshana drugs like Ushiradi Chun has to be applied. Next slide. String, that is horn of cow, is collected and used for Raktamokshana procedure. It should be round, 7 angul in length. The whole of face is to be praman of thumb, whereas the upper part should be of mudgu praman. Next slide, please. Alabu, commonly known as bottle guard, it should have circumference of 8 angul and length of 4 angul. Ghati yantra follows same mechanism as Alabu. Difference in Ghati yantra is made up of metal. Next slide, please. Jaloka of Charan. Jaloka is a type of Raktamokshana in which blood oozes through leeches. We use leeches. It is indicated in Pitta Dushta Rakta Vikara. There are two types of Jaloka, Sarvish and Nirvish. Next slide, please. Select active leech. Prepare the leech. Place in Charsha, Prajnikalka, Kanji, Takra to activate the leech. Prepare the site. Apply Grith, milk or Shastra. Place the leech on the side and stops when Tod Kandu Lakshan is there. If leech don't stop sucking the blood, use Sendav Chun or Haridra. Next slide, please. Application of Raktamokshana. Siraveda we do in Tridoshas Rakta Dushti, Sarvangagata Dushti, Prachan Karma in Uttan Rakta Ek Deshiya Pindit Rakta, Shrung in Vata Dushti Rakta, Rakta in Twak Pradeshi, and Jaloka Pitta Dushti Rakta, where the doshas are avgad. Next slide. According to dosh and position, it can be done. Superficial Rakta dosh, Ek Deshiya dosh, Prachan can be performed. Slightly deeper doshas, Grathit dosh, Jaloka can be used. Gambhir dosh in Alabu can be used. Atyant Gambhir dosh, Shring is used. Sarvang Rakta dosh, Siravedan is done. Next slide. Patient and method selection. Dosh avastha anusar, Rakt avastha anusar, and Atur avastha anusar we select the patient. In Vata Dushti, Goshranga is used due to Ushna, Madhur and Snigdha properties. In Pitta Dushti, Jaloka is used due to being aquatic and Madhura. In Kafas Dushti, Alabu is used due to Katu, Ruksha, Tikshna properties. Param Sukumar patient, Jaloka is used. Sukumar patient, Shring and Alabu used. And if the patient is Valvan, Siraved and Prachan is used. Next slide, please. Preparatory protocols. Check blood for routine and coagulation profile. Serological and other case-specific tests are done. Arrange supplies like gloves, instruments, BP apparatus, etc. Explain procedure to the patient and consent for the same. Sthanik Snehan and Shvedan is done. Yavagu is diet is advised. Next slide. Importance of Raktamokshana. In Raktamokshana, Dushit Rakta along with doshas are removed. The susceptibility of Rakta towards impurity is too much versatile. By Raktamokshana, there is breaking down of obstruction, avaran, which helps in normal movement of Vata and bodily functions. Raktamokshana is indicated in Rakta Avrat Vata and it produces quick relief from symptoms. Thank you. Sir, can you please share my poster along with this?
Sure, doctor. Just a moment. Please start the session, doctor.
Yes, sir. My poster topic is management of child health through Panchkarma. I am trying to cover the Panchkarma in pediatrics part. Introduction. Panchkarma includes 5 major therapeutic procedures of detoxification and body purification. It can be used efficiently in all the branches of Ashtanga Ayurveda. Panchkarma measures executed with precautions is effective in child as it results in adults. The knowledge and experience of Panchkarma in pediatric conditions is the key to successful administration of Panchkarma in children. Increasing and mainstreaming Panchkarma procedures among children in Ayurveda hospitals will definitely provide a new hope in management of child disorders. Objectives are to explore pediatric care through Panchkarma to improve quality of life of children, to study the Panchkarma procedures in pediatrics mentioned in Ayurvedic text, to study the pediatric Panchkarma procedures in present clinical practices. References regarding Panchkarma in children are collected from various classical Ayurvedic textbooks, published research papers from internet sources, and previous work done. Panchkarma that can be performed in children's Deepan Pachan to obtain Niram Avastha and to improve Agni before Panchkarma procedures. Boiled water with Shunti or Dhanya can be used. Snehan is very good for children. Children are delicate by nature. Massaging them with oil yields strength, make immune system stronger. Shvedan, Hast and Tap Shved is useful in neonates. Nadi Shwed, Prasthar Shwed, Sankar, Pradeha, Upnaha, Avgaha, Parishek Shwed are other types which are practically applicable in children. Kashyap mentioned a lot about this. Mridu Vaman is indicated as Balkal is considered as snigd and cough predominant stages of life. Virechan Mridu Shodhan is indicated only in cases of emergency. Virechan must be substituted with Basti in indicated conditions. Basti, it is considered as nectar in children, best treatment among Panchkarma for children. It maintains proper overall health of children, provides strength in performing skills. Nashya, it removes toxin from all the channels and help in eliminating Urdhva Jatrugat Vikaras. Children are more prone to Urdhva Jatrugat Vikar due to Kapha dosha dominancy. Raktamokshana, it is contraindicated till 16 years. Conclusion, though children have doshas, dushya, diseases, everything similar to that of adults, it is very essential to consider the respective conditions, age, doses, drugs, mode of administration, time, frequency, and procedures while managing pediatric conditions. The difference of child from an adult lies in the physical conditions of a child, being Saukumaryata, having soft and tender body structure, Alpakayata, underdeveloped organ systems, Vivid Anupsevanata, GIT not fit to receive all types of food. Aparipakva dhatu, transformation and development under progression. Ajata vyanjanam, incomplete secondary sexual characters. Aklesha sahatva, cannot tolerate any kind of stress. Asampurna balam, poor strength. Sleshma dhatu, prayam, drastic growth and development. This is the reason the fixation of dose and duration of procedures which should be shorter in pediatric group. Quality of medicine in children should be mridu, low potency, madhur and surbi, sweet and good order for better palatability, lagu, easy to absorb and assimilate. Detailed description of different Panchkarma procedures in children in different conditions is described in different classical texts. Previous research studies have concluded on the significance of Panchkarma in Balroga. Thank you.
Thank you, Dr. Chandranshu. Thank you for the insightful paper and poster presentation. Next, invite Dr. Sneha Rajendra Vidhate for the paper presentation. Dr. Sneha, are you there? Dr. Sneha Chandranshu Vidhate, are you there? Dr. Sneha Vidhate, are you there? Okay, next I invite Dr. M.D. Junaid for the paper presentation. Dr. Junaid, are you there?
Yes, sir. Good evening, sir. I'm there, sir. Can you please share the screen, sir?
Sure, doctor. Just a moment. Dr. Junaid, please start the session, doctor.
Sir, first of all, good evening to all the Prithvika team and to my co-presenters. My topic today is review and chikitsa on Mutrashmari, and myself is Dr. Mohammad Junaid, PG scholar, Department of Kaya Chikitsa from Dr. NRS Government Ayurvedic College, Vijayawada, Andhra Pradesh. Introduction. Ayurveda, the Upanga of Atharvana Veda, has described many diseases relating to Basti. The Mutroha Samsthana is one of the systems in Ayurveda meant for formation and excretion of urine. From the study of ancient surgical texts Sushruta Samhita, it becomes evident that urological problems form an important part of medical sciences. Among all the urinary problems described in Ayurvedic texts, there is one variety where both medicinal and surgical treatments both are used and are advised in Mutrashmari. Next, sir. Coming to Nidana, various scholars have described Nidana according to Charaka, Sushruta, Vagbhata, and Kashyapa. Charaka, the practice of excessive exercise, Tikshna Aushadas, Ruksha Madhyapana, excessive intake of Anupamamsa, Adhishna, Ajirna, Bhojana, Madhya Bhojana. And according to Sushruta, who neglect the Samsodhana of internal charges, intake of unwholesome dietary foods leads to Mutrashmari. And according to Vagbhata, intake of heavy, fatty, and sweet excessively, and Divaswapna, Ajirna Bhojana, and Adhyashana. According to Kashyapa, a child from paternal Shukra that got mixed up with urine, Mutra Avroda develops urinary calculi from birth, and Asatmya Ahara of the parents also leads to the Mutrashmari. Next, sir. In coming to the Purva Rupa, various acharyas, that is Sushruta, according to Ashtanga, Sangraha, Madhava Nidana, Bhavya Prakasha, Yogaratna, and Gadanikraha. The various symptoms are Basti Pida, Aruchi, Mutra Krucha, Basti Avroda, Muksha, Pushka Vedana, Jwara, Avasada, Sandra Mutra, Avila Mutra, and Basti Atmana are present in according to some texts, and some are negative in other texts. Next slide, sir. And coming to the Rupa also, the symptoms according to various scholars, there is Sushrita Charaka, Ashtang Hrudaya, Ashtang Samgraha, Arith Samyata, Kaship Samyata, Madhava Nidana, Bhava Prakash, and Yogaratnakara. The various Rupa symptoms are Nabhi Vedana, Basti Vedana, Mutradhara Sangha, Atyavilam, Rudira Mutra, Atimutram, Pratapa Roditi, Kasamana, Budanti Medra, and Vishmadhara. The various they may be present in some according to some texts, and they are not present in some according to texts. Next, sir. When coming to the Samprapti, Samprapti can be defined as it is the process which starts from Sanchaya Avastha of doshas to Vyadhi Vyakta Avastha. As said, Samprapti Vigatana Meva Chikitsa. It is possible because proper treatment is outcome only because of Samprapti Gatakas flowing. Mutrashmari is a Kapha dominant dosha value occurring in any part of UTI. The Vishet Vata dosha along with Kapha dosha and Mutra Srota leads to Mutrashmari. Kapha dosha is Samvai Karna of Ashmari. The predominant Kapha dosha gets hard and develops in the form of Ashmari. While explaining the formation of Ashmari, Acharya Sushruta narrates that the way even clear water collected in pot precipitates in the bottom in due time. Similarly, process of hardening of stone occurs with Shara of Kapha dosha present in Mutra Srotas. Next slide. According to Yogaratnakara, aggravated Vata dosha settles down in Basti Pradesha by virtue of its Ruksha Guna. It dries up locally in Mutra, Shukra, and Pitta to convert them to Sharkara, that is granules. Kapha dosha by its Guru, Sandra, Snigdha, and Pichila and Alepana Karma, that is binding karma, binds those granules together to make a soft stone-like structure. Pitta by its Paka Karma completes the stone formation process. Next slide, sir. When complete into Samprapti Gatakas, the various Samprapti Gatakas are dosha here is Kapha Pradhanata dosha, dosha is Mutra, Srotas is Mutra Srota, Srota dosha is Sangha, Agni is Jatragni Manya, Ama is Jatragni, Dosha Marga is Kosta, Shaka, Rogamarga, Abhyantara, Adhisthana, Basti, Upashaya and Apushaya. The factors which relieve the disease are Upashaya, while the factors which aggravate doshas are Anupashaya. None of the Ayurvedic texts explained about it on Mutrasana, but the main factor involved in Ashmari formation is Kapha dosha. Hence, all measures leading to control of Kapha are Upashaya, and those which aggravate Kapha are Anupashaya. Next slide. The classification of Ashmari. All the Acharyas except Charaka classified the disease into 4 types: Shleshmaja Ashmari, Pittaja Ashmari, Vataja, and Shuklaja Ashmari. Lakshanas of different Ashmari are Shleshmaja in Shleshmaja dysuria, heavy and cold sensation, bladder area will be present. Pittaja burning hot sensation, inflammatory changes will be present. Vataja severe pain in bladder and dysuria will be present. In Shukraja dysuria, scrotal swelling will be present. Features of Ashmari are Shleshmaja. In Shleshmaja, Kukutanda like heavy weight will be there. In Pittaja, reddish yellowish resembles Ballaka seed will be there. In Vataja Ashmari, hard irregular like Kadam Pushpa will be there. Sadhyasad in our class, Acharyas have described about Ashta Mahagadas, and these Mahagadas are not easy to treat Ashmari in one of them. So early detected Ashmari can be treated with medicines, and of long time is difficult to cure. The Chikitsa of most Ashmari according to Ayurveda, though Ashmari comes under Ashta Mahagada, there are some herbs in Ayurveda which can be used to treat Mutra Ashmari. Nidana Paryojan is considered the first line of treatment of any Vata Vyadhi in Ayurveda. Both Acharya Sushruta and Charaka have measured for avoiding the etiological factor, which is primary step in management. Ashmari Chikitsa can be divided into 2 types: Purva Rupa Avastha and Rupa Avastha. During Purva Rupa, the Ashtanga Hrudaya, Chikitsa Sthana, and Yogaratnakara, Sneha Sweda, Vamna, Avagaha, Sweda, and Adhika Ambopana is described. During Rupa Avastha, Vireshna uttarbasti are recommended. In Chikitsa, we follow 2 types, that is Shodhana and Shamana. In Shodhana, we can follow Vasti Karma, Kshara Prayoga, and Shastra Chikitsa. In Vata Yashmiri, for Shodhana, they mention Vata and Mutra Kricha Chikitsa, that is Abhyanga and Sneha by Vatahara Tailors, Niruha Vasti, Uttarbasti, Pupanaha, and Parishek with Vatahara Tailors. And Kvata. In Kafaja Ashmari, Kafaja Mutra is indicated, that is Abhyanga and Pana of Tailas made with Tikta Dravyas, Aushadhi and Kshira made by using Ushna, Tikshna Dravyas, Shara Prayogas, Vedana, Vamana, Niruha Vasti. In Shamana Chikitsa, Beshaja can be taken in the form of Gruta, Kshara, Shaya, Kashaya, and Kshira, followed by Uttarbasti. By the opinion of Charaka, patient of Mutrashmari should drink unspoiled wine and should be taken for a fast ride of a horse. As a result, shaking will get and the stone will be displayed. Next. According to Sushruta, Charaka, Ashtanga Sangraha, Ashtanga Hridaya, Bhavaprakash, Sarandara, and Harita, the Vata, Pitta, Kapaja, and general Ashmari can be in medicines are like this. In Vata, Pashana Beda, Varuna, Kulatta, Satavari describe Kusha the Gruta, Varuna Ganagukulu, Gokshura the Chuna, Viratarva the Ganakwada, Appa Marga, Yavakshara, Punanava, and maximum Viratarva the Gruta will be there, and Varuna the Gruta, and Pashana Beda, Shigru, Kashaya, Shunti, etc. will be there. Extras. In a Kshara Prayoga, Dravyanam tu Gutottanam, Ksharo Avimutra. Gramyasta Shukra Share, Samyukta Sadhita Susuchikisa. Paniya Kshara is indicated in management of Mutrashmari. Many preparations have been described by different acharyas which contain Kshara as main ingredient. The Kshara prepared from Kalka of Tila, Apamarga, Palasha, and Yava should be taken with goat's milk as Anupana. Sushruta also recommends Kshara prepared from Palasha and Karavira in treatment of Ashmari. In Patya, next slide, sir. Coming to Patya and Apatya, the Patya to take more water per day, to take pulses like Kulatta, Yava, vegetables, Kushmanda, ginger, diet rich in fiber, disciplined lifestyle, regular body shodhan, foods rich in vitamin A and magnesium. Apatya, suppression of mutra, avoid heavy exercise, intake of sour, ruksha and pishta anna, tomato, kashaya, rasa, viruddha ahara, calcium tablets and other supplements. Next please. In coming to discussion from the study of ancient surgical practice, it becomes evident that the urological problems form an important part of medical liberations. Perhaps this can be the reason for detailed description of Mutrashmari in our Ayurvedic text. The clear-cut cause of the disease is still unknown, but in Ayurveda, Kapha dosha in increased quantity has been accepted as the main reason for the formation of Mutrashmari, whereas in modern science they have considered causative factor for formation, but clear etiology of disease is still unknown. Conclusion: Ayurvedic text reviews with disease Mutrashmari description with Nidana, Samprati, Purva, Rupa, classification, Lakshanas, etc. And Chikitsa of Ashmari and Patya and Apatya are explained. Thank you.
Thank you, Doctor. So for next presentation, I would like to invite Dr. K.K. Chaitanya on the topic Critical Review on Rasa Mishra. I invite Dr. K.K. Chaitanya.
A very good morning to one and all. Myself, Dr. Chaitanya, first year PG scholar from the Department of RSPK, MBA Ayurveda College. Today's topic is critical review on Rasa Mishra. Introduction. Rasa Mishra was a compiled Hindi textbook of Justice Shastra, which is written by Trayambaga Sharma. The content of the book includes all the basic aspects of the Rasa Shastra, including Paribhasha, Mana Paribhasha, Yandra, and Huda. The textbook also deals with the Bharata in detail, including its dosha, Rasa Sevana Vidhi, Patyapatya, and Ashta Samskara. Many yogas are also explained in the book. Also, the textbook deals with the Maharasa, Ubarasa, Dhadus, Ratnas, Ubaratnas, Vishas, and Ubavishas, etc. The content of the book is Samanya Vijnana, Jasa Vijnana, Ubarasa Vijnana, Dhadu Vijnana, Ratna, and Ubaratna Vijnana. Samanya Vijnaniyam is the Pradhama Adhyaya or Rishmi. The first chapter begins with the Mangala Sharana to Lord Shiva, followed by the Jasa Shastra Pradhanyada, where Jasa Vargikarana is being mentioned along with the sloga Malpoba Yoga, Malpa Matroba Yogita, Tarujira Prasangada, Kshipramarogita. And the Jasacharya and Shishya Gunas are explained. The construction of the Jasashala with Nishalna Karma Vibhaga, Ubhakarana Dravyas, and Vishishta Dravyas are explained. Paribhasha, including Lavana Panjagam, Shara Panjagam, Madhuratrayam, Mamlavargam, Panjamrada, Panjagavya, Kshirat Traya, Travaga Gana, Kajali, Risapangam, Risapishti, and also the procedures such as Talana, Mavapa, Nirvapa are also explained. Mana Paribhasha, Mendra Vijnani deals with many yantra and about the Musha, Sandhibandhana, Kuda are also explained. The Jasa Vijnaniyam was the second chapter. The second chapter begins with the enumeration of synonyms of the Jasa, Grahya and Agrahya Swarupa, Naisargika and Yaugika Dosha, Shodhana of Bharata and Ashta Samskara of Bharata, Ingolota Bharata, Jarana and Murchana. Yogas mentioned are Mudga Jasa, Gresa Pushpa, Jasa Karpura, Sarvanga Sundara Jasa, Jasa Parpadi, Krishna Rasa, Jasa Sinduram, Magara Dvajam, etc. Later, Acharya ends the chapter with the Jasa Sevana Vidhi, Jasa Sevana Doshas, Jasa Sevana Patya and Apatya, and Jasa Dosha Nirvarana Vidhi. The third chapter is Subarasa Vijnaniyam, where the chapter begins with the enumeration of Maharasa. The chapter deals with the enumeration of Maharasa with detailed explanation of Abraga, Abraga Shodhana types, Shodhana method, Dhanya Bragam, the Marana, the importance, the Gunas, Apakwa Bhasma, Pakshana Doshas, and Ashuddha Bhadra. So the Abraga is being dealt in very detail, and other Maharasas and Ubarasas are also explained. Although the chapter is Ubarasa, Maharasas and Ubarasas are explained in this Madhyaya. Dhatu Vijnaniyam is the fourth Adhyaya, which begins with the enumeration of the Dhadus, Samanya Shodhana and the Marana, and a brief explanation on the Swarnadi Dhadus with the Shodhana, Marana, Charana, and Mishra Dhadus are also explained at last. The fifth is Jatna and Ubaratna, enumeration of the Jatnas, including each Shodhana and Marana are explained, and Ubhayaditnas are also enumerated with Shodhana. Explanation of the Phaliga, Rudira, Pudika, Sugandhiga, Turmuli, Turamuli is also explained. And in this chapter, Sudhavarga is also explained, like Sukudodaga, Shunakali, etc. And the Visha Ubavisha Vijnaniyam Adhyaya. Enumeration of the Visha synonyms, the type, the Kanda Visha enumeration, Varjaniya Visham, Sadharana Visha Guna, Shodhana, Marana, Visha Sevana Vidhi, Visha Bhakshana Matra, Visha Sevana Kalam, Visha Sevana Apatya and Patyam, Visha Sevana Gunas, Visha Prayoga, Visha Manarha, and Ubavishas are also enumerated, and the reference of Shodhana and Pradivisha is also being explained. The textbook ends with the Jangama Visha, that is Sarpa Visha explanation. So I conclude this book, Rasa Mishra, covered all the aspects of Rasa Shastra in a glimpse. The commentary is available both in Hindi and English. The book helps the reader to understand the basic concepts of the Rasa in total in a simpler and easier way. Thank you.
Thank you, Doctor. So next, let me invite Dr. Sneha Rajendra Vidhate for the paper presentation on the topic Ritu Haritaki in Ayurveda, a review study. I invite Dr. Sneha Rajendra Vidhate. Dr. Sneha. So next I invite Dr. Prachi Sadish Shetty. I invite Dr. Prachi for the paper presentation. Dr. Prachi.
Yes, ma'am.
Good evening, Doctor. You are audible.
Yes. Can you share my PPT, ma'am?
Sure, Doctor.
Can you show my PPT, please?
Sure, Doctor.
Yes.
Just a second. And dear participants, before going to the next presentation, let me remind you the same thing. Your time for your presentation is maximum of 8 minutes. Please follow the time limit. Thank you.
And Doctor, please start the session, Doctor.
Yes. Myself, Dr. Prachi Satish Shetty, Department of Prasuti Tantra and Stree Rog, PG scholar. My college is Kedari Redekar. Yes, title Role of Anashan Puri Langhan followed by Shaman and Anuloman in Amvat. Next slide. To study the effect of Anashan Puri Langhan, Shaman and Anuloman in Amvat. To study the Amvat in detail. Case report. The present case study of Ayurvedic management in Amvat, 34-year-old patient came with complaining of interphalangeal joint pain and swelling, both knee joint pain and swelling, both ankle joint pain and swelling, difficulty in performing day-to-day simple activity. Next slide. Past history, no history of any other major illness. Nadi 86 per minute, Mala Samyak, Mutra Samyak, Jiva Sam, Druka, Prakrut Nadi, Nidra Khandit, Nakha Prakrut, Tvaka Prakrut, Kshudha Prakrut, Ura, air entry bilateral clear, Udar soft, non-tender, BP 110/70 mm of Hg. Criteria of assessment: Sparsha, Shita, Anushan, Ushna, Sparsha Sahatva, grade minus absent plus mild plus 2 moderate plus 3 severe. Grahata minus absent plus mild plus 2 moderate plus 3 severe. Shotha minus absent plus mild plus 2 moderate plus 3 severe. Material and method. Anashan Puri Langan given for 6 days. During Langan 20 to 50 ml Shunthi Siddha Jala per day. Name of Aushadhi. After 6 days, name of Aushadhi. Ampachakvat, dose 20 ml before meal, BD, warm water with. Hingvashtak Churna 1 gram with Prathamakvat BD with cow ghee. Shankhavati 500 mg before meal, BD with warm water. Amrut Gugul 500 mg after meal, BD with warm water. Maharasnadi Kwat 20. Slide. Shunthi Siddha Eranda Sneha 40 ml with warm milk for 3 days. Observation and result. Sandhi, Ans Sandhi, Sparsha, Anushna, Sparshasatva +3, Grahata +2, Shot +1, Kurpar, Ushna +2, Manibandha, Sparsha Ushna, Sparshasatva +3, Grahata +2, Shotha +2, Parva, Sparsha Ushna, Sparshasatva +3, Grahata +2 +3, Shot, Janu, Sparsha Ushna, Sparshasatva +2, Grahata +2, Shotha +3. After treatment, Sandhi, Ansa, Sparsha Anushna, Sparshasatva minus, Grahata minus, Shotha minus, Kurpar, Sparsha Anushna, Sparshasatva +1, Grahata +1, Shot +1, Manibandha, Sparsha Anushna, Sparshasatva +1, Grahata -1, Shotha -1, Parva, Sparsha Anushna, Sparshasatva +1, Grahata minus, Shotha minus, Janu, Anushna, Sparshasatva +1, Grahata +1, Shot +1. Observation. After Langan, the patient got relief in chief complaint considerably. Shaman Chikitsa provided additional benefit to this therapy. Patient can do joint movement freely. Anuloman with Eranda Sneha is very useful for removal of Dushit Dosh, its own significance in Amvat. Next slide. Discussion. Among the disease of locomotory system, rheumatoid arthritis is the most commonly encountered painful condition in young age group. In this case study, results shown that Anashan Puri Langan had significant role in Amvat. Most important precautions during the Langan is to identify Niram Avastha and stop the Langan. If Langan will be extend after Niram Avastha, the pain will be increased. It considerably reduce the cardinal symptom, and more important, it gives relief from pain. After that, for further dosh shaman chikitsa in Dipan Pachan and Anuloman by Shuntisiddha Eranda Sneha was very effective. Shaman chikitsa with the classical treatment of Amvat, which gives drastic result in Amvat. Langan in addition create hunger reflex in patient, resulting enhanced production of internal corticosteroids which provide relief through the reduction of inflammation. Next slide. Sampraptibhanga. Anashan Puri Langan along with Shaman and Anuloman, that is firstly degradation of Apachit Ahar Ras, that is Am, by Anashan Puri Langan. During Langan, Shunti Siddha Jala is also very effective, which treat disease along with Trishna Shaman. After proper Langan, Shaman with Dipan Pachan Dravya with the Ushna Virya increase the gut fire, further adding for digestion. Anuloman removes all the Dushit Dosh easily. By this specific and complete treatment, we can avoid recurrence also. This is very effective and classical treatment of Amvat with Anashan Puri Langan followed by Shaman and Anuloman Chikitsa. Thank you.
Thank you, doctor. So now I invite Dr. Nidhi Kamale for the next paper presentation. I invite Dr. Nidhi Kamale. Dr. Nidhi. So next I invite Dr. Bhagyashree Mahadev Chavan. I invite Dr. Bhagyashree Mahadev Chavan. I think these participants are not presented in the presentation session. So next, I would like to invite Dr. Nikita Sitaram Shelke. I invite Dr. Nikita Sitaram Shelke for the paper presentation. Dr. Nikita. Now I invite Dr. Pallavi Dilip Jadhav. I invite Dr. Pallavi Dilip Jadhav. Dr. Pallavi.
And next I invite Dr. Amay Prakash Sunavane for the paper presentation. It is a topic related to Vrana.
Hello. Hello.
Hello.
Hello.
Is it Dr. Pallavi?
Sir, may I audible?
Yes, doctor. Audible, doctor. It's your poster presentation, right, doctor?
Hello.
Dr.
Hello,
Pallavi, you are audible.
Sir, can you please share my slides, please?
Just a moment, doctor.
Hello.
Just a moment, doctor. I will share for you.
Okay, sir.
And Dr. Pallavi, please start the session, doctor.
Okay, thank you, sir. I'm Dr. Pallavi Dilip Jadhav from College Shree Saptashungi Hospital and College, Nashik. My poster presentation topic is types of the Durva, mentioned in all Nigantu and its medicinal values. May I audible, sir?
Yes, doctor. Audible. Please continue, doctor.
Yes, sir. Thank you. Introduction. Durva, that is the Cynodon dactylon, is a perennial grass, commonly known as the Bermuda grass, also known as the couch grass. It is a native of the Europe, Africa, Australia, and much of the Asia. Cynodon dactylon is a widely cultivated in warm climate in all over the world. In India, the commonly known as the Durva. It is commonly used as the laxative, expectorant, and the analgesic. There are 4 types of Durva mentioned in the Ayurveda. From that, only 2 are explained with their medicinal values in some Nigantus. Aim to study the type of Durva mentioned in all Nigantu and its medicinal value. Objectives: first, to study the types of Durva, to study the types of Durva from all Nigantu, to study the medicinal values of the Durva mentioned in all Nigantu. So next slide, please. Okay, this is, we can see the pictures of Durva. So next. Materials. All Ayurveda literatures like Nigantu, Adarsha, Dhanvantari Nigantu, Bhavaprakash Nigantu, Priya Nigantu, Kayadev Nigantu. Importance of Cynodon dactylon L, that is the Bermuda grass, have a variety of the medicinal properties, including the antiviral, antimicrobial activities, and it's widely used in the traditional medicine to treat the various ailments such as cancers, convulsions, cough, hemorrhage, hypertension, measles, etc. It is also used as a brain and heart tonic. It is useful against the grief in children and for pain and inflammation. The aqueous extract of the Cynodon dactylon has a high antidiabetic potentials along with the significant hypoglycemic and the hypolipidemic effects. Sorry, sir, 1 second. Next one is Cynodon dactylon is rich in the antioxidants which can help to protect the body from the free radicals damage and reduce the inflammation.
It is also good source of dietary fibers which can help to promote the digestive health and the regularity. Sir, next slide, please. Okay, thank you. This slide shows the types of durva mentioned in Nigantu. Nigantu Adarsha explain the Shweta durva and Shama durva, that only two types. Dhanvantari Nigantu also explain the Shweta durva and Gandha durva. Kayyadav Nigantu explain three types, that are the Shweta durva, Gandha durva, and Neela durva is the other type of durva. Priya Nigantu explain only the durva, but he called it as Harita Varna. So it is considered as a Harita Durva. Bhavaprakash Nigantu explain the Shweta Durva and Gandha Durva. Sir, next slide, please. Okay. This slide shows the medicinal use of Durva, Cyanidon Dactylon. Durva is the best for the booster immunity. It cures the constipation. It will purify the bloods. It cures the eye infection. It cures the bleeding gums. It is used to treatment of obesity. It controls the sugar, and it's also useful for treat the acidity. Sir, next slide. Okay, thank you, sir. Durva contains some nutrients. Nutritional value of Durva, that is the Cyanidon Dactylon. Durva grass consists of the several nutrients such as the acetic acid, alkaloids, carbohydrates, fats, cerulic acid, fibers, flavones, glycosides, hydrocarbons, magnesium, palmitic acid, potassium, proteins, phenolic acid, vitamin C, vitamin A, etc. Medicinal values of Durvas, that is the Cyanidon Dactylon. Cyanidon Dactylon is commonly used as a laxative, expectorant, analgesic. Cyanidon Dactylon improves the digestion, reduce the inflammation, and improve the blood sugar level. Third one is the Durva grass juice, helps to maintain the blood sugar level and improves the immunity. The rhizomes of the Durva, that is the Cyanidon Dactylon, are reported to act as a diuretic in human. Durva juice is an excellent detoxifier and can be consumed empty stomach to regularize the bowel movements. By Acharya Charak, Durva Swaras is used in the Nasagat Raktasav. By Acharya Shushrut in Raktapitta, Durva Swaras used with the Vatapatra Swaras. Bhavaprakash explained the Durva used in the Mudraghat. By Shodal Nigantu, Durva Siddha Tel used in the Kandu, Pama, Vicharchika. Massage with this Durva Siddha Tel reduce the itching. Sir, next slide. Thank you, sir. Discussion is there are four types of Durva, Cyanidon Dactylon, which are having their own identical marks. It is necessary to know the type of Durva to avoid the wrong cultivation. It is easily available in India so that one can able to use it in some easy way to treat the traditional disease. Collection of information about the types of Durva from the Ayurvedic literature such as the Nigantu helps to identify the original Durva, which can help to treat the daily life complaints. Conclusion, use of Durva, that is the Cyanidon Dactylon, with medicinal preparation is effective. Information about the types of Durva can improve the medicinal values of the particular type. To value the medicinal properties of Durva, that is the Cyanidon Dactylon, is the cultivation of Durva is important. References are there, Dhanvantari Nigantu by Acharya Priyavat Sharma and Guru Prasad Sharma. Bhavaprakash Nigantu by Krishna Chandra Chunekar. Priya Nigantu. Thank you, sir.
Thank you, doctor.
Thank you so
Thank you
much,
for the
doctor.
presentation.
Thank you.
So, after such an inspiring presentation, next I would like to invite Dr. Amey Prakash Sonavane for the topic Concept of Wound in Ayurveda.
Good evening, guys. Myself, Dr. Amey Sonavane, PG Scholar, Shilendra Department from Yeshwant Ayurved College, Kolhapur. And under the guidance of my HOD and guide, that is Dr. Srinivas Sulabhati sir, I am presenting a topic on concept of wound, that is Vran in Ayurveda. basically introducing the concept of Vran, which is derived from Dhatu Vru, that is Vranoti. A pathology in which there is consumption or destruction of body tissue and formation of scar after healing that remains for a lifetime is a Vran, or in our modern language we called it as a scar. Definition of Vran according to Shruti is very broad. Formation of scar after tissue destruction can be either due to extrinsic factor, that is wound, or it can be due to intrinsic factor, that is ulcer. Sites of Vran or Vranavastu or Vran Adhisthana in Ayurveda. These are mainly on basis of involvement of body structures which are categorized mainly under 8, that is Tvaka, Maunsa, Sira, Snayu, Asti, Sandhi, Koshta and Marma. Tvaka, skin, Maunsa, muscle, Sira, vessel, Snayu, ligament, Asti, bones, Sandhi, joints, Koshta is abdominal and thoracic viscera, and Marma is vital organs of the body like brain. So it means that the Vran are being categorized according to the Vrana Vastu or the Vrana Adhisthana in Ayurveda, and there are 8 stan, which is Tvaka, Maunsa, Sira, Snayu, Asti, Sandhi, Koshta and Marma. Etiology. Shushu classified Vran into categories Nij and Agantuj Vran. Of course, Nij is intrinsic cause and Agantuj is the extrinsic cause. Nij Vran caused by vitiation of basic elements like doshas, of course, that is Vata, Pitta and Kapha, Vata, Pitta, Kapha, Rakta, the 4th dosh according to Sushruta sir, and their combinations, of course, that is the Dwadash, Tradash accordingly. Agantuj Vran inflicted by humans, birds, beasts, reptiles, or due to fall, compression, or any caustic agents, or any type of injuries which is external comes into the Agantuj Vran. Now, classification of Vran. According to the etiological, there are 2 classifications, Nij and Agantuj. According to the clinical features, they are Dushta, Shuddha, Rudhyaman and Ruddha. According to prognosis, they are Sukhasadhya, Kashtasadhya, Yapya, Asadhya. According to the site, they are skin, muscle, vessel, ligament, bone, joint, internal organs and vital parts. That is, we learnt about the site, that is Tvaka, Sira, Maunsa, Asti and etc. So these were the classification of Vrans according to their etiology, clinical features, prognosis and site. Types of Nijavran. Nijavran are classified into 16 types, that is Vataj, Pittaj, Kafaj, Raktaj, Vata, Pittaj, Vata, Kafaj, Vata, Raktaj, Pitta, Kafaj, Pitta, Raktaj, Kapha, Raktaj, Vata, Pitta, Raktaj, Vata, Kapha, Raktaj, Pitta, Kapha, Raktaj, Vata, Pitta, Kafaj, Sannipataja, and that is the 16th one is the Shuddha Vran. Now, clinical features of the Nijavran. 15 types of Nijavran and their classifications on the basis of the pain, color, discharge, smell and special characters. Why 15th? The 16th one is the Shuddha Vran, and Shuddha Vran is been considered as such a Vran which is evaluated or which is totally free from all the 3 doshas, and that is why it is called a Shuddha Vran, or which is you can say very much easy to heal. So accordingly, the 15th Vrans of Nijavran are the main for the prognosis. First is Vataj, Vedana, throbbing, stretching, pricking, piercing, Varna black red, Strav is cold slimiless discharge, Gandha is pungent, other characters like tendency to crack, less granulation tissue. Pittaj Vran, of course, Vedana will be burning sensation because of Pitta. Varna is yellow blue. Some may think for red, but no, it's yellowish in color. Of course, there is a reddish tint, but mostly is yellow blue. Strav is warm light red color. Gandha is sharp, and other characters like tendency to separate, that is pus and pustules. Types of Nijavran. The third is the Kafaj. Vedana will be constant, of course, excessive and itching because Kanduj is there in the Kafaj. Varna is paler. Strav, whitish, cold, slimy. Gandha, smell like raw meat. Other characters like rigid flow. Thick margins, membranous covering of veins and ligamentous tissue. Raktaj, Vedana will be like Pittajvaran. Varna color will be coral, spots black, spots with black blisters. Strav will be blood. Gandha will be horse, like a horse table, iron like. Character's tendency to, of course, bleed. Sannipataj, which contains the whole four combinations. So the Vedna will be different kinds. Varna will be different colors. Sta will be different types. Gandha will be different smells. And other characters will, doshas are excess in it. Vata, Pittaj. So the combination will be from the Vataj and Pittaj front. Pricking and burning sensation. Varna will be yellowish red. Strav is yellowish red. And Gandha will be fried paddy smell. Then Vata Kafaj, itching and pricking sensation. Strav will be cold slimy. Gandha linseed oil. Other characters will be hard. Vata Raktaj, pricking sensations, red in Varna, blood red straw and numbness. Pitta Kafaj will be mostly burning sensation. Straw will be yellowish red. Sesame oil will be the Gandha. Pitta Raktaja, both are the characters, so that's why the Varna will be the red and the straw will be black. The smell will be like as fish which stinks in water. The characters, the Varna will be soft. Kapha Raktaja, itching, will be the Vedna. Color or the Varna color will be red shiny. Straw will be reddish pale. Other characters like slimy and fixed, because slimy and fixed, why? Because it's Kapha and Raktaj, both combinations of Kapha and Rakta both are slimy, so hence accordingly. Vata, Pitta, Raktaja, Vedna will be pricking, burning, fuming. Straw will be yellow thin. Other characters will be with pulsations. Vata, Kapha, Raktaja, Vedna will be burning, itching. Straw will be white, thick blood. Other characters like with pulsations. Pitta, Rakta, Kafaja, itching because of Kafaj and burning will be because of Pittaj, Vedna. Straw will be white, thick blood, and other characters like tendency to separate. Vata, Pitta, Kafaja, mixture of Vata, Pitta and Kafaj. Clinical features of Agantuj Vran. Vran due to injury like accidents, war, injury, trauma, blunt and sharp objects is called as Sadhya Vran. It is a type of Agantuj Vran. So basically, Sadhya Vran will be a type of an Agantuj Vran. Shushrut broadly classified wounds into 6 types, that is Chinna, Binna, Vidya, Kashta, Pichita, Grishta. Chinna will be excised in nature associated with separation of part of the body. Bhinna is stab injury, injury to the body cavities resulting in their discharge. Vidya is punctured one, body cavity pierced by a sharp pointed weapon. Shatta, that is lacerated, another excessively excised or non-excessively incised. Pichit, crushed injury, you can say, so to severe blow and pressure. Grishit, abrasion, म्हणजे घासल्यासारखं, skin peeled off due to rubbing injury. Nature of straw discharge in Vran on the basis of involvement of doshas, the site of straw. If the Vrana is at the Twakastan, discharge will be yellow, watery discharge, smell of raw meat. If the Vrana is at the mouse, thick, white, slimy discharge like buttermilk. If the Vrana is at the Sira, vessels get torn, excessively bleeding, suppuration, copious pus discharge, that is thin, slimy and blackish like frost. Snayu, greasy, thick, similar to mucoid nasal discharge. Asti, like water shell of an oyster mixed with marrow and greasy blood discharge. Towards Sandhi, if it's there, no discharge on applying pressure, discharge on sudden movements, sticky, slimy and appears as if the churned with blood. Coaster, if the Vrana is at the coaster, secretion mixed with blood, urine, fecal matter, pus and water. If the Vrana is at the marma, depending upon the involvement of the organs, will be the discharge. Prognosis of the Vran, that is the healing of the Vran, you can say. Sushruta classified Vran depending upon the prognosis into 2 types. Kritya, that is curable, and Akritya, that is incurable. Description regarding prognosis: the basis of patient age, strength, site of the Vran, nature of Vran, associated disease, nature of discharge, smell of Vran, described in Sushruta Saita. The 3 photos which I have showed in here, prognosis of Vran, like there we can see easily curable one Vran where the granulations is properly been seen. Difficult to cure ones in the second one, where with the granulations you can see the epidermal tissues, including the vital organs too. And in the yappa, that is incurable one, you can see that the gangrenous part and all the ligaments and the tissues are been exposed, but there is no any part of granulation. Concept of wound healing in Ayurveda. Ropan is the Sanskrit word which means healing, and 4 steps in healing, that is Dushta Avastha, stage of inflammation; Shuddha Avastha, stage of granulation tissue; Ruyaman Avastha, stage of maturation and remolding; Ruddha Avastha, stage of contraction. Dushta that is defined Vran in which vitiation of all 4 doshas causes chronicity of Vran, presenting with features like excessive exudates, foul smell, signs, inflammation, etc. Shuddha is that one which is free from 3 vitiated doshas or any complications, has blackish white margins due to pure blood supply, granulations tissue at surface level, and without any pain or discharge, it's said to be Shuddha Vran. Ruyaman Vran is the pigeon colored grey margin without any exudates and showing partial layer of skin epithelium. Shwet called as the Chipitika are called as the Ruyaman Vran. Ruddha Vran, whose floor has completely healed, which is not indurated or swollen or painful, and is of same color of the and of the level of the skin, is called as the Ruddha Vran. These were the four main concepts of wound healing which we learnt now. Factors affecting Vranropana. Of course, there are 11 factors: age, addiction, site, bandaging, maggots, foreign body, associated disease, nutrition, food, emotions, and place of patient. Age, of course, whenever the patient is young and healthy, definitely he will cure first. The patient, if he is old with comorbidities, he will the prognosis will be delayed. Addiction, if the patient is having addiction of any sort of alcohol, definitely the dealing will be delayed. Site, that is the Tuaka Mounts Sira, it depends. If the wound is at the peripheral level, it will heal faster, but if the wound is deep towards the organ, towards the mount, towards the Sira Snayu, it will take time. Bandaging, definitely the dressing which we does depends. If the dressing is good, daily dressing is done, then the wound may heal faster. If the dressing is not good, dressing if it's not done daily or not done on time, the wound may heal slow. Maggots, to any diabetic patient or some, and whenever the wound is not being taken care properly, not hygiene, no hygiene is not maintained, maggots starts appearing there, and wound healing delays. Foreign body, definitely whenever a wound is there on a body, we should avoid for any foreign body contact. Associated disease such as diabetes, BP, the most probably diabetes, it's deaccelerate the wound healing. Nutrition, whatever we take in the food always accelerate the wound healing, so that's why balanced diet is needed. Food, balanced diet, as I said. Emotions, definitely while wound healing, you should never be krodhit. Why? Because it accelerates your pitta, and any types of wound which is having pitta, it will take time. Place of patient, that is called
Thank you, Dr. Amey. Next, I invite Dr. Nidhi Kamble for the paper presentation. It is a case presentation. Dr. Nidhi, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes, sir.
Hello, Dr. Nidhi. Hello, Dr. Nidhi. Can you hear me? Hello, Dr. Nidhi. Please unmute, doctor.
Hello. Hello, is my screen visible?
I will share for you, doctor. And please start the session, doctor.
Yes. Can I start now? Hello,
Please,
am I
please
audible?
start, doctor. Please start, doctor.
My case presentation is on varicose vein ulcer. So I will present it. A male patient of age 52 years of complaint in a left leg over 12 years. The pain was gradual in onset and progressive in nature. The patient also present with an ulcer in a left leg for 9 years, which occurs spontaneously after laser therapy. It was gradual in onset and progressive in nature. At first, it was small in size and gradually increased in size as time progressed. There is no history of trauma. There was pain around ulcer. The discharge was seropurulent in nature. He is non-smoker, non-alcoholic, and not having any other kind of addiction. The patient is a hotel management worker. His occupation requires him to stand for prolonged period of time. Environment he was living had extreme weather, that is summer and winter. Past history, there is no history of similar illness in past. There is no history of hypertension, diabetes, or any other serious illness in past. There is a medical history of his laser therapy. Family history, grandmother having history of varicose vein. Medication history, he also took medication tablet paraferin 4 mg, 5 mg alternate days in 7 years. Allergic history, patient is allergic to sulfa drugs and contactants such as cement. General examination, his pulse is 80 per minute, mal prakrut, mutra prakrut, jiva niram, sparsha khara, druka, proper vision, akruti, medium build, Shudha Prakrut, Nidra improper, his weight is 60 kg, BP 130/90, and Prakruti was Kapha Pitta. He had history of TVT, history of varicose vein, he had taken laser therapy in 2013. Also, the pulmonary embolism developed at 2018. Patient taking tablet warfarin. Recurrent pulmonary embolism, severe pulmonary hypertension, CT pulmonary angiogram. These are investigation done along time. Local examination showed a single large ulcer present on the dorsum of the left lower foot at medial malleolus, irregular shape surrounding with small ulcers. Margins were inflamed and edematous. Edges sloping and punched out. Skin around ulcer is hyperpigmented. Systemic examination RS is clear. CVS is S1S2 normal. CNS conscious and oriented. This was the present picture when patient was admitted on day 1. I have made this chart of signs and symptoms: pain, discharge, burning sensation, itching, foul smell, having gradation from 0 to 3. Hetu, I have considered here hereditary beach dosh, which is most important. Long distance walking, prolonged period standing, excess heavy weight lifting, sardi wake udiran, contact with air conditioner. His diet contained milk, egg, tea, chapati, curd salad, grilled food, flavored milk, yogurt, frozen food, corn, vinegar, dry fruits, and packed food. which leads to dushi vishvruddhi, prabhud kled, raktadushti, abhishanta. These are srotas drushti, anvah srotas, rasavah, raktavah, mausa, med, and svedvah srotas drushti occurred. Samprapti comes with exercise, long time standing, long distance walking, hanging, beach dosh, which affects rasa, rakta, mausa, med, dhatukshay, leading to sira tanuja, that is rakta उपधातू, शिरा कौटिल्य, रचनात्मक विकृती, रक्तसंचिती सातत्याने विस्त्रावर and त्वचेमध्ये रक्तसंचिती. This is specific संप्राप्ती according to dosh, वात, पित्त, कफ. In Vat, Dhatukshay, Vata Prokop, due to Laghu Ruksha Guna, Shira Tanuta, Shira Kautilya. Pitta Gun are Ushna Tikshna Amla Lavana, which causes Vaivarnya, Daha, Kandu, in leading to Sira Bhitti Saurambha, causing Osha Chosha Strava. Kapha Dosh, Amla Lavana Drava, Abhishandi, Kled Pradhanta, Rasarakta Mausa Med Vidagda Dishti, Dhatu Shaitilya, Pratikar Shakti Kami of that specific Dhatu, creating Pitika, Utsed, and Puya Pravrutti, causing Pidaka. This was all treatment plan given all over days. Panchavalkaladikvat, Dhawan, Trifala, Musta, Lodra, Khadir, Churna, Panchavalkal, Panchatikta, Trifala, Shilajitvati, Musta, Trifala, Yashtimadulep, Nimba, Vasa, Bilva, Kalka, protein powder, Sukshma Trifala, Gandak Rasayan, and Madhimalini Vasanta. Local treatment at the site of a wound, Dhawan Karma was done with Panchatikta, Panchavalkal, Trifala Kashay daily for twice 20 minutes. After Dhawan wound was dried, then Kalka was applied consisting Nimba, Vasa, Bilva for duration all overnight. It contained Guduchi, Nimba, Kantakari, Patol, Vasa, having Rasavirya, Vipak, Guna, and Doshaknata was Tridosh Shamak, Kafavatahar, Kafapitta Shamak, Kafapittahar. Panchavalkal is a drug with Kashay Ras. By its action of rasa, it acts as tambak. It also acts as tvaka prasadan, also act as rakta shodak, pitta shaman, varnya, vranaropan. Antioxidant protect the tissue from the oxidative damage. Tannins, phytosterol, and flavonoids are anti-inflammatory. Vitamin A and K are essential for epithelialization, promoting skin repair. Also act lekhan kledhar karma, chedan, rakta shodak properties of kashay ras will also facilitate the defibrillation of slough. Nimba, Vasa, Kalka, having rasa tikta kashay, virya sheet, ushna, vipak katu, and doshagnata, ruksha tikshna. The ingredients present in Nimbadi Kalka are having tikta and kashay rasa, reduce inflammation, excessive exudation, acts as speedan and kled upashoshan, krimigna, kandugna property, act as antimicrobial, yogvahi gun, lekhan, chedan gun, ushna virya gun, helps in penetrate action to clean the wound. Yashtimadu musta lodra lep has property of tikta, kashay rasatmak, vaka prasadan, rakta prasadan, kleda shoshan, dahasham. Also use Silajit acts anti-inflammatory action. Humic acid solution improves speed of wound healing. Silajit can affect skin health by stimulating endothelial cell migration and growth of blood vessel. Laghu Ruksha pacifies the kapha and vata dosha, whereas Kashay detoxifies the pitta, also have positive effect on various dhatus such as Rasa Rakta Mausa. Madhumalini Vasanta, main drug is Hingul, act as regenerator, enhance body strength, very useful in muscle weakness and enhance muscle growth. Yashad, muscle holds zinc 49.5%. It aids the protein synthesis, which helps in skin and muscle repair. Gandak Rasayan is also very useful, acts as Yogvahi, Daha Shamak, Jantugna, Vishagna, Pitta Shamak. Sukshma Trifala, it contains Kajjali, acts Yogvahi, Sukshma, it penetrates deep down into Sukshma Strotas and help in Strotoshodan. Panchavalkal Kwat was given orally, which act as Rakta Prasadaniya. Protein and vitamin C supplements were given. Protein useful in proliferative phase of wound.
repair collagen deposition in crucial to increase the wound's tensile strength. Protein is a vital in synthesis of enzymes and creation of connective tissue, capillaries, and epithelial cells. Amlaki is a valuable source of antioxidant and their phytochemicals and flavonoids keep artery wall healthy. Dietary supplements were included whole grain, pulses, lentils, and high protein diet, and fruits such as rich in vitamin C source. Before and after gradation were calculated, which decreased significantly. Healthy granulation was formed within 15 days, and wound healing process was seen. Patient was admitted for 90 days. Discharge was stopped. Pain, itching was totally recovered, and wound size also got small within 90 days. Regular dressing was done. Wound was kept clean, and
Hello,
all
doctor.
about treatment was followed.
Hello, doctor.
Yes, ma'am.
Doctor, you are exceeding the time limit.
Okay, it's finished. Last slide only. These are results photo from first day, during treatment, and after treatment. Thank you.
Thank you, doctor, for this wonderful presentation. And next, I would like to invite Dr. Bhagyashree Mahadev Chavan.
Yes, ma'am.
Good evening, doctor.
Good evening, ma'am. Please share my poster presentation.
Yes, doctor. Just a second.
Doctor, please start the patient, doctor.
Good evening, everyone. Myself, Dr. Bhagyashree Mahadev Chavan. I am second year PG student in Shalyatantra. We will discuss about prevention and management of the renal calculi. Kidney stones, also called as the nephrolithosis. Kidney stones are hard deposit of minerals, acid salts that stick together in concentrated urine. They are painful when passing through the urinary tract. Types of stones: calcium oxalate stone, calcium phosphate stone, struvite stones, uric acid stone, cystine stone. Kidney stones are usually diagnosed by X-ray KUB. Ultrasound are the most commonly used test for detecting the kidney stone. CT scan are the gold standard imaging, accurately diagnosing kidney stone. CT scan provide higher resolution image than the ultrasound. MRI, the sensitivity of this MRI at 82% in higher than that of the ultrasonography and KUB radiography, but less than the CT scan. Let's see about the management of the stones. Urinary system consists of kidney, ureter, and bladder. First of all, we will see renal stones. It is hard deposit made of minerals and salts that form inside the kidney called as kidney stone. If the stone size is less than 0.5 centimeter and there is no hydronephrosis, no distal obstruction, no infection, then we can give conservative management. ESWL means extracorporeal shock wave lithotripsy. It is a procedure to break up stones inside the urinary tract. Indications for ESWL: stone size less than 2 cm, calyceal stones or pelvic stones, no distal obstruction, and there is no infection. PSNL, percutaneous nephrolithotomy. In this procedure, kidney stones are removed by taking small incision in flank under J. Indications for ESWL: fail or contraindicated. There is a cystine stone size greater than 2 centimeter and urinary obstruction. Then we will do PCNL. Open surgery. Those stones are contraindicated for PCNL and ESWL. Undergo open surgery. Ureteric calculi. Ureteric calculi, presence or formation of the stones within the ureter called as the ureteric stone. Conservative management as above, like kidney stone. Intervention: if the stone size greater than 0.5 centimeter, hydronephrosis are present, persistent abdominal pain, secondary infections, and contraindicated for conservative management. If stones are smaller than 1 centimeter, we can do ESWL, and greater than 1 centimeter, open surgery can be. Open surgery, ureteroscopy. It is a procedure in which that the kidney stones as well as urethral stones, it is done with the help of the ureteroscope, a long thin tube with the eyepiece on one end and light on another end. Urinary bladder calculi. Urinary bladder calculi, cystoscopic lithopexy. Crushing the bladder stone using telescope instrument if the stone is less than 2 centimeter. Open surgery called as cystostomy. Remove the bladder stone in men with very large prostate if the size greater than 2 centimeter. Stones are multiple in nature. Stones are very hard in nature and failure to crush. Then we will discuss about urethral calculi. Prostatic, proximal to narrow membranous portion. Prostatic calculi are classified as exogenous and endogenous depending upon the point of origin. Metal boogie is thin cylindrical rod inserted into the body passage to diagnose or treat a condition. It is made up of the rubber, plastic, or metal. Open surgery is required when emergent stone clearance is necessary or when the stone size exceeds 4 centimeter in diameter. Cystoscopy is used to diagnose and treat condition affecting bladder, urethra, and small. Open surgery is done with the partial incision. Penile, there is no need of surgery. Fossa navicularis or meatus, genital milking or meatotomy is a simple procedure. Widen the meatus. It is the opening at the tip of the penis. The enlarged distal portion of the spongy urethra. Then we will discuss about the what to do, what to have, avoid. What to have: green tea, coffee, water with lemon, lime, orange slices, banana, papaya, raw red, yellow pepper, kale, bok choy, and broccoli. And avoid high oxalate foods like potatoes and yams, beets, raspberries, dark chocolate and cocoa powder, black tea, buckwheat, wheat bran, beans, nuts, seeds, tofu, miso, and soya foods, spinach, salty and sugary foods, cold cuts, and other processed meats, grapefruits, juices, more than 500 mg calcium, 2000 international unit of the vitamin D, and 500 mg of the vitamin C supplement a day. Thank you.
Thank you, Doctor. So next, I invite Dr. Sumedha Vinod Birdse. I invite Dr. Sumedha Vinod Birdse. Dr. Sumedha.
Hello. Yes, ma'am. Am I audible?
Yes, doctor.
Yes. Can you please share my screen?
Sure, doctor.
Doctor, please start the session, doctor.
Good evening. Myself, Dr. Sumedha Bedse, and my today's topic is Pathya effect of Ashtaguna Manda in Navajwara. At first, I would like to give an introduction. So, Jwara is caused by Mandagni, as we all know, and it is the symptom of other diseases. So, Jwara is also a disease and a symptom of other diseases. Even after it subsides, Mandagni persists and causes aruchi, balavarna, hani, and Angamardha. So Langhana is considered as the first line of treatment in Jwara. So according to that point, Langhana, I've decided to use Ashtaguna Manda in Navajwara. So Ashtaguna Manda is a food which has property of Deepan, Pachan, Langhan with Dosha Hara, Jwara Hara and Rakta Shodak gunas. So Ashtaguna Manda can be given to correct Agni. Hence, it treats Mandagni and other symptoms along with increasing strength of patients. So first of all, sample description. So 20 patients enrolled from OPD of Department of Swasthya Yoga and also Kayachikitsa fulfilling the inclusive and exclusive criteria. So my study is interventional open single arm study, and under the inclusion criteria above 18 years of age, the temperature, fever temperature between 99 to 102 Fahrenheit, and which the one had a history of Jwara for 1 to 3 consecutive days. And under the exclusion criteria, diagnosed case of bacterial origin Jwara, having the positive reports, and also known case of DHF, malaria, and also the Jwara in which associated with nausea and vomiting. I have excluded all those patients. Also, the second one is complaints. So according to Samhita, patients had Jwara as a primary complaint since 1 to 3 days. I have taken those patients. And Chikitsa Sana Jwara Chikitsam, the shloka including the symptoms of Jwara like Santapa, Saruchi, Trushna, Angamarda, Rudivyatha, Alasya, Nayana Sastra, Jrumbha, Gaurav, Klama, Jwalanatapa, Vayu, Ambu, and Bhakti Dvesh, Annadvesh, Avipaka, Asavairasya, Hani, Balavarnasya Hani, Shila Vaikrutam, Alpamcha, Jwara Lakshanam, Agrajam. So I have taken all those complaints as a subjective criteria. So baseline findings according to the symptoms, I have mentioned in the chart, like Aruchi, Trishna Angamardana, Ridhya Vyatha, Alasya, Nayana Srava, Jamba, Guruta, Klama, Jwalana, Atap, Vayu, Ambudvesh. All those symptoms may not present in one person, but according to the sample, I have recorded the percentage of symptoms finding. Then also given the investigations for CBC, smear for malaria parasite, which I have already excluded, and typhoid also. Then the main treatment plan is Ashtaguna Manda. So in the process of Manda, we have to take the 4 times of water of the material. So this is the Sharandar's reference I have used. Ashtaguna Manda was given to the patient according to their appetite for 2 to 3 days. For 7 consecutive days. So it contains Dhanyak, Trikatu, Sindhu, Mudgala Tandu Yojita, Brushta, Hinguteilabhyam, so Mando Ashtaguna Smritaha. So its property are Deepana, Pranadav, Basishodhana, Raktavardhana, Jwarajit, Sarvadoshagno, Manda Ashtaguna, Guna Uchate. So in the Falashruti of Ashtaguna Manda, they have mentioned the Jwara also, and also Sarvadoshagno. Also, it is a Deepan Pachan, so it definitely works on Mandagni. I've also given the bibliography references from the Sharangar, Yogratnakar, Charak, Sushruta and Bhavaprakash Nigantu. The result I've recorded under the columnar graphical form, where I've given the temperature before treatment and after treatment, also the vitals like pulse before treatment and after treatment, and also the effect of Ashtaguna Manda according to the subjective parameters, that are the symptoms I have already told, Aruchi and all. So in the discussion, according to each Dravya, their Rasa, Vipak, Virya, they've totally proven against which reduce Mandagni. So Tandula, therapeutic action of Tandula is Rochak and Bruhan. Then Mudga is Jwaragna. Dhanyaka is Deepan, Pachan, Rochan. Srota Shodaka, Jwara, Trishna, Daha, Kash, Nashaka. Pipali is Deepan, Rochan, Yogvahi, Jwara, Kasha, Swarshanasaka. Shunti is also Deepan, Pachan, Rochan, Ridyakna. Maricha, Deepan, Rochan, Shoshan, Swash, Kushta, Nashak. Hingu is also Deepan, Pachan, Rochan, Anulomani. And Sandhav is same Deepan, Pachan, Rochan, Swadu, Hridaya. And Tila it is the balya, which is also act as a gruhan, but also Deepan Varna. So the main point is Langhana is considered so first treatment of the Jwara, and that's why I've used Ashtaguna Manda and concluded that Ashtaguna Manda can be used as the sole dietary intervention in the management of Jwara. So here it is my presentation. I'm done with this. Thank you so much.
Thank you, Dr. Sumedha, for the well-explained poster presentation.
Thank you.
Next,
Sir.
I would like to invite Dr. Pooja Pradeep Sanvatsarkar for the paper presentation. Dr. Pooja Pradeep, are you there?
Yes, sir.
Okay, doctor. Good evening,
Sir, will you
doctor.
please share? Yes, good evening. Good evening, sir. Can you please share the screen for me?
Sure, doctor, just a moment.
Yes.
And Dr. Pooja, please start the session, doctor.
Yes. So, good evening, everyone. Today's topic of presentation is cosmetology and Ayurveda. Myself, Dr. Pooja Samvatsarkar. I am PG student of Dravaguna Vidyan from Sumtibai Shah Ayurved Mahavidyalaya, Pune. So, what is cosmetics? According to Drugs and Cosmetics Act 1940, cosmetic is any substance intended to be rubbed, sprinkled, poured, or applied to human being for cleansing, beautifying, and promoting attractiveness. Cosmetology is the study and application of beauty treatments. So, next slide. What Ayurveda says about cosmetology. So, human body works through various channels, which includes micro as well as macro structures, which is known as a srotas in Ayurveda. Various psychobiological processes are carried out with the help of these channels, which helps in maintaining the wellness and beauty of the body. Diet and lifestyles are the two main things which helps in achieving beauty as well as good health. Next slide, please. What is beauty according to Ayurveda? Beauty, Ayurveda has given many parameters like Prakriti, which means body constitution, Sarata, structural predominance, Samhanan, that is compactness of the body, Tvak, that is skin complexion, Praman, that is measurement, and Dirghayu Lakshan, that is symptom of long life. Beauty according to Ayurveda is not just a skin complexion, but it has many more parameters. Beauty management through diet and nutrition, Manasa Bhava, mode of life, and Rasayan Chikitsa. What Ayurveda speaks about cosmetology and where. Ayurveda has given many information about cosmetology in Dinacharya, Ratricharya, Rutucharya, and Garbhopghatakar Bhav in all the three Samhitas, Bruhatrait, in various topics. How we follow these, all these has impact on our beauty. So, दिनचर्या दंतधावन, मुख प्रक्षालन, गंडूष, अंजन, तांबूलपत्र सेवन, प्रसादन, छत्रधारण, that is using umbrella, संवाहन, अभ्यंग. Next slide, please. शिरोभ्यंग, पादाभ्यंग, उद्वर्तन, उद्घर्षण, उत्सादन, अनुलेपन, मुखालेप, and gandhamala. These all things to be followed in dinacharya can help us for maintaining the beauty according to Ayurveda. Next slide, sir. Rutucharya, all the Rutus have different things to be followed. Like in Hemant Rutu, massage, anointing, oil massage on the head, that is Mudni taila, heated rooms, and sunbath is to be followed. In Vasanta Rutu, as it is quite cold, so we have to follow physical exercise, Udvartan, herbal smoking, that is Dhumapan, gargling, bathing with the warm water, applying chandan and agaru on the body. In Grishma Rutu, that is which is summer, apply chandan paste and pearls and gems should be worn. Varsha, rubbing, anointing, use fragrances and garlands, wear light and clean clothes. While in Sharad Rutu, Hamsadaka for bath, drinking and plunging, moon rays in nights, seasonal flowers, garlands is advised. Next slide, please. Enhancement of beauty. Ayurveda has given various things to be followed, and
It's like not only the skin care, but it has given hair care, that is Kesha, eye care, Netra Prasadan, herbs for acne, that is Yuvan Pidaka Nashan Yoga, foot care, that is Vipadika Hara Yoga, deodorants or perfume, that is Gandha Dravya, mouth fresheners, breast growth enhancers, that is Tranavriddhikar and Dardhakar Yoga, post pregnancy stretch marks removal, that is Kikvisahara Yoga, cosmetic correction of scar tissue, that is Krishnikaran and Pandu Karma, cosmetic surgical correction, that is Sandhana Vidhi, which is from Shadvida Upakram, given by Sushruta. We are going to see that in next slide. Next slide, please. Varnya. Applied Varnya Karma is applying of paste, oils or herbal powders externally. It is done. Lep is of three types: lep, alep, and pralepa. Healthy skin totally depends on quality of Rakta Dhatu, Ojas, and Pitta dosha. Acharya Charaka has mentioned Varnya Gana in the Shimani Ganas, which means the group of drugs that helps in enhancement of skin complexion. Next slide, please. Varnya Mahakashaya. These 10 drugs are given in Varnya Mahakashaya, which really helps to improve that skin texture and complexion. Shweta Chandan, Nagkeshar, Padma, Kushir, Madhuk, Manjishta, Sariva, Payasya, Sita, and Lata. That these two are Dhruva Prakar. Next slide, sir. Krishnikaran, that is blackening of the scar tissue using bhallatak oil with ash of hoops and hoops of domestic and marshy animals. Next is Pandu Karma, whitening of the black scar tissue by applying paste of Rohini fruit with goat's milk, powder of Vidula and Sarja, Kasisa and Madhuka with honey. Next slide, please. Garbhopaghatakar bhav, the behavioral patterns or emotions in pregnant women that causes fetal abnormalities, like for example, fish diet, stiff eyes in offspring, pork diet, offspring have red eyes and very rough body hairs, consistent sweet diet causes diabetes and obesity, sour diet leads to eye and skin diseases, salty diet can cause gray hairs, baldness, and early wrinkles. That means whatever is ate by the mother can effect in the offspring. So the diet, the concept of diet should be followed from the mother only. Next slide, please. What happens if the Rajaswala Paricharya is not followed by the girls? Collyrium makes the child blind. Weeping, that is defective vision. Oil massage causes leprosy in offspring. Sparing of nails, that is bad nails, called as a punakhi in Ayurveda. Laughing too much, that causes child with black colored teeth, lips, palate, and tongue. Combing of hairs, child will be bald. Daurud avamana, if the daurud is not followed by the pregnant woman, that is not fulfilling the desire of pregnant lady. And vata prakopa causes kubja, khanja, vamana, jad, and vikritaksha and anaksha in the offsprings. Next slide, please. Rasa, Rakta, and Mansha Dhatu plays major role in maintaining the healthy skin. Rasa Dhatu supports all the tissues of the body and keeps skin healthy, while Rakta Dhatu detoxifies skin by removing toxins through the body, and also it is associated with the liver functions. Mansha Dhatu provides firmness to the skin. Anti-aging treatment given in Ayurveda is like Urjaskara and Vadihara. Urjaskara is like you give the medication to maintain the healthy skin, and Vadihara is dravyas are given according to Vyadhi. Tridosha balance. To keep the skin healthy, we have to maintain the Tridosh balance. So, according to this, Kapha proper moisture balance, Pitta Kapha proper moisture balance, Pitta chemical and hormonal reactions, Vata is circulation of blood and nutrients. Next slide, please. For the Vata, when the Vata Prakopa is seen in the skin, we should use nourishing and hydrating products. That also warm oil massage and moisturizer should be used. For the Pitta dominant skin, good sunscreens, face oils, and sun exposure should be mostly avoided. Kapha skin, daily massage by warm oils and skin cleansing, exfoliation should be done. Next slide, please. Kesha Dravya. Kesha Dravya is a group of drugs that help in maintaining overall health of the hair. Strength, texture, growth, color of the hair is enhanced with the help of these drugs. For example, Bringaraj, Narikel, Til, Nilini, Hastidantamashi. Next slide, please. Kesharanjan Dravya, drugs that improve texture and gives proper color to the whitish hairs are Kesharanjan Dravyas, Bringaraj, Shikekai, Ritha, Nilini, and Amalaki. Next slide, please. What is hair? The drugs that are used for hair removal are known as Lom Shatan drugs. Bhallatak oil mixed with the latex of Snuhi can be used for this. Ash of Kadali and Dirghavritta Bhasma, orpiment salt and seed of Shami pounded with the cold water can be used for the Lom Shatan purpose. What is Rom Sanjanan? It helps in the regrowth of the hair. Ash of elephant tusk and Rasanjan mixed together. Also, Kasi's young leaf of Naktamala pounded them with the juice of Kapitta can be used for the Rom Sanjanan purpose. Next slide, please. Netra Prasadan. Eyes are important element when cosmetic is concerned. So Ayurveda has mentioned 5 types of Anjana to glorify its beauty. Also, the Chakshusha Dravyas are given in Ayurveda are Mamira, Yaranga, Chakshusha and Katak. Next slide, please. Yuvana Pidaka Nashan, that is acne treatment. So Vachalodra, Saindhava, Sarshapa, Dhanyak, Vachalodra, Kushta, and many yogas like these are given in the Granthas. Woman is the best treatment for Yuvan Pidaka with kapha predominance cases. Post-inflammatory scars can be cured with the help of these yogas. Next slide, please. Vipadika Hara Yoga. Vipadika is characterized by the presence of cracks that uneven the skin and make it rough, dry, scaly. The palm and the sole region. Vipadika Hara Yogas like Gorak Mandi Grut can be used in such a cases. Next slide, please. Sarunaka is type of dry eczema, commonly known as a dandruff at the scalp. Exfoliation or scaling is observed on scratching. Papules are rough with no discharge. Sandalwood and lemon juice emulsion can be used for this instead of shampoo for hair wash. A past prepare of Haritaki, Churna and Amalak Falasti with milk should be applied on the scalp for the hair wash. Next slide, please. Gandha Dravya. The Dravyas or the drugs which relieves the bad body odor are known as Gandha Dravya. That can be used for dhupan purpose like Shweta Chandan, Kumkum and flowers like rose and jasmine can be used for this purpose. We can also use perfumes or apply the paste, and Arga Kalpana of these Dravyas can also be used. Next slide, please. Stanavriddhi and the Adhakar Yoga, formulation that helps in proper development and tightening of the breast. Actually, we can see that in these times market preparations are available, but our Granthakars has already given this. Methi Modaka, Saubhagya Shunti, Mundi Tel Nasyam, Shirparani Tailam, and Marichadi Tailam application can help in enhancement of the breast. Next slide, please. Kikvi Saharayog, post-pregnancy stretch marks is the commonest problem faced in pregnant women's post-pregnancy. So Ayurveda has given some formulations for this. Shweta Chandana and Mrinala Lepa, Dhataki Shirisha Sarshapa Ushira Lepa, cosmetic correction of scar tissue. Sushruta propounded 8 unique measures to overcome this, like Utsadana, Avasadana, Mridvikarana, Darunikarana, Krishnikarana, Pandukarana, Roma Sanjanana, and Roma Shatana. Next slide, please. Discussion. Beauty in Ayurveda is not limited to the mere external appearance of the skin, hairs, etc., but it's a reflection of harmony between healthy body and mind. Ayurveda has its own broad aspect behind the term beauty. Since Vedic period in India, significant importance has been given to the different therapies of methods to promote beauty, attractiveness, and charming appearance of the body. Various ganas are mentioned specifying Varna Karma of those groups of drugs such as Varna Mahakashaya by Charak Samhita and Ashtang Samgraha, Lodradi and Eladi Gana by Sushrut Samhita and Ashtang Hridaya and Sangraha. Though there is slight difference between the authors regarding this list of drugs. Next slide, please. Ayurveda has not only given the medications to enhance the overall beauty, but also has provided the habits to be included in daily routine so that it makes you look and feel good inside out. Modern science says healthy gut is responsible for healthy skin, which was already told by our acharyas years before while talking about the importance of Yogya Ahar and Vihar, which further promotes healthy rasa, raktadi dhatus, and skin in return. Cosmetic, as defined by the Drugs and Cosmetic Acts, include any article intended to be rubbed, poured, or sprinkled, sprayed on, or introduced into, or otherwise applied to the human body, uh, or any part thereof for cleansing and all. As Ayurveda believes that all the living beings that have the Pancha Mahabhuta as its components, the same for the skin. It is the seat of Sparshana Indriya. So, skin is also the dwelling of the Bhrajak Pitta and regulates the temperature of the living body and absorbs all the local medicinal applications. Cosmetology as external beauty has gained a lot of attention and demand in today's world. Ayurvedic cosmetics can use safely with minimal or no adverse effects. It clearly removes toxins, waste, and impurities from the body. The human body responds extremely well to the natural substances, while it has an inbuilt resistance to synthetic ones. Hence, cosmetology practices using Ayurveda medicines and procedure is the need of today's era. Thank you.
Thank you, Dr. Pooja, for the wonderful presentation. Next, I invite Dr. Tejesh Dhanraj Malbhage for the paper presentation. Dr. Tejesh, are you there? Dr. Tejesh Dhanraj, are you there? Dr. Tejesh Dhanraj Malbhage, are you there? Okay, next I invite Dr. Priyanka Balsavi Bange for the paper presentation. Dr. Priyanka Bange, are you there?
Yes, sir. Am I audible?
Yes, Doctor, audible. Good evening,
Can
Doctor.
you please share my paper presentation PPT, please?
Sure, Doctor, just a moment.
Okay.
Doctor, please start the session.
Yes. Good evening, all. My name is Priyanka Balasab Bhange, PG Scholar, Sanskrit and Yoga. MAM Sumati Vaishya Ayurved Mahavidyalaya, and my guide, Dr. Ramesh Ujjwale, HOD Sanskrit and Yoga. My topic for paper presentation is the role of Pitta Pitta in the management of Amla Pitta. Introduction. Amlapitta is a disease which is commonly found in almost all parts of the world. Amlapitta is a disease of Annava Srotas. For Annava Srotas, Agni plays an important role in development of disease. Roga Sarvahi Mandagni, stated by Acharya, here Mandagni is responsible for development of Amlapitta. Due to Visheshan of Agni, Prakrut Pachak Pitta Avastha gets converted into Vikrut Pachak Pitta Avastha, give rise to the Amlapitta. Due to alteration of food habits, changing lifestyles, addition of drugs, night culture, and mental stress hampers the process of digestion. Hence, disease like Amlapitta produce. In present era, the role of Patha Apatha are very important. Patha is referred to the Ahar and Vyahar, which causes specification of disease, where Apatha is referred to the Ahar and Vyahar, which causes aggregation and complications of diseases. According to Yogaratnakar Shastri, Ahar, food, Aushadhi, medicine, and Patha has some importance during treatment. As per him, if we take medicine and doesn't follow proper Patha, then disease got increased. Next slide, please. Aim and objective to understand the role of Patha and Apatha in Amlapitta. Next slide. Materials definition. Amlaguna udriktam pittam amlapittam. When there is increase in amlaguna of pitta dosha, the condition is called as amlapitta. Nidan panchak. It is a disease of Annava Srotas. The dietary factors plays a predominant role as etiological factor. Aharaj hetu, guru, abhishandi, ati ushna, parushit ahar, adhyashana, ajirna, anshana, viruddhashan, kulatha, dahi, Lavanras, Amlaras, Katuras are responsible for the formation of Pittash Vyadi. Viharaj Hetu, Vek Vidharan, Diva Swap, Atap Sevan, Ratri Jagran, Ushna Sevan are included in Viharaj Hetu. Next slide. Mansik hetu. These hetu also play an important role in the production of Amla Pitta. Chinta, Krodha, Bhaya, Shok, Dvesh, Matsar are included under Mansik hetu. Samprapti. Kashyapa explained that the Nidan causes the dosha prakopa, especially Pitta dosha. Here mostly Amla and Drava Gunatmak Pitta increase. This leads to the Mandagni, vitiation of doshas situated near Amashay. Here formation of Amavisha takes place due to Amvisha. Ingested food becomes Vidagda and Shuktibhav. This Vidagda and Shuktibhav food create Amlata in Amashay and travels all over the body, produces symptoms according to the involvement of dosha and gati. Next slide, please. Patha and Apattha in Amlapitta. Acharya Charak stated that the Ahar and Vyahar, which is beneficial and nutritional to the body and also gives the happiness to the mind, is known as Patha, and opposite to that is known as Apattha. Patha for Amlapitta disease mentioned in Sahitas by various Acharyas. Annavarga, Yava, that is barley, Godum, Puranshali, Mudga, Kshiravarga, Godugda, that is cow milk, Kshakavarga, Patola, that is bottle gourd, Kushmanda, white gourd, Phalavarga, Dadim, pomegranate, Amalki, gooseberry, miscellaneous, Khanda Sharkara, that is stone sugar, Puran Madhu, old honey, Gogrit, and Narikelodak, that is coconut water. Next slide. Abatta for Amlapitta disease mentioned in Sahitas, Annavarga, Navanna, that is new rice, Masha, black gram, Kulatta, horse gram, taila, Jalavarga, Dushit Jal, polluted water, Sheet Jal, Madhyavarga, Nutan Madhya, Kandavarga, Aluk, that is potato, Kshiravarga, Dadhi, Avikshir, that is goat milk, Navaguda, Jaggery, Mansvarga, Masya, Anupmas, meat of marshy and animals. Common things to be avoided: excessive use of spices, chilies, and other eaten substances in food. It is good to consume little less quantity of food, which facilitates the action of Pachak Pitta, which will help to control the formation of Ama. Consumption of incompatible food items, that is Viruddhahar, should be strictly avoided. Since it is considered to be the chief etiological factor of the disease, it is better to avoid excessive water intake after consuming food, as it interferes with the concentration of digestive enzyme and slows down the digestive process. Next slide, please. Discussion. According to Charak, the food and drinks which are useful for the body channels are termed as Patha. On the contrary, those having a deleterious effect on them are Apatha. If a person follows the rules of Patha for particular disease, there is very little significance of drug treatment, and when a person exposed to a Patha, then drug treatment has no value, as Patha Sevan has been mentioned in classics as equally important as Aushad Sevan and as effective measure in prevention of disease and prevention of complications of diseases. Thus, for a person of Amlapitta disease or whom with a family history of similar other diseases can be advised the daily uses of a diet enriched with Yava, Godum, Puranshali, Mugdayush, Laja Sattu. These can be considered as those having similarity in their gunas like Deepan, Laghu, Pittahara, Vatanuloman, which are opposite to as that of Ama and Pitta. As these are cost effective and easily available, they can be advised for regular uses by which Pitta can be maintained in its normalcy, and in turn Nidan Parivarjan for the above said Amla Pitta, formation of Ama and Vidagda Pitta Prakop can be prevented. Next slide. Conclusion. Ayurveda does not regard Amlapitta as a disease that can be treated by mere medicine or by dietary regime, though it is a yapya, not totally curable, difficult to cure disease. The prolonged use of the above pattha along with treatment procedure will not only generate the person free from Amlapitta but protect to live a long life, Dirgha Jivanam, healthy Sukhayu, and will be useful to the society, Hitayu. Thank you.
Thank you, doctor. Next, let me invite Dr. Purushottam K.
Yes, madam. Yes, madam.
Good evening, doctor.
Good evening, madam. Hello.
Please wait, doctor. We will share soon.
Okay, okay, madam.
Doctor, please start the session, Doctor.
Yes, thank you, sir. Myself, Dr. Purushottam. I am presenting the topic Pratinidhi Dravyas. I am from RSBK department, ALN Rao Ayurveda Medical College, Koppa, Chikmagalur, Karnataka. Next, please. Concepts of Pratinidhi Dravyas. Nowadays, it is very important and most research topics. Substitutes are important in pharmaceutical and therapeutical approach in present scenario due to lack of availability of raw materials and extent of some species. We find explanation about Pratinidhi Dravyas from Vedas to modern era. Acharya Vagbhata explained during pharmaceutical of yoga, Pratinidhi Dravyas are used having similar properties such as rasa, guna, virya, vipaka, etc. The term abhava Pratinidhi is mentioned in Sharangadhara Samhita. So, next. In first chapter 54th Prathama Kanda of Sharanga Samhita, we found that detailed explanation of some of the Pratinidhi Dravyas which are mentioned by Sharanga Samhita, and the physician can also stated that to remove or replace the appropriate drug during the formulation of the compound. Abhava Dravya is well explained by Bhava Prakasha as Anekarata Nama, Abhava Varga by Yoga Ratnakara, and Abhava Prakarana by Govinda Satsen in Vaishya Ratnavali. Next, sir. The need of Pratinidhi Dravyas. Nowadays, we are finding the unavailability of raw drugs due to shortage of wet or dry or raw drugs, extents of some of the species, and considering the most economical cost factors. Next, sir. Condition not to substitute. When we are going to formulate a yoga, the Pradhana Dravya should not be substituted by other. Yes, sir. Next, sir. Factors to be considered for selection of Pratinidhi Dravyas. In controversy in identification, habitat of drug, non-availability, extent of species, seasonal unavailability, consider economical factors. For example, when we are using Vajra and Vaikranta, complicated process involved in purification, extraction, contraindication of the drugs. Next, sir. Benefits of Pratinidhi Dravyas. Patient benefit is greater to formulate the medicines, reaching the need or demand of patient expectation by particular compound with the same result, helps when drug availability is influenced by seasonal and geographical changes. Next, sir. Some of the Pratinidhi Dravyas are mentioned here. In place of Parada Basma, Rasa Sindura can be used. Rasa Sindura, Hingula can be used. Swarnamakshika can be used. Vajra, Vaikranta in place of Vajra. Swarnamakshika in place of Swarnamakshika, Gairika can be used. Loha, Mandura can be used. Kanta Loha, Tikshna Loha can be used. Loha and Mandura. These are the some of the drugs in Rashastra of Pratinidhi Dravyas. Next, sir. Some of the herbal drugs for Pratinidhi Dravyas: Madhu, Purana Guda, Sita, Kanda Sharkara, Draksha, Kashmiri, Rukshamla, Dadima, Meda, Eshti Madhu, Kakoli, Shatavari. Purana Guda, Navaguda is by keeping under hot sun for 4 yamas. Next, sir. Discussion. The concept of Ayurveda and present modern era of pharmaceutical procedures after differ, but using current scientific base and Ayurvedic views, we can achieve the standardization in Pratinidhi Dravyas. Synonyms of a drug is explained on the basis of geographical area. By considering these geographical synonyms, we can use the drugs. Similar action of main drug is important and have synergistic action with other drugs having same rasa, guna, virya, vipaka is very important. Some drugs are very expensive, such as Swarna, Hira. By considering cost and similar properties, in place of Hira, we can use Swarna. In place of Swarna, we can use Swarna Makshika. Each of Swarna Sahityat, so Swarna Sampanat, that shloka comes. Nowadays, substitute or Pratinidhi Dravyas is a topic of research. Next, sir. Okay, thank you, sir.
Thank you, Doctor, for this short and exceptional presentation.
Thank you.
So, next I invite Dr. Next I invite Dr. Anjita BL for the paper presentation on the topic Pharmacotherapeutic in Diabetic Mellitus.
Dr. Anjita BL, are you there?
Yes.
Okay, doctor. Doctor, please mute the other Zoom connected device, doctor.
Can you please share my
So Dr. I will share for you. Doctor, can you
Is it-
please mute other Zoom connected device, Doctor? Can you please mute the other the meeting connected device, Doctor? Can you reduce the volume of other Zoom connected device, Doctor? And please start the session, Doctor.
Hello?
You are audible, Doctor. Please start the session. Hello, Dr. Anjita. Screen is visible, Doctor. Please start the session, Doctor. Hello, Dr. Anjita. Can you hear me?
Dr. Anjita, please respond.
Hello, Dr. Anjita. Can you hear me? Hello, Dr. Anjita. Can you hear me?
I think there is some network issues. So next I invite Dr. Ajay Kumar Pandey. I invite Dr. Ajay Kumar Pandey to present the paper on the topic Ayurvedic and modern aspects of renal calculi. Dr. Ajay Kumar Pandey. So now I invite Dr. Saurabh Sadish Kadge. I invite Dr. Saurabh Sadish.
Okay, next I invite Dr. Tejish Dhanraj Malbhage for the paper presentation. It is a case study, single case study.
Dear participants, I would like to remind the same thing about the time period. Kindly try to complete your presentation within the time period of 8 minutes.
Okay, let's continue the presentation. Next is a presentation of Dr. Tejas Dhanraj Malbhage.
Good evening, everybody. Myself, Tejish Dhanraj Malbhage. I am PG Scholar Shalatantra Department of Yeshwant Ayurvedic College, Kodoli, Kolhapur. Guide name is Dr. Desai Ajay Desai and HOD is Dr. Shree Srinivas, Yeshwant Ayurvedic College, Kodoli, Kolhapur. Now we are going to talk about the abstract. Foreign gangrene is one of the rare but life-threatening diseases. It is a fulminant form of necrotizing fasciitis of the perineal, genital, and perianal regions, with the infective etiology caused by a mixture of aerobic and anaerobic microorganisms. In the present paper, the effect of Chedan karma and Santan karma in case of foreign gangrene is documented. Chedan karma, Early and exotic debridement of the scrotal gangrenous tissue was done, followed by Shodhan Karma, daily cleaning and dressing, with Panchavalkal and Trifalakal. Oral medications, Panchatikta Grudku Gud, Gandhak Rasayan, and Amal Churn were given. Significant improvement was observed in the patient in subjective parameters. The patient resumed his routine work and was no discomfort, side effects, or complication or recurrence after treatment and in follow-up period. Introduction. Pulmonary gangrene is one of the rare but life-threatening diseases. It is a fulminant form of infective necrotizing fasciitis of the perineal, genital, or perianal regions, with occasional cranial extension to the abdominal wall, which commonly affects men but can also occur in women and children. It is characterized thrombotic occlusion of small subcutaneous vessels and development of gangrene. It is a true urological emergency due to the high mortality rate, but fortunately the condition is rare. As Fournier's gangrene is idiopathic gangrene of the scrotum, it can be correlated with koth described in the Sushruta Samhita. Kuthitu putitum gam miti anena kuthap putitve karana ghana kotha putibhava means death and pus formation or gangrenous changes of tissues is called kotha. Synonyms of the disease are periurethral phlegmon, streptococcal scrotal gangrene, synergistic necrotizing cellulitis. It is a polymicrobial synergistic infection caused the aerobic, anaerobic, gram-positive and gram-negative bacteria, yeast and sometimes mycobacteria. Pathogens involved are coliforms, Klebsiella, Streptococci, Staphylococci, Clostridium, Bacteroides, and Corynne bacteria. The disease has a fulminant spread from scrotum up to the abdomen and thorax. Chedhan karma has been described in Sushruta Samhita for koth. छेद्य बकंदार ग्रंथि स्नायु मांसिरा कोथ अधिमांसकाः स्नायु कोथादिषु तथा छेदनं प्राप्तम् उच्यते is the slok given by Sushruta for koth. The spread of infection is along the facial plates and is usually limited by the attachments of Colles fascia in the perineum. Infection can spread to involve the scrotum, penis, and can spread up the anterior abdominal wall up to the clavicle. The testes are usually spared as their blood supply originates intra-abdominally. The involvement of the testis suggests retroperitoneal origin or a spread of infection. After debridement, reconstruction techniques such as primary closure of the skin, local skin flap coverage, split thickness, skin grafts, muscular flaps, which are used to fill a cavity, should be done. Definition. The name Fournier's gangrene kept after the French venenologist Jean Alfred Fournier. Fournier's gangrene is defined as the polymicrobial necrotizing fasciitis of the perineal, perianal, or genital areas. Fournier gangrenes. In this paper, we are going to talk about the definition, etiology and risk factors, pathogenesis, pathology, incidence, clinical features, differential diagnosis, investigations, treatment, medical and surgical complications of Fournier gangrenes. Risk factors: diabetes mellitus, alcoholism, malignancy, cirrhosis liver, chronic steroid use, HIV infection, malnutrition, and morbid obesity these patients are risk factors for Fournier gangrenes. Incidences: the age 30 to 60 years is common. Age 6, 10 times more common in males. Social habits, more common in male homosexuals, more prone to rectal injury. Etiology and risk factors. Initially described as idiopathic, now in more than 70% cases, inciting cause is known. Necrotizing processing commonly originates from infections in anorectum, urogenital tract, or skin of genitalia. Pathology. Pathognomic findings on pathologic evaluation of tissues are necrosis of superficial and deep facial plan, fibrinal coagulation of the nutrient arterioles, polymorphonuclear cell infiltration, presence of microorganism with the involved tissues, air in the perineal tissues. Mechanism of spread. Enterobacteria act through synergisms, fibrinoid coagulation of nutrient vessels, decreases locally blood supply to skin, decreases tissue oxygen tension, growth of anaerobics and microrephilic organism, production of enzymes, collagenase, lecithiases, hyaluronidase, digestion of facial barrier, rapid spread of infection. Clinical features of Fournier gangrenes begins with insidious onset of pruritus and discomfort of external genitalia, prodromal symptoms of fever and lethargy, which may be present for 2 to 7 days before gangrene. The hallmark of gangrene, Fournier's gangrene, is out of proportion pain and tenderness in the genitalia, increasing genital pain and tenderness, with progressive erythema of the overlying skin, dusky appearance of the overlying skin, subcutaneous crepitation, feculent odor, obvious gangrene of the portion of the genitalia, purulent discharge from wounds. As gangrene develops, pain subsides due to nerve necrosis. differential diagnosis, balanitis, cellulitis, epididymitis, gas gangrene, complicated hernias, complicated hydrocele, necrotizing fasciitis, orchitis, testicular torsion are the differential diagnoses for foreign gangrene. Investigations done during for foreign gangrene are CBC, the complete blood cells, electrolytes, serum creatinine, blood sugar, ABG, blood and urine culture with sensitivity, coagulation profile for DIC. Imaging, conventional radiography, ultrasonography, CT scanning, and MRI are the imaging for investigations. Medical treatment used for foreign gangrene is restoration of normal organ perfusion, reduction of systemic toxicity, broad spectrum antibiotics to cover anaerobics as well as aerobics. Cipra, Clindametro combination given, vancomycin for MRSA, tetanus prophylaxis, irrigation with superoxidized water, hyperbaric oxygen therapy, IV immunoglobulins to neutralize superantigen as streptococcus A and B as adjuvant, antifungal if required, and non-conventional therapy is unprocessed honey enzyme action, dressing with gauze soaked with zinc peroxide, and surgical treatments is repeated aggressive debridement, preservation of testes, subcutaneous pocket from desiccation, reconstruction after infection is over, fecal diversion, urinary diversion, vacuum assisted closure. Now we are going to talk about the case. The case study is a 53-year-old male patient came to Yashwant Ayurvedic Hospital in Shalyatantra OPD with complaints of insidious onset of pruritus and discomfort of external genitalia, pain and tenderness in genital area, progressive erythema of genital skin, dusky appearance of the overlying skin, subcutaneous crepitations, feculent odor, purulent discharge through wound, and he came for the further management and treatment. Investigation done for these patients are CBC, BSL, HbA1c, HbA1c, HbSAg, HIV, and ECG. Medical treatment given for him is antibiotics piperacillin, metronidazole, amikacin IV, analgesic tramadol IV, antacids planned is pantoprazole IV intravenously, antiemetic condensator intravenously. Daily dressing by betadine H2O2 and NS was given. Treatment plan: Chedan Karma, surgical debridement under spinal anesthesia was planned. Procedure: treatment of the patient was done in a step-by-step procedures. As Chedan Karma is indicated for Kotha, in first step, Chedan Karma early and
Thank you, doctor. Next, I invite Dr. L. Sai Lakshmi for the paper presentation on the topic Gridrasi. Dr. Sai Lakshmi, are you there? Dr. Sai Lakshmi, are you there? Okay, next I invite Dr. Anjita BL for the paper presentation. Dr. Anjita, are you there?
Yes.
Okay, doctor.
Can you hear me?
Yes, doctor, you're audible.
Okay, sir. Okay, sir. Good
Your screen
evening.
is also visible, doctor. Please start the session.
Okay. Good evening. I am Anshita BL, third year PG scholar, Dr. NRS GSC Vichayawada. My topic is pharmacotherapeutic in the diabetes mellitus with respect to the diabetes mellitus, Madhumeha. Diabetes mellitus is a metabolic disorder of multiple etiology characterized by the chronic hyperglycemia with a disturbance of carbohydrate, fat, and the protein metabolism resulting from the defect in insulin secretion, insulin action, or both. It's classified into type 1 diabetes and type 2 diabetes. Type 2 diabetes is non-insulin dependent diabetes, mainly due to the lifestyle disorders. Then the symptoms: polydipsia, polyphagia, lethargy, weight loss, small breathing, blurred vision, smell of acetone, nausea, vomiting, etc. And the complication include diabetes retinopathy, diabetic nephropathy, diabetic neuropathy, stroke, cardiovascular diseases. Madhumeha, who is greatly suffering from the eruptions accompanied with the secondary diseases, should be called as the patients of Madhumeha. This can be correlated with the diabetes mellitus. All we know about the Sambrapti, the classification: type 1 diabetes, we can correlate it with the Dadukshayajannya Madhumeha, and type 2 diabetes, we can correlate it with the Avarnajanya Madhumeha. Madhumeha Purvarupa, Hasta Padatala Snigdha Pichila Guru Gatrada, Madhura Shukla Mutrada, Tandra, Sada, Pibasa, Durganda. And the Ruba, frequent urination, increased thirst, extreme hunger, weakness and tiredness, loss on weight. Sadhya Chalda, Pramaha can't be cured completely. It can be managed through the diet, exercise, medicine. Management of Madhumeha, Stula Pramehi and Balavan Buhudosha can be go for Samshodhana. Krisha Durbala can be go for Samhrumana. Then the therapeutic modalities are Nadhana Parivarjana, Ahara, Vihara, and Aushadha Sevana. The Aushadha include Ruksha with Tikta Kashaya Aushadis. The yogas indicated in the Madhumeha, herbal, mineral, and herbo-mineral. The herbal yogas are Sorasa, Amalagi, Haridra, Billopatra, Guduji, Karavelaga, Kiradatikta, etc. Kwada, Falatrigadi, Nisha Kadagadi, Katagadiradi, Aragodadi, Churna, Tribala, Nishamalagi, Gokshuradi, Nagrodadi, Grida, Dhanundaram, Trigandagadi, Dadimadi, Asava, Lodrasava, Madhugasava, Devadyarvadi Arishta. Meshashringi. As the cause of the Madhumeha are Kaba and Medo Vardaka Ahara, Avyayama Vihara, Meshashringi having the Legu Ruksha Guna and reduces the Kaba, Kashaya Tikta Resa, Kaduvibaga, Ushnavirya pacifies Vada, in that ultimately cures the Madhumeha. Amalagi is antioxidant in action that prevent the complication of the diabetes mellitus apart from hypoglycemic action. Haridra and Karavelaga as Samprapti Vikatana and Amalagi is Tridosha Hera and Rasayana contributing to the management of Prameha. Next, the Kadagadiradi Kashaya, Resa, Kashaya Tikta Resa, Legu Bruksha Guna, Kadhira and Amra clear the Shoshaka property. It reduces the symptoms include Prabhuda Mutrada, Adisweda, Malavibanda, and Alasya. Next, Nisha Kadagadi Kashaya, Resa, Kashaya Tikta Resa, Guna, Legu. These both Kashaya can be given in the starting stage. When there is any skin involvement, we can go for Kadagadiradi Kashaya. Next, Asanadi Kwada, Rasa, Kashaya, Tikta, Guna, Legu, Ruksha. Asanadi works on Samprapti Vikadana. The Rasa and Guna of the Asanadi Kwada elevate Medha, Mamsa, Sharira, Kleda. It also works on insulin sensitive by stimulating D-chiroinositol. Most of the drugs having the Dibana Pachana Anulomana property, so helps to clear the Dadu Agni Chanita Ama. Then go for mineral. Nagabhasma, it is indicated in polydipsia as Nagabhasma decreases the osmolarity of the blood. When diabetes is associated with complications like carbuncle along with Shilajadu, it Nagabhasma is administered give good result. That is indicated in obese diabetic patient, chronic diabetic patient, and diabetics associated with the psychological symptoms like depression. It acts on the pancreas. It stimulates the insulin secretion by increasing and activating the beta cells. And it due to the Medohara and Lagana property, it facilitates free circulation and normal binding of insulin. It rectifies the receptors. And it acts on the brain, decreasing the stress hormone. Next to Vangabhasma, it is indicated in the diabetes mellitus associated with the oligospermia, old age diabetic patient with a decreased bladder incontinence. It acts on the pancreas, it improves the insulin action and at cellular level and increases the beta cells. It acts on testicle, stimulate the epidermal growth factor, thereby maintenance of the spermatogenesis. It acts on the organ of urinary system, gives strength to the organ as it avoids the neurogenic and stress incontinence. Acts on the liver, it improves the glucose metabolism or glucohomeostasis. Next, Yashoda Bhasma, it is indicated in the Pitta Pradhana Lakshana in Madhumeha, diabetes associated with the peripheral neuropathy, diabetic patients complaining excess lethargy, diabetes associated with the psychological originated diabetes, and lean diabetic patient. It acts on the pancreas. It regulates the glucagon secretion. It enhances the half-life of the insulin and acts on the muscle. It increases the glucose uptake and reduces the lethargy, and acts on nerve fibers, correct the neurotransmitter dysfunction. And the next Swarnamakshika Bhasma, it indicated in the patients with diabetes with Pitta Pradhana Lakshana, diabetes associated with a vascular disorder, diabetes associated with anemia. Major component of the Swarnamakshika are copper, iron, calcium, aluminum, potassium, magnesium. Of the major component of the Swarnamakshika, copper has the essential role in the glucose and the cholesterol metabolism. Copper might stimulate the liver to convert glucose into glycogen. Next, Abragabhasma indicated in the Madhumeha with Pleha Vriddhi. In gestational diabetes, Abragabhasma can be given along with the Pravala Pishti. Madhumeha associated with the reproductive and cardiac problem. Regeneration of the islets of Langerhans and induces the secretion of the insulin from the pancreas is the probable mode of action of Abragabhasma. Next comes to the herbomineral Chandraprabha Vadi, Shilajatu Vadi, Vasanta Kusmagara Resa, Chandrakala Resa, Trivanga Bhasma, Navayasaloga, etc. are the main herbomineral drugs used in the diabetes mellitus. Chandraprabha Vadi. Majority of the drugs are Kadu Tikta Kashaya Rasa, Ushna Virya, Kadu Vibhaga. Yavakshara and the Sarjakshara alkaline substances decreases the acidity of the urine and gives reliefs in the burning and micturition. Pipelimula and Vaja acts as a sedative and relieve anxiety, which helps in the management of psychosomatic diseases like diabetes mellitus, hypertension. It is useful in the Purvarupa stage of the disease. Shila Jetwadi Vadi, the majority of the drugs are Tikta Kadurasa, so it acts on the Kleda, Meda, Puya, Sweda, Mutra Shoshaga. Most of the drugs in the formulation possess Dibana Pachana property, which reduces the ama. Kaduvibaga drugs also works on the Mutravaha Srodhas and reduces the frequency of urine. Drugs of the Shila Jetwadi Vadi are mainly Rasayana, Vrishya, Balya, Chakshusha, and Ruksha, Legu Guna, and Ushna Virya, so helps to remove the avarana of Vada caused by the Kaba and Pitta. Thus, it helps to reduce the Prabhuda, Avila Mutrada, Kshuddha Adikya, Pibasa, Asya Madhurya. Next, the Vasanta Kusumagar Rasa. Especially, it is used in the Prameha and its complications of the Prameha, indicated in the chronic diabetic neuropathy, Pipilika Avacharana, numbness, pain, burning sensation. In diabetic neuropathy, the end artery and end nerves get damaged. The color of the legs are turned black. In this condition, Vasanta Kusumagar Rasa improves blood supply to the particular area and changes the color. Next, stage-wise management. Level 1, in the initial stage when the patient is having mild raised blood sugar and not associated with a major complication, we can go for Phalatrigadi Kashaya, Kadagadiradi Kashaya, Nisha Kadagadi Kashaya, Nishamalagi, and Trubala Kashaya, and Trubala Churna. Next, patient not responding to the above mentioned management in terms of symptomatology and reduction in the blood sugar level and developing signs of complications of diabetes may be referred to the next level. The drugs are drugs in the level 2, Shivagudika, Vangabhasma, Trivangabhasma, Vasanta Kusumagara Rasa, Arogyavardhini Vadi, Chandraprabha Vadi, Shila Jetwadi Vadi. Level 3, all the patients referred from the level 2 should be treated at this level. All patients comes under Stula Pramehi, Balavan, Kaba or Pitta Pramehi and willing to undergo the Shodhana line management of the better recovery should be treated at this level. Diabetes mellitus is a disease that cannot be cured, but it can be controlled by primary through the exercise and diet, and the secondary through the medicine. Ayurvedic principles of management helps to reduce the excess kleda, kaba dosha, and helps to maintain the mamsa medo dhatwagni in samyavastha in the body, and also helps to reduce and prevent complication. Thank you.
Thank you, Doctor, for the well-articulated presentation. Next, I invite Dr. Purushottam K for the paper presentation.
Yes, sir.
Good evening, Doctor.
Good evening, sir.
And please start the session, Doctor.
Concept of Agni in Rashastra. Myself, Dr. Purushottam, final year PG RSPK, AL Rao Ayurveda Medical College. Okay. Introduction. Rashastra is the nucleus of Ayurveda. Agni is the main constituent to maintain health, strength, complexion, lifespan, prana, etc. Agni is commonly known as digestive fire and metabolic fire. Sarve Roga Mandagni, that is all the diseases caused by due to the low fire, the Mandagni. Agni is one among Panchamahabhuta. As a physical form, Agni in Rashastra and Vaishya Kalpana, it is responsible for Dravya Paka and Parivartan, that is Samskara. Next, sir. Importance of Agni in Deha. Agni is responsible for conversion of food and medicines to get absorbed, assimilate. If Agni is impaired, it leads to Ama Utpatti. Because of Ama, we find so many diseases. Agni is necessary for conversion of heterogeneous compound to homogeneous compound, that is compound inside the body to maintain homeostasis of the body. It is one among the 6 factors that influence the transformation of food, that is Ahara Parinama Karaka Labhava. So Agni Pariksha is one among the Rogi Pariksha. Next, sir. Importance of Agni in Rashastra and Vaishya Kalpana. Samskara hi gunantardana. There is Agni Sannikrsha we found. It is responsible for changes in both chemical, physical constituent of a dravya. To reduce the particles of nanosize of metal and mineral, Agni plays vital role through a process called Mana. Some of the active principles present in the drug will be transferred to a media in certain temperature. Example, Kashaya preparation, when we use Katina Dravyas, for Katina Dravyas, we use Agni. majority of Kalpana requires Agni such as Avaleha, Guda, Sharkara, Gugulu, Kshara, etc. Next, sir. Types of Agni particular to body, Jatara Agni, Datva Agni, Bhut Agni. When we come to Rashastra, there are types of Agni according to Ravana in Arka Prakasha, Dhuma Agni, Deepa Agni, Manda Agni, Madhyam Agni, Karagni and Batagni. Next, sir. Interpretations of yoga prepared by the samskara of Agni and their action. Majority of yoga are prepared under Agni samskara. Due to this, they are basically attributed to Agni Guna, particularly in Rasaushadhis. Scientific research have revealed molecular mechanism behind the treatment. The nanotechnology, that is Basmikarna in Ayurveda, it has been established the size, shape, surface of a compound reduced to nanoparticles. By the use of these nanomedicines, target specific delivery is achieved. Next, sir. In our body, each cell is made up of 5 basic elements called Panchamahabhuta. The food medicines which are available outside the body is composed of Panchamahabhuta. To convert those heterogeneous compounds to the homogeneous compound, Agni is very much essential. That is achieved by through Dhatvagni. Majority of the yogas contains Agni Vardaka ingredients. That is Trikala, Trika to Chaturata we found in almost a majority of formulations. Agni plays a role as a catalyst, enzyme, a bioavailability enhancer, carrier, receptor, stimulant, a synergetic action. These are all the qualities attributed to Agni. Agni is considered as a prana, that is all kind of metabolism inside or outside the cell. Next, sir. Yogas along with major indication incorporated in the action of Agni. I have quoted here some of the slokas. Aragyavardhinivati Siddha Makraja. In the sloka, we found Gora Mandagni Arochakam, the reference. Abraka Basma Ruchidama Kapam Shitam Deepanam Shita Virya. Vaikramta Basma Deeptagni Kruta. Swarnamakshika according to Rasatrani Mandanala Arochakam. Like this, we have found the many references towards the Agni Ruddikara. Next, sir. Okay, sir. Thank you.
Thank you, doctor.
Thank you, madam.
And next I invite Dr. L. Sai Lakshmi for the paper presentation on the topic Gridrasi. Dr. Sai Lakshmi, are you there?
Yes, sir.
Okay, doctor.
Is my screen visible, sir?
Yes, doctor, screen is visible. Please start the session, doctor.
Okay, I am Dr. Sai Lakshmi, presenting on a topic Gridrasi. It is a frequently encountered problem in the present era, produced commonly due to the changed lifestyle. In this condition, patient will be become incapable to do his daily work because of a severe pain from Kati to Padanguli. It comes under Vataja Nanatmaja Vikaras and considered as a Maharoga according to Sharaka. The description about this disease has been described in all the classics. Sushruta has given the detailed expression. Dhyanavata and Apana Vayu are the major doshas involved. It is named so because the fact that the gait of the patient resembles that of the vulture. It is mainly it can be compared to the in modern sciatica. It arises due to the compression or the inflammation of a sciatic nerve and caused mainly due to herniated lumbar disc, and rarely it occurs due to spondylolisthesis, lumbar stenosis, and malignancies. These are the particular symptoms with the nerve involved. The main causative factors of the Gridrasi are not mentioned. Etiology of a Vata Vyadhi is considered under Gridrasi. Due to Nidana, there will be a Vata Prokopa causing Dhatu Kshaya, leading to Ka Unia in Kati. Dosha Dusha Shamuchana takes place, affecting the Sira and Snayu, leading to Gridrasi. The main doshas involved are Vata and Kapha. Dushas are Kandra, Snayu, Sira, and Mamsa. Shroto Dustri Prakarana is the Sangha. Purva Rupa are not mentioned, and the Rupa that are mentioned according to Charaka or Svik Purva, Kati Prusta, Uru Janga Panu. Uru Janu Janga Apada Kramat, Gridrasi Stamba Ruk Todav, Grihnanti Spandate Muhu Muhu. Vata Kapha, the Tandra Gaurava Arocha Kanditam. Sectic Shapana means it is the patient is unable to elevate or lift the leg. This is the difference between Vata Gridrasi and Vata Kapha Gridrasi. Lumbar spondylosis, disc degeneration, And lumbar arthritis can be compared with Vata Gridhrasi. Lumbar spinal stenosis can be compared with Vata Kapsha Gridhrasi. The Kukundara and Nitamba Marmabhigata Lakshanas are seen in Gridhrasi. It can be differentiated from Katigraha, Kanju, Kanja, Pangu, Marmabhigata at any of the next, the treatment management, mainly Kafabrita Vata Chikisha is given, followed by Vata Anlomna, Virechana Karma, and Vishnu Virya Aushadha Prayojana is done. That is followed by Sneha Chikisha. Nirgundi produces a beneficial effects in treating Gridhrasi. All the causative factors has to be avoided. And single drugs that are used in Gridhrasi or Rasna, Arenda, Nirgundi, Rasona, Shunti, Ashwagandha, Ajamoda, Arka, and Balataka. Compound drugs that are used are Ajamodadi Chuna, Panchamula Kwata, Dashamula Arista, Bala Taila, Vishnu Grita, and Rasnadi Gula. And these are some of the formulation mentioned according to dose wise. These are the medications at a level 1. We can do Ashwagandha Chuna, Rasnadi Chuna, Shunti Chuna, Chopshinadi Chuna. At a level 2 of a disease condition, Dashamula Kwata, Guglu Tikta Kwata, Danvantri Kwata, Balarishta can be given. At a level 3 of the disease condition, Udvatna Sweda and Patrapinda Sweda, Shashti Sali Pinda Sweda, Kati Vasti, Virechna, and Anvasan Vasti, Niruha Vasti, Agni Karma can be performed. The main Rasaushadhi that can be given in Gridhrasi are in acute and inflammatory condition where there is more pain, and we can give Vata Vidvamsaniras. In acute and non-inflammatory condition, Vata Gajankusharas can be given. When the condition is chronic and recurrent, we can give Vata Rakshasras. When there is spasticity and rigidity in muscle system, then Yogendra Ras can be given. In radiculopathy and myelopathy, Sekanga Viras can be given. In lumbar canal stenosis, Shivagudika can be given. In Samira Panagras can be given in canal stenosis and listhesis. Trayodashanga Gukulu is one of the important drug that is mainly indicated in sciatica. This drug have 13 herbs, and all these have a mainly Guru, Snigdha Gunatmaka, Madhurasa, Madhurvipaka, Vishnu Viryatmaka, which corrects the which directly take part in Samprapti Vigatana and correct the above mentioned symptoms. Some of these are the Guglu formulations that can be given. Vatacha Gridhrasi is Lakshadi Guglu, Panchatikta Guglu, Grita Guglu, Shiva Guglu, Swayambhu Guglu, that can be given in Vata Kapsha Gridhrasi or Kaishwar Guglu, Navaka Guglu, Punarnavadi Guglu, Simhnath Guglu, Vyati Shardula Guglu, and Yograj Guglu. Basti Chikisha, it is a important the treatment in Gridhrasi. Niruha Basti can be given with Dashamula and Aranda Muladi. Anuvasan Vasti can be given with Bala Taila, Mulaka Taila, Kshira Bala Taila, Prasarni Taila are beneficial. Kati Vasti, it is can be given in disorders like including slip disc and lumbar spondylosis, sciatica, and all spinal problems. It reduces the pain and stiffness. Mahanarayana Taila is given to the patient when he is suffering from the back debility, disc degeneration, or experience tenderness in the back. Balashwagandha Taila, it works to strengthen the spinal vertebrae, muscles, and ligaments. Bala Taila, most of the it is an excellent Vata pacifying drug. Nirgundi Taila is because of its excellent analgesic action, it is beneficial for reducing spinal stiffness. Sahacharadi Taila, it controls the kapha dominance symptoms like Stamba, Graha, Gaurava, and Tantra, and also on walking distance and magnitude of pain. Mahanarayana Taila can be given like a Katibasti. It is more effective to control Vata dominant symptoms like Thruk, Toda, numbness, burning sensation, and Muhu Spandana, and functional ability, Shakti, Kshepana Nigraha, and the functional ability. Raktamokshana, Siraveda, and Raktamokshana are indicated, and Agni Karma can be performed at the little toe of the affected leg. These are the rasayanas that has to be given in Gridhrasi: Balataka, Sukumara, Lasona, and Narsimha Leham. The yogasanas that are indicated are Sharabhasana, Setubandhasana, Pavanamuktasana, Bhujangasana, Adho Mukha Savasana, Ardhamachendriyasana, Balasana. It helps, it works on the spinal issues and piriformis phases that usually aggregate the sciatica pain. Therefore, concluding the topic, Gridhrasi is a painful condition and there is no established therapy. It is Abhyanga with a medicated oil followed by Svedana may be used as a first line of treatment for both type of Gridhrasi. Agni Karma and Raktamokshana can be useful in severe pain condition and chronic condition. Basti therapy may be better choice for the management of Gridhrasi. Nidana Parvachana stop the further progression of disease. I conclude that various treatments modalities present in Ayurveda vary according to the condition of disease present. Thank you.
Thank you, doctor. So next I invite Dr. Priyanka Dhanorkar for the poster presentation.
నువ్వు ఏ డిపార్ట్మెంట్ ఏ కాలేజ్ అవేం అవసరం లేదు.
I invite Dr. Priyanka Dhanorkar.
Hello.
Hello, doctor.
Am I audible, madam?
Yes, doctor, you're audible.
Can you share my poster presentation, ma'am?
Just a second, doctor.
Dr. Priyanka, please start the session, doctor.
Hello. Okay. Good evening, everyone. Myself, Dr. Priyanka Dhanorkar, second year PG scholar in Rog Nidan department. Today, we will discuss the topic Ashtonindi Purush according to Charak Samhita. The aim is to assess importance of Ashtonindi Purush. In Charak Samhita, Acharya Charak has mentioned the symptoms of Prashna Purush, that is ideal person. 8 types of physical abnormalities were explained by Ayurveda. People with this malformation are considered to be difficult to treat, and they are more prone to wide range of diseases. Ashtonindi Purush is important for doing chikitsa. These people are very poor for treatment as compared to Swasth Purush and Ashtonindi Purush. Swasth Purush gives better response to treatment as compared to Ashtonindi Purush. इह खलु शरीर मधि कृत्याष्टि पुरुषा निंदिता भवन्ति तद्यथा अतिदीर्घश्च अतिरस्वश्च अतिलोमाच अलोमाच अतिकृष्णश्च अतिगौरवश्च अतिस्थूलश्च अतिकृशश्चेति. There are 8 types of Ashtonindi Purush is explained by Charak. That is Atirasva, that is dwarfism, short stature or excessive small person. Atidirgha, excessive tall person. Atiloma, hairy body. Alom, hairless body. Atikrishna, tan body. Atigaura, fairy body. Atisthul, obesity. And Atikrusha, emaciated body. Atisthul and Atikrishna are more commonly found. According to Charak, Atisthul are more liable to health risk. Now I will explain Ashtonindi Purush one by one. First of all, Atidirgha and Atirasva. Atidirgha and Atirasva are occurs due to defect of bija, that is defect in sperm and ovum of female and male body, or Atma Karma, Ashay, Kal, or Matru Ahar Vihar Dosha, that is defect in mother's food and activities when she is pregnant. Atidirgha, Atirasva can be considered as a Vikrutanga. Pathological tall statures includes excessive growth hormone, acromegaly, genetic disorder like Klinefelter syndrome. Pathological short statures include growth hormone deficiency, that is dwarfism, genetic disorders like Turner syndrome. Next is Atilom. Atilom means hairy body. Person suffering from the disorder has more body hair on body than normal, thicker hair, or more than one loam from single loam coop. Due to atiloma, the sweat that releases cannot dry out properly, and that can be lead to skin disorders. According to modern, it can be correlated with disorder named hypertrichosis, that is Werewolf syndrome. The cause for hairy body or this syndrome is unknown. Sometimes it can be considered as congenital. Alone, hairless body. Low count of loam coop is present, which result in blockage, presence of low amount of outlets for sweda. Thus, reduced amount of sweda, which not able to excrete properly. Absence of protection can lead to various infections. Also, The main function of hairs are to regulate the temperature. In alone type of patients, it can be seen there is temperature management is not happening. Ati Krishna, Ati Gaurav. With the combination of different Panchamahabhut, Garbha Varna is formed. According to Shishrut, Tej Mahabhut, Prithvi Mahabhut form Krishna Varna of Garbha. Tej Mahabhut and Aap Mahabhut cause Gaura Varna in Garbha. Teja, Prithvi, Akash causes Krishna Shava Varna. Teja, Jal, Akasha cause Gaura Shava Varna. According to Charak, Krishna and Gaura Varna is a Prakrit Varna and other Varna are Aprakrit Varna. According to modern, hyperpigmentation and hypopigmentation occurs due to imbalance of production of melanin. Hyperpigmentation seen in Addison's disease, Cushing syndrome, hyperthyroidism, and hypopigmentation seen in vitiligo. Atistut, that is obesity. This can be associated with Medoro, can be defined with the excessive and abnormal increase in Med and Mausodhatu, resulting in pendulous appearance of buttocks, belly, and breasts. The causative factor of obesity, according to Ayurveda, are Bijadosha, Medavardhak Ahar, and Vihar. According to modern, factors for obesity are sedentary lifestyle, stress or psychological causes, dietary intake, social economic status, drug induced. Next is Atikrusha. In Charak Samhita, Karsha is included under Nanatmaj Vyadhi. A person suffers from severe nutritional deficiency. Causes can be Vatavardhak Ahar, like Katu, Shita, Ruksha, Kashaya Ahar, Khafahar Ahar, Guru Ahar when you are suffering from Mandagni, Upwas for a long period, Ratra Jagran, Shoka Bhaya Chinta, Veg Vidharan, Ati Vyayam, Ruksha Udvartan, or a congenital, that is Bij Dosh. The above description is of undesirable persons in the form of standpoint of physical constitution only. So it does not include psychological perverted person like scoundrel, mean-minded. Out of the 8 types of mentioned above, the first 6 are not significant for medical purposes. They only present the popular sentiment about undesirable persons. Undesirable person like hunchback, that is kubja, may also be taken as a undesirable. Conclusion, according to above study, that of the medicament includes therapeutic action when administered, and attendance action includes preparation of medicaments and nursing. The effort of patient lies in following the instruction of physician and giving the current history of disease. 8. Undesirable constitution. Thank you.
Thank you, Doctor. So next I invite Dr. Aishwarya K. Sunil. I invite Dr. Aishwarya K. Sunil for the paper presentation on the topic diabetic retinopathy.
Thank you, ma'am. Can I share the screen?
Sure, doctor, please.
Is it visible?
Yes, doctor, visible. Please start the session, doctor.
I'm Dr. Aishwarya Kiswell, second year PG scholar from the Department of Shalakya Tantra from Alvas Ayurveda Medical College, Mudbidri. Today, my topic will be diabetic retinopathy, diagnosis, and Ayurvedic management of the same. Introduction. Diabetes mellitus has in recent times gained importance as one of the most common disease which contributes to death and disability worldwide. Diabetes is defined as a metabolic and vascular syndrome. Diabetic retinopathy is a chronic, progressive, potentially sight-threatening disease of the retinal microvasculature associated with prolonged hyperglycemia. Symptoms are blurred vision, floaters, flashes, distorted vision, dark areas in vision, poor night vision, impaired color vision, and partial or total loss of vision. This is the prevalence and incidence of the same in India. Factors that affect course and severity. Considering the complications of diabetes mellitus, it can be classified into microvascular complications and macrovascular complication. In macrovascular complication, it includes heart attack, stroke, and peripheral neuropathy, whereas in microvascular complication, it includes glaucoma, cataract, and other conditions. The factors which affect the course and severity of diabetic retinopathy include the pregnancy, systemic hypertension, nephropathy, and poor metabolic control. The best predicator, that is the duration of diabetes. According to statistics, it is noted that type 1 diabetic patient has 20% chances of getting diabetic retinopathy after 10 years, and type 2 diabetic patient has the chance of getting diabetes after 10 years, that is 25%. But after 30 years, there is 95% chance that both type 1 and type 2 patients getting diabetic retinopathy. Pathogenesis of the same. Diabetic retinopathy is essentially a microangiopathy which affects retinal precapillary arterioles, capillaries, and venules. Microangiopathy causes microvascular occlusion and leakage. This is the pathophysiology of the disease, where the capillary changes and hematological changes lead to microvascular occlusion, then retinal capillary perfusion, which in turn causes tissue hypoxia, and in eyes it causes retinal ischemia, which then causes release of VEGF, which is the vascular endothelial growth factor, and in turn causing neovascularization. Neovascularization is the growth of new blood vessels which was not present before. Classification of diabetic retinopathy, it's divided into 4. NPDR, that is non-proliferative diabetic retinopathy, which is again divided into mild, moderate, severe, and very severe conditions. Proliferative diabetic retinopathy divided into early and advanced PDR, diabetic maculopathy, and advanced diabetic eye diseases. Coming in short of the symptoms, which is signs which we see in NPDR, is microaneurysms, that is the new blood vessels formed, dot and blot hemorrhages. This is deep vein bleeding which causes dot and blot hemorrhages. Flame-shaped hemorrhages are superficial bleeding which is seen in the eye. Hard exudates and soft exudates. Cotton wool spots is the soft exudates which can be seen in the fundus. NPDR, I have already mentioned there are 4 ways to classify it as mild, moderate, severe, and very severe. If at least one microaneurysm is present, it's mild. In at least 2 to 3 microaneurysm is present with hard exudate and cotton wool spot, it's severe, moderate, and in severe and very severe condition, these 3, at least if 2 among this is present, it's severe, and more than 2 if it's present, it's very severe condition. Proliferative diabetic retinopathy. This is in PDR cases. There is an occurrence of neovascularization. This is the end stage where new blood vessels are formed. Extra membrane. This is the main hallmark feature of PDR, where fibrovascular epiretinal membrane is formed. There will be venous detachment, venous hemorrhages. This is the visual representation of how the disease progresses from normal vision, normal fundus. In PDR case, there will be hemorrhage and exudates. As a disease progress in pre-proliferative stage, there will be abnormal growth of vessels, that is a neovascularization. But when it comes to proliferative stage, there will be retinal detachment, retinal break, and hemorrhage. Third one was diabetic maculopathy. The diabetic macular edema occurs due to increased permeability of the retinal capillaries. It is diagnosed on slit lamp examination with help of a 90D lens. Criteria is thickening of retina at or within 500 micron of the center of fovea, hard exudates at or within 500 micron of the center of fovea, and development of a zone of retinal thickening 1 disc diameter or larger in size. This is how there are 3 types of diabetic maculopathy: focal, diffuse, and ischemia. In FFA is a diagnostic criteria, which is fluorescent fundus angiography, where a fluorescent stain is injected into the cubital fossa of the patient. It's given as IV, and later the fundus photography is taken. In focal case, you'll see the focal leakage with adequate macular capillary perfusion. When it comes to diffuse, there will be leakage at the posterior pole with a typical flower petal pattern. When it comes to ischemia, there will be macular and paramacular non-perfusion will be seen. These are the various FFA images of NPDR, PDR, and micro. The last image shows the microaneurysms where new blood vessels are formed. Investigations. The main thing which we can do to prevent a diabetic retinopathy is to keep a check on and proper screening of the diabetes patient. After 10 years, after 20 years, after 30 years, we have to properly screen so that we can avoid diabetic retinopathy and in turn avoid blindness. So investigations include urine examination, blood sugar investigation, RFT, lipid profile, hemoglobin, HbA1c, FFA, and OCT, which is together used for eye examination. Control of glycemia, again I have given the perfect values to note on. This is the normal OCT image of a normal eye, but when its second image is that of a diabetic retinopathy patient, where you can see subretinal fluid and intraretinal fluid accumulation. This is an image of how the OCT image shows the neovascularization of retinal layers. Next diagnostic purpose will be ophthalmoscopy, which can be done in the OPD basis. This shows the various images of non-proliferative, proliferative, and diabetic maculopathy edema in DR cases. Management of the same. Till the first examination is normally done 3 years after diagnosis of type 1, but in case of type 2, it is done at the time of diagnosis. And every year, in case of no DR or mild NPDR case, every 6 months in case of moderate NPDR, every 3 months in case of severe NPDR, and every 2 months in case of PDR with no high risk characteristics. Treatment. In modern, normally the treatment is giving intravitreal anti-VEGF injection. Examples like Avastin, but as I have already put on the screen, Avastin injection almost costs 34,000, and this injection it gives a validity of 2 weeks. Again, the patient is supposed to take multiple shots of the same to get a prolonged effect. So Ayurveda treatment is has a better hold compared to the economically, financially, and progression of diseases can be controlled by Ayurveda line of treatment. Second option in modern is laser therapy, and then is intravitreal steroids. Coming to the Ayurvedic perspective of the disease, it can be correlated to Timira, where in Vataja Timira, you can get a Lakshana called Jalani, Keshan, Mashakan, Jashmimshcha Upekshate, which we can consider it as floaters, where we get small thread-like patterns. In Pittaja Timira, you see Shiki Tiktira Patrabam, where there is phosphogenes, which is normally multiple colored. In Kafena Timira, you can see Shanka Kuntetu Kusuma, which can be again taken as flashes of light. So you can correlate each Timira to the modern symptoms, whatever we see. This is the probable correlation of the dosha-wise Timira first and its various stages. According to Vagbata, this diabetic retinopathy can be correlated to as Madhumehajanya Timira. It is again of 2 types, Avarnajanya and Dhatukshayajanya. Etiopathogenesis of Timira, Tridosha plus Rakta dosha, and Saptadhatu and 4 Drishti Patalas, all these are affected in case of Madhumehajanya Timira in different stages of the disease. Avarna and Dhatukshaya also has a role in diabetic due to prolonged and uncontrolled diabetes. Hello?
Doctor, you are exceeding the time limit.
Okay.
Make it fast.
Okay, thank you, sir. So this is how each and every cause will lead to diabetic retinopathy. Management of diabetic retinopathy in Ayurveda. Mainly, the protocol goes as treat the cause first, then management of Urdhvagata Raktapitta, because hemorrhages is one of the symptoms seen. Then treatment of Avarna, Dhatuksha and Agni Madhya. Agni Chikitsa at the cellular level can be done with normal Dipna Pachana drugs. Raktapitta Shamak Chikitsa like Virechana, Upavasa can be done. Raktamokshana is contraindicated in Timra. Rest you can do. Avarna Chikitsa, you can give Shalaja to Gugulu, Chavanaprasha, Brahma, Rasayana, etc. Vatanlomana Chikitsa like Madhu Taila Chakshusha Basti is very much indicated. Tatukshaya Chikitsa Basti is the right mode of action which can be included. Kriya Kalpas like Tarpana with Mahatrifila Grita, Patoladi Grita can be given. Chakshusha Basti, as I have previously told, it's a type of Siddha Basti with Chakshusha, Pramehara and Raktapittahara properties can be used. Anjana, Saharivadya Anjana, Drakshadi Anjana, etc. can be used. Ashtotana can be indicated with Trifla Grita, Durvadi Grita and Patoladi Grita. Seka with Pitta Kashaya, Rasa Dravyas can be used in this case. Shamana Yogas, these are the various Shamana Yogas. Mainly Vasakadi Kashaya is given in a large scale. These are various research papers which I could find regarding this topic. This is the Patya and Patya of the disease. Conclusion, it is important to screen all diabetes annually by examining the fundus so as to initiate therapy as early as possible. Strict glycemic control helps to stabilize the retinal changes. Taking into consideration of various research articles, the observations reveal that Ayurvedic approaches are helpful in managing diabetic retinopathy successfully. Thank you.
Thank you, Doctor. Next, I invite Dr. Shital Sonavane for the case presentation.
Hello. Hello, everyone. Am I audible?
Yes, Doctor, you're audible.
Can you please share the screen for me?
Sure, Doctor.
Could you please start the session, Doctor?
Yes. Hello, everyone. Myself, Dr. Shital Sonvane, PG scholar from Department of Komarbritya from CSMSS Ayurveda Mahavidyalaya, Aurangabad. So today I'm going to present a case study which is of Kapat Chhardi. Chhardi is one of the most commonly seen as disease, symptom or complication in pediatric age group. With prevalence rate of 4%, modern antiemetics have major side effects, whereas Ayurvedic medicines provide relief with no adverse effects as well as are cost effective. There is kapha dosha dominance in balyavastha, kapha, kaphakar hetu, and kapha disorders results in kapha lakshanas which contribute significantly towards the chhardi. The consumption of snigdha, ghana, swadu, vidahi, excessive sleep, etc. all considerably increase the kapha, aggravating it to larger extent. By doing this, patient experiences tandra, asya madhurya, prasek, Santosh, Nidra, Gurutva. He also vomits up unoffered solid, sweet, and white stuff while experiencing horripilation and mild discomfort. Next slide, please. So, I'm going to discuss a case study. 4-year-old male child presented with complaints of rillas, aruchi, 3 episodes of curdy, white, snigdha, ghana, swadu, vomiting with no signs of dehydration since morning, brought by his parents in OPD. Next slide. So Ashtavik Parikshan was found to be normal. His jiva was moist, and which I found that patient is not suffering from any sign of dehydration. Vikrut Srotas, which I found in that patient was Annavaha and Rasavaha. Next slide. This is review. Tandra Asya Madhurya Kafa Praseka Santosha Nidra Aruchi Gauravarta Snigdha Ghana Swadu Kafad Vishuddha Saloma Harsha Alparuja Vametu, which is a reference I have taken from Charak Sutrasthan Beast. Drug review is Shantyadi Yog, Vidanga Plava Shantik, Churnava, Kapaja Mumi. This reference I have taken from Bhav Prakash. The drug I am giving is Shantyadi Yog. Next slide, please. These are the drugs which I gave the patient in Churna from, which we will be seeing in the next slide. Next slide, please. So these are the Rasapanchak of the drug. We all know about the Rasapanchak. I will discuss the karma. Plava or musta, which I gave to the patient, acts as Sangrahi, Deepan, Pachan, Trishna Nigrahan. Vidanga acts as Krumigna, Deepan, Pachan, and Vatanuloman. Shuntya, it is Deepan, Pachan, Jiva, Kantha Vishodan, and also has activity on 5-HT3 receptors, which we will be discussing at the end. Next slide, please. Anupan I gave was Madhu, that is Ruksha and Laghu, and Kapagna, Lekhan and Kruminashak. Next slide, please. So drug regimen, Shuntari Yog, I gave the child in as 3 gram churna orally, muhur with madhu. I told them to mix the 3 gram of churna with madhu, and as per need over the day he can do the chartan of that. For dehydration purpose, I gave them Lajamanda. I wrote them a video of the Lajamanda, how to prepare at home, and mother can give it to the child. Follow-up I took on second and third day. Duration of treatment I gave for 3 days. Pathya was Mudgayusha, Shali, Mog, Yava, Tadim, etc. And Apathya was Nigda, Guru, Vidahi, Asatmya, Viruddha, Ahar, which I explained the mother in detail. Assessment criteria which I included was subjective parameter as nausea or ullas, loss of appetite as aruchi, chardi weight, and objective parameter was dehydration. Next slide, please. So, for nausea or ullas, I gave the gradation as 0 as absence of vomiting or nausea, grade 1 as nausea without vomiting, and grade 2 as nausea with vomiting. Next slide. Loss of appetite or aruchi was 0 for normal appetite, reduced appetite as grade 1, and grade 2 as markedly reduced appetite. Next slide, please. Chardi Vega, episodes of vomiting, grade 0 for no episode of vomiting, grade 1 to 3 episodes of vomiting per day, grade 2, 3 to 6 vomiting per day, grade 3, more than 6 episodes of vomiting per day. Next slide, please. Objective criteria as dehydration, for 0 for no dehydration, 1 for some dehydration, and 2 for severe dehydration. Next slide, please. I considered the modes of the grades of dehydration from WHO criteria. Next slide, please. My patient was suffering from no sign of dehydration. After giving the drug and drug regimen and follow-up, I found that the child showed great improvement in symptoms after starting the chikitsa. Ullas reduced from grade 2 to grade 0, that is nausea with vomiting, to no nausea and no vomiting. Aruchi improved from grade 1, that is markedly reduced appetite, to improved in appetite. Chardi weight reduced from grade 1, that is 3 episodes of vomiting, to 0, and with overall improvement in general condition of the child. So at the part of discussion, as I told, the probable mode of action, which was, I found that effective maybe in this case was one of the 5-HT3 antagonist action of the Shuntha. Another one case study, one article I had read that mice were given reserpine to prove the antiemetic action of Cyprus rotundus. So it was found that it has antiemetic activity, and Vidanga is also for Deepan Pachan. So overall, my drug was considered to be highly effective in the management of Kapachardi of this child. So next slide. Thank you.
Thank you, Dr. Shital,
Yes, sir.
for the well explanation of the paper presentation. Next, I invite Dr. K. Reksha J. Udupa for the paper presentation.
Yes, sir. Can you share the screen?
Sure, doctor. Please share the screen, doctor.
So can you share the screen?
Just a moment, doctor.
Okay.
And Doctor, please start the session.
Topic of my presentation is Tondikeri, commonly correlated with tonsillitis. Next. Tondikeri is explained under Talugata Rogas by Shushruta. Acharya Vagbhata explained under Pantagata Roga. Acharya Charaka explained under Mukharoga. Classical references. Shofa Stula Todaha, Daha Prapaki Prabhuptabhyam, Tondikeri Matatu, Sushruta Nidana. There will be swelling, which is big in size, has pricking type of pain, burning sensations are the symptoms of Tondikeri. Tondikeri Vanakarpasika Tat Palanukari Vyadiram Hanusandhyashrita Kante Karpasi Phala Sannivaha Pichilo Mandaruk Shopaha Katinas Tundikerika. Ashtangrodaya reference. Due to vitiated kapha and rakta doshas, it will cause large swelling resembling the fruit of Vanakarpasa, and the complaints will be burning sensation, pricking pain in the throat, suppurative cyst. Samprapti Aharaja Nidana with Viharaja Nidana causing Agnimandya results in Kapadosha Prakopa causing ama formation, later leading to the Rakta Dushti. Stan Samshaya of doshas in Talu and Kanta Pradesha causing Shota, Paka at the region of Talu and Kanta causing Tundikeri. Next slide. Samprapti Dosha Kapha Kaparakta Tushya Rasa Rakta Mamsa Srotas Rasavaha Raktavaha Mamsavaha Agni Jatragni Datvagni Mandya Srota Dushti Sanga Rogamarga Bahya Udbhavastana Amashaya Adhishtana Mukha Hanusandhi Vyaktastana Talu or Kanta. Lakshana Daha Paka Shoka. Next slide. Chiksa Sutra. The treatment modalities for Tundikeri explained by our acharyas in Ayurveda is two types, Shamana and Shastra Chikitsa. Shamana Chikitsa, Shulahara, Shotahara, Grantihara Aushadhis, which subsides Tundikeri. Kavala Gandusha, Duma, Nasya can also be given. Shastra Chikitsa, Tundikeri, Adrishya Sangate, Talu Puppute, Eshava Vidhi Karya, Vishilsha Shastra Karmani. Even though it can be cured by Shastra Chikitsa, but Dallana specifically explained the treatment of Tundikeri as Vedya Sadhya Vaidhi, Tundikeri, Vedya Sadhya. Common yogas are Yavakshara Gutika Panchavalkala Kvata. So, as it is commonly related with tonsillitis, tonsillitis is inflammation or infection of the tonsils, which is medically termed as tonsillitis. Tonsils are protective glands that are situated on both the sides in the throat. The tonsils constitute an important part of the body's immune system and are vital defense organs. They protect the body from bacteria and virus by fighting these as soon as they enter the body. Next slide. Anatomy. In the normal state, tonsils are pink in color and about the same size. The tonsils along with adenoids are said to form the first line of defense against infective organisms. Pathology. When the tonsils get inflamed, they become red, swollen, and may develop pus pockets that start exuding discharge. In cases with recurrent infections, tonsils may become so swollen over a period of time so as to almost reaches each other. Tonsillitis is very common amongst children. No particular gender predilection is seen in case of tonsillitis. Next slide. Causes. Bacterial and viral infection can cause tonsillitis through droplet infection. Common causes Streptococcus bacteria. Other causes include adenovirus, influenza virus, Epstein-Barr virus, parainfluenza virus, enterovirus, herpes simplex virus. Next slide. Triggering factors. Food with artificial colors and preservatives. Peanuts, cold food, cold drinks, ice creams, changes in weather, extreme cold climate, damp weather, exposure to lot of pollution, sour fruits, lemon, pineapple, grapes, oranges. Next slide. Signs. Red and swollen tonsils, white spots, specks or patches on the tonsils, enlarged lymph nodes in the neck region, bad and foul breath, tongue which is coated, cough, running nose, fever and malaise. Acute tonsillitis symptoms will be soreness of throat, difficulty in swallowing or painful swallowing of food, pain or discomfort while swallowing saliva, change of voice, pain in the ears due to common nerve supply of back of the throat and the ear, headache, malaise, tiredness, difficulty in taking feeds in babies. This may be the sole indicator in some cases of tonsillitis in infants. Next slide. Classification. Catarrhal tonsillitis. When tonsils are inflamed as a part of generalized infection of oropharyngeal mucosa, it is called catarrhal tonsillitis. Membranous tonsillitis. Sometimes exudation from the crypts may coalesce to form a membrane over the surface of the tonsil, giving rise to clinical picture of membranous tonsillitis. Next slide. Parenchymal tonsillitis. When the whole tonsil is uniformly congested and swollen, it is called acute parenchymatous tonsillitis. Diagnosis. Usually the examination is when done, there is redness and swelling in the tonsils, pus pockets of the tonsils, discharge from the tonsils. In case of peritonsillar abscess, there might be shift of the involved tonsil towards the center of the throat, and the uvula may be shifted towards the opposite side. Next slide. Diagnosis: throat swab. This is used to get a sample of secretion from the back of the throat. Monospot test, a blood test that can detect certain antibodies which can help confirm the person's symptom are due to mononucleosis Epstein-Barr virus antibodies. If a monospot test is negative, antibodies in the blood against EBV might help diagnose mononucleosis. Blood test, this primarily includes CBC, which is done to confirm presence of infection. Complications will be local, severe swelling with the spread of infection and inflammation to the hypopharynx and larynx may occasionally produce increased respiratory obstruction, although it is very rare in uncomplicated acute tonsillitis. Next slide. Peritonsillar abscess is one of the complications of acute tonsillitis, and its development means that infection has spread outside the tonsillar capsule. Spread of infection from tonsil or more usually from peritonsillar abscess through the superior constrictor muscle of the pharynx first results in cellulitis of the neck and later in oropharyngeal space abscess. The systemic or general complication of acute tonsillitis are rare and almost confined to the childhood. Septicemia, untreated acute tonsillitis can result in septicemia with septic abscess, septic arthritis, and meningitis. Allopathic treatment, acetaminophen, ibuprofen are given for relieving the symptoms. Antibiotics are prescribed once a bacterial infection is confirmed. Tonsillectomy for those children who do not respond to antibiotics. Quinsy, it is usually treated by draining the abscess and antibiotics. Sometimes removing the tonsils is needed to treat the quinsy. Prevention, avoid the loose contact with the close contact with others who are sick. Keep children away from the kids who are known to have tonsillitis or sore throat. Next slide. And as this tonsillitis usually occurs in children, so these are some of the prevention methods for the children. Next slide. Thank you.
Thank you, Doctor. Next, I invite Dr. Supriya Ji for the paper presentation.
Yes, sir. Can the slide be presented? Hello.
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 You are audible, Doctor.
Yeah, can the slide be presented?
I'll
Slides?
share it to the Doctor just a moment.
Yeah.
Okay, Doctor, please start the session, Doctor.
Yeah. Namaste, everyone. The topic selected is clinical review on Badhariya deafness. Myself, Dr. Supriya Ji Acharya, second PG scholar, Shalakya Tantra GMC Bangalore. Next slide. So we'll see what are the contents of my session. Introduction, we'll deal with introduction, Badhariya, Uchayshruti or Ashabda Shravana, the differences between them, deafness, Nidana and Samprapti, the common causes, risk factors of deafness, the quantification and assessment of Badhariya, and finally, Chikitsa and the conclusion. So first is introduction. As we know, among the 28 Karnagata Rogas mentioned by Sushruta and Yogaratnakara, as well as the 25 Karnagata Rogas mentioned by Bhagbata, Badhariya is one among them. Acharya Sushruta has not mentioned. He has mentioned 4 Karna Rogas, which are Karna Shulas. And Acharya Charaka has mentioned Badhariya among the Vata Jananatmaka Vyadhi Maharogadhyaya. And also, considering the Indriya Pradoshaja Vikaras, we can tell he has explained Badhariya too. Going on with the modern aspect, that is, as soon as we tell Badhariya, we get deafness in our mind. So what is deafness? Any impairment in hearing is deafness. So WHO mentions by 2050, 1 in every 10 will have disabling hearing loss and shall require hearing rehabilitation. And because of the advancement in technology, 1 billion young adults are at a risk of permanent or avoidable hearing loss due to unsafe listening practices. Next slide. So what is Badhariya or Uchayshruti or Ashabda Shravana? So Ashabda Shravana, as this word itself says, Shabda Abhave Shabda Shravanam, whereas Badhariya and Uchayshruti is what we need to consider here. Uchayshruti is Taraswara Matra Shravana, means a person can hear only under a noisy environment or in a loud sound he can hear, not a lower frequency sounds, and this we can see somewhere in otosclerosis. Badhariya means any frequency sound. It may be a lower frequency or a higher frequency. The person is not able to hear anything. So the definition Vagbhatakara mentions Shleshmanugato Vayuhu Yada Nadova Sampekshitaha Uchaihi Krichar Sim Kuryat Badiratam Kramenacha. So when a Shleshmanugata Vayu is vitiated in the Shabdavas Rodas, or if Karnanada is not treated properly, or if it is left untreated, then it results in Bhadariya. Next slide. Sushruta mentions two types of Bhadariya here. He mentions either it is Shuddha Kevala Janyavata or it may be Avrana Janyavata. He mentions in Nidanasthana that is Shuddha Shleshman Mito Vapi Bhadiryam Tena Jayate. So he gives two sampraptis here. Next slide. So what is deafness? Deafness is nothing but a person who is not able to hear as well as someone who's having a normal hearing. That person is said to have deafness. So this can be mild, moderate, severe, profound as per the Government of India classification. Other than that, it can be unilateral, bilateral, congenital, acquired. It can be acute, chronic. It may be of sudden onset as well as gradual onset too. Some of the preceding events need to be given importance before going into deafness, like before going into the treatment. In the history, we need to ask about if there was any ear journey done by the patient, or there was any open hand slap injuries on the ear, if the patient had any history of cold or cough, was there any exposure to the loud noises, is the patient have hobbies like surfing, swimming, or scuba diving, such hobbies, or certain specific symptoms tell about the disease, like diplacusis means double sound the patient hears, it indicates Meniere's. If the patient hears in a loud, noisy background, that is paracusis villi, we can tell that the patient has otosclerosis. So these need to be considered. Going on the types of deafness, we have organic, non-organic. Non-organic is nothing but functional, malingering and psychogenic, whereas the organic, next slide, we have conductive, sensory neural, mixed as well as central hearing loss. Next slide. Going on with the Nidana and Samprapti, this is a common Nidana, that is Pratichayi Jala Krida Karna Kanduyanar Marut Mithya Yogena Shabdasya Kupita Nesha Kopanahi. We also have a specific Nidana mentioned by Yogaratnakara. Sushruta mentions specific causative factors like Vidura Marma Upagata or Visharna Taila usage. Shukra Shonita Janya Bhadiriya also is mentioned. Karanasha Ardita resulting in Bhadiriya. Other than that, doing Apatya Karma in the Rutukala resulting in Bhadiriya. Next slide. The Samprapti we can classify based upon the Nidana. If it is Shuddha Kevala Vatajanya, it has a different Samprapti. If it is because of Karananada Upekshita, it will be having a different Samprapti. Or if it is Shleshmanugata, here Shleshma means not only Kapha. Dalana mentions it may be even associated with Pitta Rakta along with Vata, or even it may be Anyonya Avarana Vata. So based on that, the Samprapti differs. Next slide. The common causes, if we see in the EAC, it may be either the form of earwax, foreign body, otitis, inflammatory swellings. Exostosis is nothing but bony growths, which we see in swimmers usually because of the continuous irritation. In the tympanic membrane, we can see like perforation, sclerosis. It may be a retracted TM because of cough or cold. Middle ear cavity lesions like cholesteatomas or even any tumors present there. Other than that, otitis media, barotrauma, ET dysfunctions, eustachian tube dysfunction can also result in hearing loss. Inner ear diseases like Meniere's, acoustic neuroma more common, and any other ear tumors can also result in hearing loss. Next slide. Some of the risk factors need to be considered here. First one is aging, presbycusis, which is commonly known as heredity. People with the certain genetic makeup will have chances of getting hearing loss at an early age. Loud noises, this may be a short exposure or a long exposure. It may be in a form of occupational, like in case of companies, factories and all, farmers and all. Other than that, recreational noises like usage of headphones, speakers, or having hobbies like shooting or motorcycling, such things. And even ototoxicity, certain drugs like chemotherapy drugs, anti-malarial drugs, aspirin doses, and even gentamicin, they can result in short-term hearing loss as well as tinnitus. Next slide. So it is through a thorough history as well as a proper clinical evaluation and hearing assessment we can go with the diagnosis. So what are those? We will see now. Next slide. So quantification of the degree of the hearing loss. This is as per WHO. Until 25, it is fine, normal. So 26 to 40, he mentions as mild, again moderate, moderately severe, severe, and profound. So based on this quantification, the PTA report what we get. So based on that, we will confirm whether it's a conductive or a sensory neural or a mixed hearing loss. Next slide. Other assessments criteria are clinical tests are present, like traditional screening tests, like which can be done in a clinical setup, like watch test, or it may be a finger friction test, or even it may be a speech test. Other than that, the commonly used the tuning fork test. Famously, the most common is Rinner's and Weber's. Other than that, even we have Schwabach's, Gelle's, and ABC tests. They're all there, but most used is Rene's and Weber's. And in a clinical setup, how it is done is, first we'll go with the Rene's and Weber's test. We will go come to a provisional diagnosis, and through the help of PTA, that is the audiometry test, we confirm the diagnosis. Other than that, even we have speech audiometries, impedance audiometry, or the tympanometry is also used. Next slide. So these are some of the investigations, the PTA reports or the Rene's, Weber's and all. Next slide. The chikitsa, main golden rule of management is nidana parivajana. Most of the nidanas which lead to badhirya, if avoided, it is a very better way of management. So nidana parvarjana forms the first line of management. Other than that, samanya chikitsa is mentioned. Samanyam kannarogeshu kritabanam rasayanam avyayamo ashiraha snanam brahmacharyam akatanam. This reference we get from Sushruta. Mainly since Shravana is a Vatasthana, here mainly Vatahara management is mentioned. Other than that, in Ashtanga, that is both Hridayakara as well as Sangrahakara, they mention the use of Navana, that is butter, in the form of Abhyanga or Purana. He mentions Nada, Badhirya Shulani, Navana Abhyanga Puranaihi. Further, again in Sushruta, he mentions for these 4 diseases, the Chikitsa is similar, that is Chaturunam Viroganam Samanyam Beshajam Viduhu, that is Karnashula, Pranada, Karnanada, Badhirya, and Karnakshveda. So the line of management for each can be used it can be interchanged for all of them. Next slide. Some of the Vishesha Chikitsa in Badhirya, if we see, it is a Karna Purana. So, Visheshena Badhirya Puranam Shrutam is what mentioned by Sushruta. So, various medicaments can be used for the purpose of Karna Purana, but precaution should be taken. There should be no infection seen in the EAC or the TM, or there should be no rupture or that is perforation of the tympanic membrane. Precaution should be taken, and only then Karna Purana is to be done. So, Sarshapa taila is mentioned, Kshara taila, Shatapaka bala taila, Bilva taila, Mahamasha taila, Hingwadi, Kshirabala, Danvantara, Nirgundyadi. So, all these oils can be used based upon the dosha, pradhanata, as well as the samprapti. Vigatana should be properly done, and then based on the condition, the oil can be chosen. So, Karna Purana, practically how we do, we go with first Abhyanga, and then we go with Patasveda, and then we do Karna Purana, that is filling up of the ear canal until the meatus, and we hold it it is kept for there for about 15 minutes maximum. We keep it for 15 minutes practically. Thereafter, we again remove it and followed by Patasveda. So this is done for both the ears. Next slide. Other than that, even we have the reference of Murdabasti, Nasya, and Mastishka Parishechana, that is Shirodhara. And if Pratishaya is caused as a Nidana, then we can inculcate the Pratishaya Chikitsa here too in Badhirya. Other than that, if it is more of Vata Pradhana, then we'll go with Vataja Karana Shulava Chikitsa. If it is Shleshma Anubandha, that is, it may be Shleshma, Pitta, or Rakta Anubandha. First, we need to do the Harana of the dosha, which is Anubandha, and then we'll go with the Virechana line of management. Badhiryam, Varjayet, Bala, Vriddha, Chirotita. So, in case of Bala as well as Vriddha, that is Bala, usually if it's indicating congenital conditions, avoided. Vriddha, developmental, it is usually the senile conditions. Acharya mentions avoided. Other than that, Chirotita, more than 1 year chronic history, Acharya mentions avoided. Next. So modern line of management, what do we have? Mainly we have the hearing aids, recreational therapy, what we say. Other than that, assistive hearing devices are also used. Speech therapy is mentioned. These are all, they just maintain it. They don't give a permanent cure for the condition. What we can do is we can prevent developing hearing loss. If we have a history of heredity, or if we are above 45, then have the hearing tested once in a year, and avoid the continuous use of earphones or speakers. Give up the nicotine smoking, also causes hearing loss. And if you are working in a factory or in a loud environment, use the noise deleters, as well as if certain medications, if you are using for a continuous period of time, do check over it. Next slide. So coming to a conclusion, Badhirya, we can say it is a Vata Kafaja Vyadhi more predominantly, and avoiding the Nidana is a main line. First line of management. Emphasis is mainly given on Dinacharya, that too especially on Karna Purana. Karna Purana mainly prevents Badhirya, and in the today's world of advancement, many of them are using a lot of earphones, headphones, earbuds and all, which are the main cause for developing of Badhirya in a younger age. So again, Nidana Parivarjana. Rather than going for this rehabilitation therapies, we in Ayurveda we do have a better line of management for Ayurveda for Badhirya if the Samprapti Vikatana is done properly and if they have come at a proper time, it can be better treated, we can say. So, and also there is a wide open door for research here, mainly with respect to kriyas like Karna Basti and Karna Pichu, which is not much thrown light upon. And also there are many Ayurvedic formulations which we don't follow. We are restricting ourselves to certain formulations for Badhirya. So there's a wide door for research, and I would like to tell that, like, if it is looked into, it helps a lot for our branch. Finally, I conclude by saying there is nothing greater than a sympathetic ear. So please do take care of the ear, and thank you.
Thank you, Doctor. Thank you for the wonderful presentation. Next is a case study. I would like to invite Dr. Saurabh Sadish Kadge for the paper presentation. It is a case study related to the Parikartika.
Management of Parikartika by Tilatel Matra Basti case study presented by Dr. Saurabh Sadish Kadge, PG Scholar, Department of Shalyatantra, under the guidance of Dr. Vaibhav Magar, Associate Professor, Department of Shalyatantra, Yashwant Ayurved College, Kodoli, Kolhapur. In today's lifestyle, which is more of a sedentary life, having more diseases than ever, one of them is fishery nano, caused by many reasons such as low fiber diet, non-vegetarian diet, low physical activity, junk food, irregular meals, stress, which all causes irregular bowel movements and constipation, leads to passage of hard stool causing erosion and deep tear through the skin and anal margin extending into the anal canal, which named as pericarditis, that is fishery nano. In this study, a single case was taken to treat acute stage of fishery nano with Tiltal Matra Basti for 3 days only. Assessment was done on the basis of acute pain, burning sensation, spasm, itching, and constipation. In the earliest reference of Parakartika is available in Sushruta Samhita, Charak Samhita, and Kashyap Samhita. In modern science, it is correlated with fishery nano. The present day, the management done by laxatives, seeds bath, anti-inflammatory, local anesthetic agent to give temporary relief, and it takes a longer duration to get rid of the symptoms. Warm 50 ml basti of tila tail for 3 consecutive days with conservative management. The til tail basti has many effects: Varnanashak, Daha Shaman, Varnaropan, relieving of spasm, Malabaddhata, as stated in text. Hence, an effort has been made to evaluate the study of Tiltail Matra Basti for 3 days in Parikartika with special reference to fissure in ano. This is the images of fissure in ano and anatomical structures of anal canal and having fissure in ano. Aim of the study is to study the efficacy of Tiltail Matra Basti in the acute stage of management of Parikartika with special reference to fishery nano. Materials used are Tiltail for Matra Basti and Trifera Churna 1 tablespoon for post meal. Methods we used 50 ml warm matrabasti tail on 3 consecutive days. Advised to take light meals and warm water and bed rest for 3 days. It is the case of 23-year male patient came to OPD with complaints of Kartanvat Vedana, Udapradesh Daha, Malav Stamban and Sarakta Mal Pravrutti. Patient having similar complaints with frequent intervals and had taken the medicine for the same from Ayurveda as well as allopathic practitioners. He had got some relief from the same. The patient had above complaints for 3 days and had treatment for the same and allopathic medicines. Not satisfied, so came to OPD, an acute stage of exaggerated pain, burning, and constipation. On examinations, vitals are normals. Malaustambas, Rakta Malpravrutti, Sam Jiva, Kshudhamandya. On local examinations, fissure is seen with difficulty due to severe spasm and pain on examination. PR examination was not quite possible due to spasm and pain. Mild bleed during the examination. Hetu of this case is irregular meals, sabudana, junk food, fast food, frequent tea, diva swap, late night sleep, and no physical activity. All of these caused Vata Pitta Prakop with Strotovrod, causing Malabadhata, and straining caused Parikartika, that is fissure in ano. Samprapti happen is Vikrut Ahar Vihar Sevans leading to Strotodushti Malabadhata, and straining during defecation caused fissure in ano, resulting in signs and symptoms like pain, burning, spasm, and bleeding. The treatment we given is Nidan Parivarjan Chikitsa. It is advised all the food and lifestyle changes. Tilatel Matravasti 50 ml for 3 days and Trifara Churna. Results given are: for first day, Tilatel given after 20 to 30 minutes was able to sit properly. No pain was relieved up to 70%. On second day, pain was on lower side, burning relieved remarkably, no bleeding, PR allowed by patient, wound showed no acute bleed and was soft and healing tendency. Patient on third day, patient allowed PR, pain and burning was almost relieved, no pain and burning after defecation, no bleed, no spasm. Stools are soft and patient is happy for discomfort was relieved. Discussion: fissure in ano caused by various factors of Vikrut Ahar Vihar and excessive stress, which results in altered bowel movements, constipation, and hard stool, which on straining while defecation forms acute ulcer leading to pain, burning, bleeding, spasm, giving rise to severe discomfort and illness. To visit hospital. The burning symptoms which we thought will not reduce but also on lower side because lubrication leaves spasm. Other than above symptoms, we got added 3 benefits of Matrabasti: having sound sleep and patient was not having from 3 days. Conclusion: from above study it is found that Matrabasti stat and for 2 days is good line of management of Parikartika. The main symptoms of pain and burning was relieved immediately after 20 to 30 minutes, and positive approach of the patient towards the management. The pain and burning during and after defecation relieved markedly, and he had food consumption which he had reduced for 2 days in the fear of pain during and after defecation. Thank you.
Thank you, Dr. Saurav, for the paper presentation. Next, I invite Dr. Sodhi Raikwar for the paper presentation on the topic Pradishaya and its management. Dr. Sodhi, are you there?
Yes, sir. Can you please share the slide?
Okay, doctor, just a moment, I'll share for you.
Okay.
Prasadi, please start the session, doctor.
Yes. Hello everyone. Myself Dr. Swati Rakwa, second year PG scholar, Department of Shalakya, GMC, Bengaluru. My topic is Pratishaya and its management. Next, please. Introduction. Pratishaya is a Nasa gut disease. It is described from Samhita Kal in Brihatrai as well as Lagutrai. It is described as a cause of Kasharoga, as a Purvrupa Prajakshama, and as a symptom of Vegvidharana, Chayas, as well as Vishmasanaj Yakshama. On the basis of sign and symptom, the disease Pratishaya can be compared to rhinitis in modern medicine, characterized by sudden and frequent attacks of sneezing, profuse watery nasal discharge associated with nasal obstruction, which is intermittent watery of eye, heaviness of head, and respiratory distress and insomnia. Next, please. Nidana. Nari prashanga siriso abhitapo dhumo raja sheetam ati pratapa sandharanam mutra purishyosch sadhya pratishaya nidana muktam. Purvrupa शिरो गुरुत्वं छवतो प्रवर्धनम तथा अंगमर्दः परिहृष्टरोमता उपद्रवश्चापरे पृथक विधा नृणाम प्रतिशायपुरा शरा स्मृता. Next, please. संप्राप्ति चयम गता मूर्धनि मारुतादया पृथक समस्ताश्च तथैव शोणितं प्रकोप्यमाना विविधैः प्रकोपणैः नृणां प्रतिशायकरा भवन्ति. निदान सेवना, then विशेषण और वात दोषा, शाम कफ पित्त रक्त cause आवरण of this Prithvika obstructing its gati, then dosas get lodged in serum pradesha. This Prithvika expels out kapha, pitta and rakta through nasal route, then pratishaya. Next, please. संप्राप्ति घटक दोषा वात कफ प्रधान अल्प पित्त दूष्य रस एंड रक्त अग्नि जठराग्नि एंड रस धात्वाग्नि श्रोतस प्राणवः एंड रसवः श्रोतो दुष्टि संग बीमार गमन उद्भव स्थान अमाशया व्यक्त स्थान नाशा रोगमार्ग आभ्यंतर एंड व्याधि स्वभाव आशुकारी. सामान्य लक्षण सिरोशूल सिरोगौरव ज्वर काश कफोत्क्लेश स्वरभेद एंड इंद्रिय असमर्थत्व. Types of Pratishaya: Vataj, Pittaj, Kaphaj, Sannipataj, and Raktaj Pratishaya. Sadhyata Sadhyata. In neglected or improperly treated case, the disease may change into Dushta Pratishaya, which is Kricha Sadhya. Chikitsa Navam Pratishaya Mapashya Sarvam Upacharit Sarpisha Eva Panai Swede Vichitrai Bamanaischa Yuktai Kalu Panai Abapidanaischa. Next, please. The nasal disease are best treated with Nasya and Dhumpana. Other Panchakarma in Pratishaya. First up, Mukh Abhyanga with Panch Lavana Grata, Panch Moola Grata and Dashmoola Grata. Shvedana, Nasya, Dhumpan with Vidangadi Dhuma and Grata Shaktu Dhuma. Next, Kaval Graha. Next, please. Drugs are generally used for Nasya, Anuteri Nasya, Trifla and Trikatu Churna, Pradhaman Nasya, Sundi Telinasya, Rajanyadi Telinasya, and Pipalyadi Telinasya. Jal Neti. Among Shatakarmas, Neti is the best technique to purify the nasal passages, sinuses, etc. Jal Neti is one of the simplest forms of Neti and devoid of side effect and easy to perform. Technique: Jal Neti can be performed over rushing a bowl on a table, in the sewer or outside. The Neti pot should be filled with lukewarm saline water. It should be neither too hot or nor cold before administration. Action: Jal Neti rinses out the dirt and bacteria. Jal Neti helps to drain dead and passages like the sinuses. The used shaken tube receive exactly the same effect as the sinuses. Some Pathya in Pratishaya: Katu, Amla Lavan Rasha, Snigdha Ushna Laghu Bhojana, Purana Yav and Shali, Kulath and Mudgayusha, Gramya Jangal Mansrasha, Vritak, Kulatha, Shigru, Karkotak and Lashuna, Dadhi, Taptambu, Varunajala and Trikatu. Conclusion: Pratisha is a small disease with big discomfort. It hampers the daily routine and makes the mind clumsy. When it becomes chronic, reflects with raised eosinophilia. The best management from Ayurveda is Nashya Karma. Many medicines are used selectively according to the sensitivity and utility. Thank you.
Thank you, doctor. Thank you for the wonderful presentation. Next, I invite Dr. Manushree MM for the paper presentation. Dr. Manushree,
Yes,
are you
sir.
there?
Yeah, yes, sir.
Okay,
Sir, can
doctor.
you please share the slide form?
So, doctor, just a moment. And Dr. Manushree, please start the session, doctor.
Yes, sir. Yes. Myself, Dr. Manushree, second year PG scholar from the Department of Shalakya Tantra, JMC Bengaluru. I selected the topic meniastasis as next slide. Meniastasis is an inner ear disease characterized by the episodes of vertigo, fluctuating sensory neural hearing loss, tinnitus, and sensation of oral fullness. It occurs as a result of endolymphatic sac distension caused by the excessive production of the endolymph or the faulty absorption of the endolymph or either both. As there is no exact correlation of meniastasis in Ayurveda, but by seeing the symptoms of Karnanada, Karnakshveda, Bhadirya, and Brahma, we can correlate it to meniastasis. According to Charaka, the symptoms of Brahma Roga and Vataja Karna Roga resembles meniastasis. In meniastasis, the three main manifestations are vertigo, tinnitus, and hearing loss. That is, we can consider it with Brahma, Karnanada, Karnakshveda, and Bhadirya. Next slide. कर्णनाद यदा तु नाडीषु विमार्गम् आगतः स एव शब्दम् अभिवायिस्तु तिष्ठति शृणोति शब्दान् विभ्रांस्तदा नरः प्रणादमेनं कथयन्ति च आमयम्. If the Prakrbita Vayu takes Vimargagamana and takes Sthana Samshaya in the Shabdava Shrotas, creates different types of noise which can be perceived by the patient. It is termed as Karnanada. Next, Karnashveda. Next slide, sir. Shramat क्षयात् कषायरूक्षभोजनात् समीरणैः शब्दपतैः प्रतिष्ठितः विरिक्तशीर्षस्य च शीतसेविनः करोति श्वेडम् अतीव कर्णयोः. Vataprakopa occurred due to the Shrama, Dhatukshaya, Ruksha Kashaya, Bhojana, etc. gets Sthana Samshaya in the Shabdavaha Srotas leads to Karnakshveda. According to Videha, the patient perceives Venugoshavat Shabda in Karnakshveda. Next, Bhadirya. When Vata either alone or along with the association of Kapha gets blocks the way of sound, it develops Bhadirya. Next slide. Next, Brahma. Brahmaha Chakra Ruda Seva. Brahma refers to giddiness or whirling. It's a condition caused due to the vitiation of Vata and Pitta with the involvement of Rajoguna. This Vata, Pitta, and Rajoguna afflicts causes Brahma. Next slide. Understanding of Nidana. In modern perspective, the exact cause of mania disease is not yet known, but there are few postulations. They are it may be the cause of Meniere's disease according to modern defective absorption of endolymph, vasomotor disturbances, allergy, sodium and water retention, hypothyroidism, autoimmune and viral etiologies, or even untreated or improperly managed otalgia, otitis media, sinusitis, rhinitis, etc. Thanks.
Understanding the Nidan of Menial disease in an Ayurvedic perspective, Samanya Karnaroga Nidanas like Jalakrida, exposure to Avashaya, Shita Upachara after Shirovirechana, or Atiyoga or Mithya Yoga of Karnendriya. There are some Vata Prakopaka Nidanas like Ratri Jagarana, etc. And some other Nidanas like Ajirna, Agnimandya, Vishamashana, noise pollution, etc. And even excessive traveling, exposure to loud sounds, usage of earphones, physical and mental stress, and these also cause Vata Prakopa. And having Kama, Krodha, Lobha, Chinta, Shoka, Mada, Matsaya, these also cause disturbance in Rajoguna. All these Nidanas can be considered as a Nidana for Meniere's disease. Next slide. Coming to the understanding of Samprapti, at first there will be Vata Tridosha Prakopa with the Kapha predominance, and this Kapha Pradhana Tridosha causes Srotarodha in Urdhvagami Sira of Shravanendriya. Then it further aggravates Vata dosha, resulting in the symptoms of menial disease, that is tinnitus, vertigo, and hearing loss. Next slide. Dushta kapha, that is vitiated kapha, causes the mechanical dilatation of the endolymphatic sac, thus interfere with the sensory cells of balance and hearing. Also, it blocks the sensory and mechanical signals through the vestibulocochlear nerve to the auditory center and the organ of Corti. In later stages, by the influence of Vata dosha, there occurs the death of sensory cells, resulting in hearing loss. Next slide. Understanding doshic components of Meniere's disease. Basically, Meniere's disease is a Vata Pradhana Tridoshara Vadi along with Rajoguna vitiation. The symptom vertigo is due to the increased Laguguna of Vata and Pitta, whereas the tinnitus is due to the avarana of Vata by Kapha dosha. Hearing loss is due to Margavarodha in Shabdavaha Srotas. Next slide. Coming to the diagnosis and investigations, it is mainly by PTA, and the PTA shows low frequency fluctuating hearing loss along with coinciding non-changing high frequency hearing loss. Here the PTA shows tent-like demarcation, and the hearing loss will be peak at 2 kilohertz, and the average pure tone loss is about 50 decibels only, and it is always mild to moderate hearing loss. Next slide. Coming to Chikitsa, the treatment of Meniere's disease is based on Vyadhi Avastha and Rogi Bala. General outline of the treatment is as follows. As it is a Vata Pradhana Vyadhi, we need to encounter Vata first. Then Vata Hara Chikitsa is as follows. Snigdha Virechana, Vatanulopana, Nasya, etc. And there should be Sthanika interventions like Karna Purana, Shiro Pichu, Shiro Abhyanga, Shiro Dhara. Next. And also Samanya Karna Roga Chikitsa, that is as per Shushruta, Samanyam Karna Rogeshu Ghritapanam Rasayanam Avyayamo Ashirasnanam Brahmacharyam Akatanam. This reference also holds good in this disease. Also, due to the Meniere's disease is always chronic in nature. Due to the chronicity of the disease, Sattva Chikitsa is also needed to boost the morale of the patients. And also, it is Vata Pradhana Vyadhi, Vatasya Upakrama should be adopted along with these treatments. Next. Snigdha Virechana. The first step is Amapachana. It can be achieved with Agnitundivati, Sudarshana Churna, Trikatu, Shunti, etc. Next, after Amapachana, Snehapana in Arohana Krama should be done. We can use Ashwagandhadikrita, Gugulutiktakagrita, Mahatiktakagrita, Sukumaragrita, Jivantyadikrita, according to the dosha, according to the dosha and prakriti of the patient. Then Virechana can be given with Trivrit Leha or Tripala Kashaya or any other yogas. Next slide. Then Nasya Karma, it is one of the important intervention. It purely depends on the Vyadhi Avastha. In initial stage, there is Kapha Avarana, and so we need to use Tikshna Nasya Yogas. And in later stages, there will be more Vata Prakopa than Kapha Dosha. We need to use Shamana or Bhumana type of Nasya in later stages. Next, Karna Purana. It does Sthanika Vata Shamana as well as Tarpana of the Karna Indriya. We can use Bilva Taila, Kshara Taila, Deepika Taila, Bhringamalaki Taila, Apamarga Kshara Taila, etc. Next slide. Then coming to Patya Patya. Patyaharas include Goduma, Shali, Mudga, Yava, Puranagrita, Patola, Shigru, etc. And some other mamsas like mamsa of Lava, Mayura, Harina, Kukkuta, etc. And Patya Viharas include maintaining celibacy and also Karna Purana and Karna Abhyanga. Apatya include avoid humid climate, introducing a stick or blade of glass or metallic objects into ear, and taking head bath, brushing teeth with hard brushes. Excessive talking, Vyayama, should be avoided as it increases Vata. All Vata Kara Nidanas should be avoided. Next slide. It appears Meniere's disease appears to be rare, but due to inevitable stress in day-to-day life, and we are encountering more and more cases during our practice. The most affected age group is about 30 to 60. The frequent screening and evaluation of the subject is necessary for the early detection of the disease. Even though we cannot directly correlate the Meniere's disease with the Ayurvedic conditions, but we can, by understanding these Karnanada, Karnakshveda, Bhadirya, Brahma, the doshic involvement of the Meniere's disease, according to the Ayurvedic perspective, can be analyzed by knowing these Karnanada, etc. And we can manage Meniere's disease effectively by Ayurvedic interventions. Many more case studies are had been occurred in our institution. We have good results, and we need to apply Ayurvedic interventions in this area. Thank you, sir.
Thank you, Dr. Manushree, for the well-explained paper presentation.
Thank you, sir.
Next, I invite Dr. Saudi Balram Bhagile for the paper presentation. Dr. Saudi Bhagile, are you there?
Yes, sir. Hello.
You are audible, doctor.
Sir, can you please share slide for me?
Sure, doctor. Just a moment. I will share for you. And please start the session, doctor.
Yes, my topic is literary review on role of Tarpana in eye disorder. Myself, Dr. Swati Bhagile, postgraduate student of Vidarbha Ayurveda Mahavidyalaya, Amravati. Next, introduction. Shalakya Tantra is one among the 8 specialty Ashtanga Ayurveda which deals with the Urdhva Vyadhi. In Ayurvedic Samhita, various local therapeutic procedure for the Netra Roga has been described in the name of Kriyakalpa. Kriyakalpa is made up of 2 words. Kriya means special therapeutic procedure and the Kalpa means formulation like Swarasa, Grita, Kasha, etc. Eye are only one organ in the body which receives separate treatment modality like a Kriyakalpa as a Bahirmarjan Chikitsa. Panchakarma is the foundation for the Kaya Chikitsa. Similarly,
Netra, Kriyakalpa are the foundation for the Netra Chikitsa. They are the modulated to suit the structural peculiarities and the different disease condition of the eye. These local therapies are the unique and each does the function in a different way. Next, please. Topical administration and oral administration. In Kriyakalpa, the medicine have a direct action on the ocular tissue, and the oral administration there will be no direct action on the ocular tissue. In Kriyakalpa, the medicine will bypass the systemic metabolism. In the medicine undergoes the systemic metabolism in oral administration. In Kriyakalpa, the contact time between the tissue and the medicine can be monitored. In oral administration, the tissue contact time of the drug cannot be monitored. Next, please. Procedure of Tarpana. These procedures are the consistent for the Purva Karma, Pradhan Karma, and the Pachat Karma. Purva Karma. It includes proper Shodhana of the body and the head by the Panchakarma, like Vamana, Virechana, Raktamokshana, Basti, Nasya, as well as the collection of the medication required for the procedure. In Pradhan Karma, it includes actual procedure of the Kriya Kalpa. In Pachat Karma, it includes the Parihar Kala and the Sansajan Krama. Next, please. Next slide, please. It is the in Tarpana, it is the procedure in which the medicated Grita is kept over the eye for the specific period of the time. It is also named as a Netra Basti. It gives nourishment to the eye and the cure Vata, Pittva, predominant Netra Roga. Beside Grita, Vasa, Majja and the Grita Manda are also used by the special arrangement made around the eye with the Mash Pali or the Tarpan goggle. The duration and the matra kala to retain the medicine are as follow. According to the modern pharmacology, various drugs used in the form of the eye drop or the eye ointment enter in the eyeball by passing through the cornea. This penetration depends upon the permeability of the various layers of the cornea. The epithelium and endothelium highly permeable for the lipid content as compared to the stromal layer. Thus, fat-soluble drug readily penetrate this layer. However, the only water-soluble drug can penetrate the stromal layer. Thus, for the complete penetration of the drug, it should be lipophilic and the hydrophilic. The Triphala Grith, which is generally used for the Tarpan, is saturated with the decoction of the various drugs and hence it contains both lipid and the water-soluble constituent of the Triphala. Thus, it is the lipophilic as well as hydrophilic and hence it has got a very good penetration through the various layers of the cornea. Next, please. Conclusion. The Kriyakalpa procedure explained in the Ayurveda is the Bahir Parimarjan Chikitsa and follows the topical treatment protocol for the eyes. Various drugs can be selected according to the stages and the types of the disease. It has a high bioavailability of the drug to the target tissue of the eye due to its own pharmacotherapeutic action and the tissue contact time. The time duration is under control, so any unwanted effect can be easily managed. Kriyakalpa play very effective role to maintain the Netra Swasthya and the Netra Roga Chikitsa. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Nishigandha Suresh Patel for the paper presentation. Dr. Nishigandha Suresh Patel, are you there? Dr. Nishigandha Suresh Patel, are you there? And next is a paper presentation. Next, I would like to invite Dr. Ajay Kumar Pandey for the paper presentation. The topic of paper presentation related to the Ayurvedic and modern aspect of renal calculi.
Good evening, guys. Myself, Dr. Ajay Kumar Pandey, PG second year student, Shalyatantra, Yashwant Ayurved College and Research Center, Kodori, Korapur. And my guide is Professor Dr. Lakshmi and M. Narhari, and HOD is Dr. Tri Srinivasa. My PPT presentation on the topic of Ayurvedic and modern aspects of renal calculi. Introduction of renal calculi. A renal calculi is hard solid mass of material that forms in the kidney from the substance of urine. Renal calculi develops as a result of various metabolic disorders which affects the fate of calcium, other minerals, elements in the body. Stones may be formed in the kidney, urinary bladder and urethra. In Ayurveda, renal calculi are termed as Ashmari. 4 types of Ashmari. They are mainly described. Material and methods. Descriptions were collected from standard Ayurvedic literature, Samhita and recent researches. Paper related to topic of concern, modern textbook and articles were referred. Recent advance in the field of urosurgery were studied. Review of literature. Ashmari. The word Ashmari is derived from 2 words. Ashma, stone-like structure, and Ari means enemy. Enemy means Dushman. Type of Ashmari according to Ayurveda, Bhed. Swarup of Ashmari as per Ayurvedic context. Vataj, Pittaj, Kafaj and Sukraj. Vataj में शव, परुष, विषम, खर, कंटक, चिता, कद्मभूष, रुक्ष. पित्तज में पीत और भास, कृष्ण, मधुवर्णा, रक्त, पित्त, असित. कफज में श्वेत, स्निग्ध, महत, कुकुटांधपत, काश, मधुपुष्पत्व और श्लक्षण. शुक्रज में मूत्र, कृच्छ, बस्ती वेदना और वृषण शोथ. ठीक. रेनल कैलकुलाई types and morphology in X-ray film. Calcium oxalate monohydrate looks like rounds and well seen. Calcium oxalate dihydrate stone looks like a zagged edges well seen. Calcium phosphate is just similar to oxalate, comparatively it is more dense. Triple phosphate stone is staghorn shaped. Cystine stone looks like faintly radiopaque. Type of kidney stone. Calcium oxalate, calcium phosphate, steroid, uric acid and cystine. Percentage of kidney stone. With the help of pie diagram, I am trying to elaborate the percentage of kidney stone. That is 7% uric acid, 12% steroid and 1% cystine, and rest of the stone is due to the 80% of calcium. Now Vataj, Pittaj and Kafaj. Calcium oxalate, that is round. Vataj में कद्म पुष्पवत. Calcium oxalate dihydrate jagged edges कंटक चिता. Calcium oxalate, calcium phosphate similar to oxalate, more dense. Cystine faintly radiopaque, मधुवर्णा, पित्तोभास्था, uric acid, pebble shaped, रक्त पित्त, अशीत. A triple phosphate, staghorn and मधुक पुष्पवत कफज. Now etiology, metabolic, lifestyle, genetic factor, drugs and others. अश्मरी हेतु व संप्राप्ति. हेतु में असंशोधनशील व्यक्ति अपथ्यकर आहार सेवन, संप्राप्ति हेतु सेवन, कफदोष, प्रकोपित कफदोष, मूत्र संवेद, बस्ती में मध्य प्रवेश, अश्मरी, सुश्रुत निदान 3. उत्तर तंत्र. Due to improper purification of the body by following the improper diet and lifestyle, कफ दोष gets vitiated, combines with urine, reaches in बस्ती to form अश्मरी. संप्राप्ति घटक दोष एंड त्रिदोष. दूष्य होता है मूत्र, श्रोतश होते हैं मूत्र व श्रोतश, अधिष्ठान होते हैं बस्ती, साध्य साधक, कृच्छ साध्य. Pathophysiology. The formation of renal calculi is the complex process and is dependent in the interaction of several factors including urinary concentration of stone forming ion, urinary pH, urinary flow rate, and the balance between promoter and inhibitor factor of crystallization, anatomic factor that encourage urinary stasis. Clinical manifestation. Several abdominal or flank pain, frequency, dysuria, oliguria and anuria, in obstruction, hematuria, burning sensation during urination. Now, according to position, what is the symptom? Ureteric pelvic junction calculus में mild to severe sudden gripping pain is felt in the loin. Upper 1/3 ureteric calculus, pain start in the loin near the renal angle and gradually radiates to the groin. Mid ureteric calculus, pain tends to radiate to the lateral flank and abdominal region. Distal ureteric calculus, pain tends to radiate into the groin and testicular in the male or labia majora in the female and to the intermedial aspect of thigh. Now, uretrovesicular junction calculus cause irritative Voiding symptom like mimicking cystitis such as urinary frequency and urgency. मूत्रश्मरी पूर्व रूप लक्षण पूर्व रूप ज्वर बस्ती पीड़ा हारोचक मूत्रकृश बस्ती शिर मुश्क शोफ वेदना बस्ती गंध मूत्र समान लक्षणम नाभि बस्ती सेवनी मेहन वेदना मूत्र संग सधुर मूत्रिता मूत्र विकरण गोमेद प्रकाश अवेल मूत्र प्रवृत्ति एंड सिक्ता में मूत्र प्रवृत्ति मूत्रधारा संग ऑब्स्ट्रक्शन सधुर मूत्रिता हिमेट्यूरिया नाभि बस्ती वेदना स्पेनिस एंड गोमेद प्रकाश अवेल मूत्र प्रवृत्ति स्टर्बिट एंड सिक्ता में मूत्र प्रवृत्ति संडी. Diagnosis with the help of urinary analysis, that is routine or microscopic. X-ray QV मतलब X-ray QV means kidney ureter bladder. Ultrasonography lower abdomen, intravenous pyelography and cystoscopy. Now plain X-ray QV show multiple stone in the right kidney, ultrasound abdomen and pelvis, and bilateral renal stone with the help of X-ray QB to identify radiolucent stone and changes in the renal pericula and hydronephrosis. And X-ray characteristics of the radio opaque stone is calcium oxalate dihydrate, calcium oxalate monohydrate, and calcium phosphate. And magnesium ammonium phosphate cysteine is poor radio opacity, and radiolucent is uric acid, xanthine, ammonium urate. Diagnostic study with the help of intravenous pyelography, kidney, renal, pelvis, and ureter with the help of IVP. साध्य सत्ता व चिकित्सा साध्य सत्ता आतंक समान घातक सुश्रुत चिकित्सा में इसका वर्णन है. तरुण अवस्था में औषध साध्य होता है, प्रवृद्ध अवस्था में शस्त्र कम करना पड़ता है. चिकित्सा सूत्र स्नेहन उत्तरबस्ती शस्त्रकर्म संसमन चिकित्सा. औषध चिकित्सा में वात जश्मरी में घृत पाषाण भेद उषक आदि गण सिद्ध करते. छार परपटी 250 mg अनुपान मधु देते हैं. चंद्र प्रभावटी 250 mg TDS सहचर तेल 20 से 40 बूंद देते हैं. पित्त जसमरी में पित्त हर औषध क्षीर एवं कषाय प्रयोग करते हैं. वीरत आदि क्वाद देते हैं. शुद्ध शिलाजतु देते हैं. गोक्षर आदि गुग्गुल देते हैं. शतवर्य आदि योग देते हैं. वीरत आदि क्वाद 15 ml TDS देते हैं. सामान्य जल के साथ शुद्ध शिलाजतु 250 ml TDS देते हैं. गोक्षर आदि गुग्गुल 5 mg TDS शतवर्य आदि योग. एंड कफ जसमरी में वरुणादि उषक आदि गण गोक्षर आदि गुग्गुल अपामार चंद्रभावटी स्वदृष्टा आदि क्वाद 15 ml TDS. शस्त्रकर्म में आक्रियायाम ध्रुव मृत्यु क्रियायाम संशय भवत तस्मात् ध्रुवपक्षा कर्तव्य शुरू साधुकाराणाम. सुश्रुत चिकित्सा 7/28 का श्लोक. सर्जिकल मैनेजमेंट ऑब्स्ट्रक्शन रिलीफ में यूरेथ्रिक स्टंट इंसर्शन डालते हैं. परक्यूटेनियस नेफ्रोस्टोमी करते हैं. डेफिनेट सर्जिकल ट्रीटमेंट में ESWL करते हैं. इलेक्ट्रोकार्पोलर शॉकवेव लिथोट्रिप्सी यूरेट्रोकोमी परक्यूटेनियस नेफ्रोलिथोटोमी एंड यूपन लेप्रोस्कोपिक एंड रोबोटिक पाइलोलिथोटोमी यूरेथ्रोलिथोटोमी सिस्टोलिथोटोमी. एंड indication for active stone removal. Stone with diameter exceeding 6 to 7 mm. Persistent pain despite adequate medication. Persistent obstruction with risk of impaired renal function. Stone with urinary tract infection. Risk of pyonephrosis or urosepsis. Bilateral obstruction obstructing calculus in the solitary functioning kidney. Path patient at 2 से 3 liter of water every day. Tender coconut meat is more useful. Consuming kulath.
Thank you, Dr. Ajay Kumar Pandey. Next is another paper presentation. I would like to invite Dr. Akash Kumar Chedilal Kewat for the paper and poster presentation. First is a paper presentation on the topic review study of Urdu Jatrugata Varma. And before that, we are going to the poster presentation of Dr. Akash Kumar. Just a moment, we will connect with that recording. The topic of poster presentation is upper limb or arm nerve. Upper limb or arm nerves.
Hello everyone, I am Dr. Akash Kumar Kewad, PG Scholar, Department of Sharir Rachna, Yashwant Ayurvedic College, Kodoli, Kolhapur. My guide's name is Dr. Avinash Vipra sir, Associate Professor, Department of Sharir Rachna, Yashwant Ayurvedic College. My HOD's name is Dr. Chhaya Patil ma'am, Department of HOD, Department of Sharir Rachna, Yashwant Ayurvedic College, Kodoli, Kolhapur. My poster presentation is of upper limb nerves. Introduction. The nerves found within the arm are terminal branches of the brachial plexus and serve to innervate muscles of the upper extremities and transmit sensory information to the higher processing centers of the brain. There are 5 muscles in the upper arm. First is musculocutaneous nerve, second is radial nerve, third is median nerve, fourth is axillary nerve, and fifth is ulnar nerve. Now aims and objectives to present this poster. To review the study of nerves of the upper limb. First is musculocutaneous nerve. The musculocutaneous nerve innervates the 3 muscles of the anterior compartment of the arm, the coracobrachialis, biceps brachii, and brachialis muscles. The root value of musculocutaneous nerve is ventral rami of C5, C6, C7 segments of spinal cord. Second is axillary nerve. The axillary nerve, also known as the circumflex nerve, is one of the 5 peripheral nerves that run through your shoulders. Root value of axillary nerve is ventral rami of C5, C6 segments of spinal cord. Third is radial nerve. The radial nerve helps to move your elbow, wrist, hand and fingers. It runs down the back of the arm from the armpit to the hand. The radial nerve is part of peripheral nervous system. The root value of radial nerve is ventral rami of C5, C6, C7, C8, T1 segments of spinal cord. Fourth is ulnar nerve. Ulnar nerve, also called as musician's nerve. Ulnar nerve is named so as it runs along the medial or ulnar side of the upper limb. The root value of ventral rami of C8, T1 segments of spinal cord. I have also explained in picture given side by side of each nerves. Fifth is median nerve. The median nerve, also called as laborer's nerve, it helps to move your forearm, wrist and fingers. It also provides sensation to the forearm and certain parts of the hand. Root value of median nerve is ventral rami of C5, C6, C7, C8 and T1 segments of spinal cord. Now coming to the conclusion. The arm is the region of the upper extremities extending between the shoulder and the elbow joints. The nerves found within the arm and terminal arches of the brachial plexus and serve to innervate muscles of upper extremities and send sensory information to the higher processing centers of the brain. This will let the reader to gain a greater understanding of the main anatomical regions of the upper limb. Thank you.
Thank you, Dr. Akash Kumar Kewad, for the poster presentation. And next we go to the paper presentation. Before that, thank you for all participants to support this program, and thank you for all panel members. And next is a poster presentation. Dr. Ravindra Kumar is there? Is the Ravindra Kumar, Dr. Ravindra Kumar is there? Dr. Nishikanda Suresh Patil is there? Dr. Nishikanda Suresh Patil is there? Okay. Next is the paper presentation of Dr. Akash Kumar Kewat on the topic review study of Urdu Jatrugada Marma.
Hello everyone, I am Dr. Akash Kumar Kewat. I am going to present a review study of Urdu Jatrugat Marm. My guide's name is Dr. Avinash Vipra sir, Department of Anatomy, Yashwant Ayurvedic College, Kodoli, Kolhapur, and my HOD is Dr. Chaya Patil ma'am, Professor and HOD of Department, Yashwant Ayurvedic College, Kolhapur. Introduction. The word marm is derived from the mri dhatu plus manin pratyay, which causes death, jivsthan, sandhisthan. The marm science is one of the exclusive concepts of Ayurveda. Marms are the site of pran and these are spread all over the body, that is head, neck, trunk and extremities. These are formed by a confluence of 5 important elements or structures like mans, sira, snayu, asthi and sandhi. Injury to these areas causes aggravation of doshas which destroy mind, body and finally results death. Marmas are very important from traumatological point of view. Any trauma at this point causes death or pain or equivalent to pain of death. Marm classification. Classification of marm based on location. First is Shakhagat marm, second is Ura Udar marm, third is Prusht marm, fourth is Urdu Jatrugat marm. Shakhagat marm, now 11 in each extremities, that is 44 in all total all extremities. Ura Udar marm is 12 in number, Prusht marm is 14 in number and Urdu Jatrugat marm is 37 in number, total 107. Now Urdu Jatrugat marm, that is marm of head and neck. There are total of 37 marm scattered over the head and neck. Name of marm, that is Griva marm, marm of neck, 14 in number. Siragat marm, marm of head, 23 in number. Marm of neck, Dhamniyan, Nila 2, Manya 2, located in the neck on each side lateral to Matruka, 4. Matrakayan or Kant Sira marm, located in the neck, 4 on each side of neck on the side of trachea, total 8. Krukatika marm, located at the site of junction of head and neck or base of the skull bone, that is occipital protuberance on both sides, 2 in number. Here are the pictures explaining the marm of neck. Marm of head, Vidhur marm, located posterior inferior to the ear, 1 on each side, 2 in number. Fern marm, located in the saddle or roof of nose on the olfactory tract on both sides, 2 in number. Apang marm, located on the lateral angle of eye on both sides, that is outer canthus, 2 in number. Avart marm, located just above the lateral part of eyebrow on both sides, 2 in number. Utshape, located at the level of hairline of scalp above temporal region, 1 on each side, 2 in numbers. Shankh marm, located between the ear and forehead, 2 in number. Here are the pictures explaining all the marm points of head. Stapani marm located in between the two eyebrows, 1 in number. Simant sutural joint present over the skull, 5 in number. Shrungatak, it is situated inside the skull at the lateral aspect of body of sphenoid bone, where cavernous sinus is situated that nourishes the sense organs, that is nose, ear, eye and tongue, and it is 4 in number. Adipatti, located at the superior or top part of intracranial portion where superior sagittal sinus, straight sinus, occipital sinus and transverse sinus meets. It is 1 in number. Now classification of MRM based on the effect of injury. Depending upon the effect of injury, MRM are classified into 5 types. They are Sadhya Pranhar MRM. Injury to this MRM causes immediate death. Second is Kalantar Pranhar MRM. Injury to this MRM leads to gradual death. Vaikalyakar MRM. Injury leads to deformity. Fourth is Vishalyagna MRM. These MRMs are fatal after removal of foreign body. And fifth is Rujakar MRM. Injury to this MRM leads to pain. Classification of MRM based on composition. These MRMs are formed by conglomeration of 5 important structures like Mans, Sira, Snayu, Asthi and Sandhi, and they are categorized by the name depending upon the predominant structure present in that MRM. Now classification of MRM based on composition. First is Sira MRM, second is Snayu MRM, third is Asthi MRM, fourth is Sandhi MRM. Now I will explain Sira MRM. It is Neela 2 in number, Manya 2 in number, Matruka 8 in number, Shrungatak 4 in number, Apang 2 in number, Sthapani 1 in number and Fund MRM 1 in number. Now Snayu MRM, its example is Vidur MRM, that is 2 in number, Asthi MRM, Shamkha 2, Sandhi MRM, Simant 5, Adipatti 1, Avart 2, Krukatika 2. Now classification of MRM on the basis of measurement. 4 Angulman MRM, these are Nabhi 1 in number, Simant 5 in number, Shrungatak 4 in number, Matruka 8 in number, Neela 2 in number and Manya 2 in number. Half Anguliman MRM, these are Adipatti 1, Shankh 2, Utshep 2 in number, Sthapani 1 in number, Vidur 2, Krukatika 2, Apang 2, Fund 2, Avart 2 in number. Conclusion. MRM science is one of the important parts of Ayurveda. MRM points are spread all over the body. The knowledge of MRM is very essential for a surgeon because any mistake in surgical procedure may cause various complications or death of the patient. MRM therapy is a significant aspect of Ayurvedic treatment. It removes blockage from MRM point and a light stimulation of these points produce flow of vital energy or pran. These are the references I have taken. Thank you.
Thank you, doctor. And we are come up to the end of today's session. I would like to invite Dr. Aishwarya Aras to conclude the session. Hello, Dr. Aishwarya.
Thank you, Dr. Sabin. So, dear all, we successfully completed our second day of Prithvika's national level paper and poster presentation presented by Team Ayurveda. At this moment, I take this opportunity to thank our respected faculties for being here with us from the beginning. And I congratulate all the participants for their active participation. Congratulations all. So there will be one more session tomorrow